A very good morning to one and all present here to the second day of the 3 days national workshop on localization of sustainable development goals in Gram Panchayats through adopting thematic approaches, theme 2, Healthy Village. So before we begin on to today's program, I would like all of you to do the recap of the day one. The day one began with the arrival of the dignitaries, followed by the lamplighting ceremony and the national integration song. There was a short video on theme 2, that is Healthy Panchayat, which was prepared by the Ministry of Panchayati Raj. The welcome address and journey of Andhra Pradesh on theme 2, Healthy Gram Panchayat, was delivered by Shri B. Rajshekhar Sir, Special Chief Secretary, Department of Panchayati Raj and Rural Development, Government of Andhra Pradesh, followed by Dr. C.S. Kumar, Additional Secretary, Ministry of Panchayati Raj, Government of India's insights about ensuring health and well-being for all at all ages through availability, accessibility, affordability, and appropriate healthcare services, followed by Shri Vivek Bharadwaji, Secretary, Ministry of Panchayati Raj, Government of India's address on policy formulation to institutionalize theme 2, Healthy Village, followed by the video on theme 2, Healthy Village, which was prepared by the Government of Andhra Pradesh. Then there was the keynote address by Shri Buddhi Mutiala Naidu, Deputy Chief Minister and Honorable Minister for Panchayati Raj and Rural Development, Government of Andhra Pradesh, and followed by the keynote address by the Honorable Chief Guest, Shri Kapil Mureshwar Patilji, Honorable Union Minister of State for Panchayati Raj, followed by the felicitation of dignitaries by the Department of Panchayati Raj and Rural Development, Andhra Pradesh, and then there was the national anthem by the police band. After the vote of thanks by Srimati A. Surya Kumari ji. Then we began, after the tea break, with the panel discussion 1 on showcasing of best practices of national award-winning Gram Panchayats, which was chaired by Shri S.M. Vijayanand, Ex-Secretary, Ministry of Panchayati Raj, Government of India, co-chaired by Shri Dheeraj Shahji from National Institute for Health and Family Welfare. And the speakers were from Gram Panchayat, Kadanal, Block Bejnath, District Kangana, Himachal Pradesh, Gram Panchayat Sankara, Block Nagari, District Dhamtari, Gram Panchayat Dhupartari, Block Bezera, District Kamrup, Assam, Gram Panchayat Mariapuram, Block Gisugonda, District Warangal, Telangana. And then there was the video on Gram Panchayat Maniachivadi, Taluka Patan, District Satara, Maharashtra. And then the concluding of the panel 1 was done by Shri S.M. Vijayanand, the chair of the panel, followed by the felicitation of the dignitaries by the Department of Panchayati Raj and Rural Development, Government of Andhra Pradesh. Thereafter, you all people were divided into various groups and the topics were distributed to you. And you were supposed to be there at your respective venues for the group discussion, which lasted for about 45 minutes. The theme for Group 1 was Role of Gram Panchayat in Preventive Measures of Communicable and Non-Communicable Disease. The theme for Group 2 was Availability and Accessibility of Quality Healthcare Services. Theme for Group 3 was Addressing Issues of the Malnutrition for Women, Children and Adolescents. Theme for Group 4 was Palliative Care for Elderly and People with Special Needs. Group 5's theme was Role of Gram Panchayats in Combating Lifestyle Disease like hypertension, diabetes, asthma, etc. The theme for Group 6 was Prevention and Treatment of Substance Abuse, including narcotic drugs abuse, harmful use of alcohol and tobacco. The theme for Group 7 was Sexual and Reproductive Healthcare Services and Family Planning. And thereafter, instructing you all about the theme and all, we people had gone for a lunch break, and then there was a group discussion of all the groups. and the PPT format was also shared with you people. Thereafter at 3:30 p.m. we all reassembled at this auditorium again, where we proceeded with the panel discussion 2 on health issues at the grassroots by the domain experts of Ministry of Panchayati Raj. This session was chaired by Dr. C.S. Kumar, Additional Secretary, Ministry of Panchayati Raj. Composition of the panel were the NGOs and the other organizations. And this was also chaired by Shri B. Rajshekharji, the Special Chief Secretary, Department of Rural Development and Panchayati Raj, Government of Andhra Pradesh. And the organizations which participated in this panel discussions were Japaigo, TRIF, Nimhans, and thereafter Shri Vikas Anandji, Joint Secretary, Ministry of Panchayati Raj, Government of India, highlighted about the PDI framework for healthy village. The summing of the panel discussion 2 was done by Dr. C.S. Kumar, Additional Secretary, Ministry of Panchayati Raj, and of course Shri B. Rajshekharji as well gave his insights upon the same. Simultaneously, we had the translator, the Additional Commissioner Panchayati Raj, Dr. M. Sudhakar Rao, who after every session was translating the spoken words and all in Telugu language, which really made the audience of diverse background to understand the entire things which was being disseminated in English or Hindi language. Thereafter, it was the felicitation by the Panchayati Raj and Rural Development Government of Andhra Pradesh, followed by tea and refreshment. And thereafter, the catch was the amazing cultural evening program, which started around 7 o'clock in the evening and lasted late till night, followed by the dinner. And through this cultural evening program, we came to know about the rich culture and heritage of Andhra Pradesh. Not only the musical instruments were played so well, but they were the young girls from the university who also performed mime, and as well as the way Goddess Lakshmi is worshipped. So this act was presented via dance performance, and the name of this was Ashta Lakshmi Strota. Well, people, today is day 2 of the 3 days national workshop on theme number 2, that is Healthy Village. And this will begin with the panel discussion number 3, where Shri B. Rajshekhar Sir, Special Chief Secretary, RD and PR, Government of Andhra Pradesh, will be chairing the session. And I request all of you meanwhile to kindly be seated. आप सभी से विनम्र अनुरोध है, कृपया अपना स्थान ग्रहण करेंगे और कुछ ही समय में हमारे बीच में उपस्थित होंगे श्री बी राजशेखर जी, जो कि स्पेशल चीफ सेक्रेटरी हैं रूरल डेवलपमेंट एंड पंचायती राज गवर्नमेंट ऑफ आंध्र प्रदेश से, and respected chief secretary sir will also be present. Dr. K.S. Jawahar Reddy sir is the chief secretary government of Andhra Pradesh. He will be soon here at the venue. Then thereafter there will be healthy village video presentation of PR and RD, Commissioner Health and Family Welfare, Women, Children, Disabled and Senior Citizen, followed by UNICEF, and there will be 3 sarpanches as well in this panel discussion. People, we all in this workshop have realized that the 17 SDGs are very, very essential for all of us, including the 9 themes. The 17 SDGs are integrated and they recognize that action in one area will affect outcomes in the others, and that development must balance the social, economic and environmental sustainability. सतत विकास लक्ष्यों को अपनाने का फैसला हम सभी जानते हैं कि संयुक्त राष्ट्र शिखर सम्मेलन में लिया गया था। इस संबंध में महासभा की बैठक न्यूयॉर्क में 25 से 27 सितंबर 2015 में आयोजित की गई थी और इसी बैठक में अगले 15 साल के लिए 17 लक्ष्य तय किए गए थे, जिनको 2016 से 2030 की अवधि में हासिल करने का निर्णय लिया गया था और इस बैठक में 193 देशों ने भाग लिया था। अब एसडीजी का स्थानीयकरण क्यों महत्वपूर्ण है, ये हमें समझने की आवश्यकता है कि एसडीजी सार्वभौमिक है, विश्व स्तर पर लागू किया जा रहा है और एसडीजी 2030 तक या उससे पहले हासिल होने की उम्मीद है। सभी से अनुरोध है, जो लोग पीछे बैठे हैं वो लोग आगे बैठने की कृपा करें। I request all those people who are sitting at the back to kindly come forward and take the front seats, please. The last 4-5 rows, please come forward and take the front seats, please.
దయచేసి కొంచెం వెనక కూర్చున్న వాళ్ళంతా ముందుకు రావాల్సిందిగా కోరుతున్నాను. స్పెషల్ సిఎస్ గారు, అదేవిధంగా మినిస్ట్రీ ఆఫ్ పంచాయత్ రాజ్ నుంచి జాయింట్ సెక్రటరీస్ వాళ్ళందరూ కూడా వచ్చే ఆల్రెడీ మనకి హాల్ బయట ఉన్నారు. దయచేసి వెనకున్న వాళ్ళు అందరూ కొంచెం ముందుకు వస్తే బాగుంటుంది. సో మిగిలిన వాళ్ళు కూడా ఈజీగా వెళ్ళి సీట్స్ ఆక్యుపై చేసుకోవడానికి వీలుగా ఉంటుంది కాబట్టి దయచేసి అందరూ ముందుకు వచ్చి కూర్చోవాల్సిందిగా కోరుతున్నాను. థ్యాంక్ యూ మ్యామ్. సారీ.
पंचायती राज में एसडीजी के स्थानीयकरण की आवश्यकता क्यों पड़ी? एसडीजी गरीबी उन्मूलन, खाद्य सुरक्षा, स्वास्थ्य एवं शिक्षा, लैंगिक समानता, पानी और स्वच्छता एवं रोजगार आदि पर जोर देने के लिए ग्रामीण विकास के अभिन्न लक्ष्यों से जुड़े रहते हैं। ग्राम, ब्लॉक, जिला पंचायत के स्तर की योजना का उद्देश्य भागीदारी को बढ़ावा देना है। अगर हम लक्ष्य 1 की बात करें तो लक्ष्य 1 है गरीबी की पूर्णतः समाप्ति, यानी पूरी तरीके से गरीबी को खत्म करना, नो पॉवर्टी एट ऑल, टू फोकस ऑन इरेडिकेटिंग एक्सट्रीम पॉवर्टी, ensuring equal access to resources and providing social protection systems for the poor and vulnerable. दुनिया के हर देश में सभी लोगों की अत्यधिक गरीबी को समाप्त करना इस लक्ष्य का उद्देश्य है। दूसरा लक्ष्य है भूखमरी की समाप्ति, जीरो हंगर, एंड हंगर, अचीव फूड सिक्योरिटी, improve nutrition and promote sustainable agriculture. This objective, this goal aims to eliminate hunger, ensure access to safe and nutritious food, and promote sustainable farming practices. भुखमरी की समाप्ति, खाद्य सुरक्षा और बेहतर पोषण और टिकाऊ कृषि को बढ़ावा देना इस लक्ष्य का उद्देश्य है। Talking about the Sustainable Development Goal number 3, गुड हेल्थ एंड वेल बीइंग, यानी अच्छा स्वास्थ्य और बेहतर जीवन स्तर। दिस गोल इंश्योर्स हेल्दी लाइव्स एंड प्रमोट्स वेल बीइंग फॉर ऑल एट ऑल एजेस, targets improving maternal and child health, addressing major diseases and strengthening healthcare systems। यानी कि सभी को स्वस्थ जीवन देना और सभी के जीवन स्तर में सुधार लाना इस लक्ष्य का उद्देश्य है। वहीं 17 में से लक्ष्य नंबर 4 की यदि बात करें तो वो है गुणवत्तापूर्ण शिक्षा, यानी समावेशी और न्याय संगत गुणवत्तापूर्ण शिक्षा सुनिश्चित करना और सभी के लिए आजीवन सीखने के अवसरों को बढ़ावा देना। क्वालिटी एजुकेशन, ensuring the inclusive and equitable quality education and promoting lifelong learning opportunities for all. Focus on providing access to quality education, reducing disparities and promoting skills development। सतत विकास लक्ष्य का लक्ष्य नंबर 5 यानी गोल नंबर 5 है जेंडर इक्वालिटी, यानी लैंगिक समानता। लैंगिक समानता प्राप्त करना और सभी महिलाओं और लड़कियों को सशक्त बनाने के लिए प्रयास करना। So the goal number 5 states focuses on achieving gender equality and empowering all women and girls. It aims to eliminate discrimination, violence and harmful practices, ensures equal opportunities in education, employment and decision making।
Then I'll announce it.
I request all of you sitting at the back to kindly come forward and take the front seats, please। जितने भी लोग पीछे बैठे हैं, आप लोग प्लीज अपनी जगह से खड़े होकर आप आगे आने का कष्ट करें। All the ones sitting at the back, सभी से अनुरोध है आप लोग आगे आ जाइए, because very soon we are beginning with our day 2 conference। I request all of you sitting at the back। Meanwhile जो लेट आएंगे वो पीछे अपना स्थान ग्रहण करेंगे, आप लोग आगे आ जाइए प्लीज। Thank you so much। Ladies and gentlemen sitting at the back, please come forward। Front rows towards my left, all the front seats are empty। Please can you all make it fast?
దయచేసి మధ్య సీట్లు వెనక సీట్లో కూర్చున్న వాళ్ళంతా ముందుకు రావాల్సిందిగా కోరుతున్నాను। వెనక వచ్చిన వాళ్ళు అంటే లాస్ట్లో వచ్చిన వాళ్ళు వెనక రోజు ఆక్యుపై చేస్తారు, దయచేసి మీరు లేవండి। అమ్మ మీరంతా ఇప్పుడు వెళ్తున్నారు, ముందుకు రండి। మీరు వెనకున్న వాళ్ళు మధ్య రోజులో ఉన్నారు కూడా కొంచెం ముందుకు రండి। లెఫ్ట్ సైడ్ అంతా ఖాళీగా ఉన్నాయి, ఇక్కడ కూర్చోండి దయచేసి। మళ్ళీ అందరికీ రిక్వెస్ట్ చేస్తున్నాను, కొంచెం ముందుకు రండి అందరూ। Those who are seated on my left, please do come forward। దయచేసి ఇటుపక్క లెఫ్ట్ సైడ్ కూడా ఆ మధ్యలో కూర్చున్న వాళ్ళు ముందుకు రావాల్సిందిగా కోరుతున్నాను। కంటిన్యూ।
इस 3 दिवसीय राष्ट्रीय स्तरीय कार्यशाला में हमें उम्मीद है कि आपने इस राष्ट्रीय कार्यशाला के प्रथम दिवस में भी काफ़ी कुछ सीखा होगा, काफ़ी कुछ देखा होगा। बेस्ट प्रैक्टिसेस की यहाँ पे बात हुई, किस प्रकार से अन्य राज्य काम कर रहे हैं और किस प्रकार से आंध्र प्रदेश की ग्राम पंचायतें सशक्त हैं। वो बेस्ट प्रैक्टिसेस के माध्यम से, वीडियो के माध्यम से और प्रेजेंटेशन के माध्यम से हम सभी को कल देखने को मिला। और आज भी ये कार्यशाला का द्वितीय दिवस है और मुझे उम्मीद है कि आज भी आपको हमारे जितने भी एपिटोम ऑफ नॉलेज यहाँ पे उपस्थित हैं, जो डिग्निटरीज हमारे बीच में उपस्थित होंगे, उनके माध्यम से हमको काफ़ी बेहतर मार्गदर्शन मिलेगा और किस प्रकार से आप लोग जो जनप्रतिनिधि हैं अपनी पंचायतों में किस प्रकार से चीज़ों को रेप्लिकेट कर सकते हैं, वो आपको यहाँ से काफ़ी कुछ सीखने को मिलेगा। हम जब 9 थीम्स की बात करते हैं, उससे पहले ज़रूरी है कि हम सतत विकास लक्ष्यों को बेहतरीन से जान लें, और उसी में से जो 9 थीम्स निकाली गई हैं जो कि ग्राम पंचायत स्तर पर पूर्ण की जानी है, उसमें आप किस प्रकार से योगदान दे सकते हैं वो आप बेहतरीन से और समझ पाएंगे। लक्ष्य नंबर 6 की यदि बात करें, यानी कि गोल नंबर 6, ये है साफ पानी और स्वच्छता, यानी कि सभी के लिए स्वच्छ पानी और स्वच्छता उपलब्धता और उसका टिकाऊ प्रबंधन को सुनिश्चित करना। Clean water and sanitation ensures availability and sustainable management of water and sanitation for all. Targets include achieving universal access to clean water, improving water quality, and ensuring proper sanitation facilities. लक्ष्य नंबर 7 की बात करें तो यह है सस्ती और स्वच्छ ऊर्जा, affordable and clean energy. And this goal focuses on ensuring access to affordable, reliable, sustainable, and modern energy for all. And this also promotes the use of renewable energy sources, increasing energy efficiency, and ensuring universal access to electricity. यानी कि सभी के लिए सस्ती, भरोसेमंद, टिकाऊ और आधुनिक ऊर्जा की पहुंच को सुनिश्चित करना। सभी से अनुरोध करूंगी कि आप शीघ्र अतिशीघ्र स्थान ग्रहण करने की कृपा करें, ताकि समय पर हम द्वितीय दिवस की कार्यशाला को आरंभ कर पाएं और निश्चित समय पर आप कार्यशाला से फ्री हो पाए। आई रिक्वेस्ट ऑल ऑफ यू टू काइंडली बी सीटेड एट द अर्लीस्ट। लक्ष्य नंबर 8 की यदि बात करें तो यह है डिसेंट वर्क एंड इकोनॉमिक ग्रोथ, अच्छा काम और आर्थिक विकास। निरंतर समावेशी और टिकाऊ आर्थिक विकास को बढ़ावा देने के साथ साथ उत्पादक रोजगार और सभी के लिए सभ्य कार्य को बढ़ावा देना। This promotes sustained, inclusive and sustainable economic growth, full and productive employment and decent work for all, aims to create jobs, support entrepreneurship and ensure fair and inclusive economic growth. लक्ष्य नंबर 9 की यदि बात करें तो यह है उद्योग नवाचार और बुनियादी ढांचा का विकास, यानी कि मजबूत और बुनियादी ढांचा बनाना, समावेशी और टिकाऊ औद्योगिकरण को प्रोत्साहित करना और नवाचार को बढ़ावा देना। To build resilient infrastructure to promote inclusive and sustainable industrialization and foster innovation. Targets include developing quality infrastructure, supporting technological advancements, and promoting innovation for sustainable development. बस कुछ ही समय में हम आज के द्वितीय दिवस की कार्यशाला को औपचारिक रूप से आरंभ करेंगे। सभी से विनम्र अनुरोध है, कृपया अपने फोन्स को आप साइलेंट मोड में या स्विच ऑफ मोड में रख दें। I request you all to kindly keep your phones either on silent mode or on switch off mode, please. और सभी से इस कार्यक्रम मैं चाहूंगी कि हम लोग सभी इस कार्यक्रम की गरिमा को समझते हुए अपना पूर्ण योगदान देंगे। And I request all of you to kindly be seated. वही लक्ष्य नंबर 10 की यदि बात करें तो इसका उद्देश्य है असमानता में कमी लाना, देशों के भीतर और देशों के बीच असमानता को कम करना, to reduce inequality within and among the countries, among nations, focus on addressing income inequality, social discrimination, and promoting policies that empower marginalized and vulnerable populations. लक्ष्य नंबर 11 की यदि बात करें तो इंडस्ट्री, इनोवेशन एंड इंफ्रास्ट्रक्चर, यानी शहरों और मानव बस्तियों को समावेशी, सुरक्षित, लचीला और टिकाऊ बनाना, टिकाऊ शहरी और सामुदायिक विकास लाना, to make cities and human settlements inclusive, safe, resilient and sustainable, aims to ensure access to safe and affordable housing, improve urban planning, and promote sustainable development in cities. So, ladies and gentlemen, can we all give a huge round of applause for our eminent dignitaries on dais, please? We have the respected Chief Secretary to the Government PR and RD Department. We have the Chief Secretary, Government of Andhra Pradesh, Dr. K.S. Jawahar Reddy with us. A huge round of applause for him. We have Shri B. Rajshekhar, the Special Chief Secretary, RD and PR, Government of Andhra Pradesh. We have So, ladies and gentlemen, I welcome you all to the day 2 of the 3 days national workshop on theme 2, that is Healthy Village. And we have on dais the Special Secretary, Shri B. Rajshekhar ji, RD and PR, Government of Andhra Pradesh. We have Dr. K.S. Jawahar Reddy, Chief Secretary, Government of Andhra Pradesh. We have the Commissioner from Mr. J. Nivas, Commissioner Health, who would be giving a video presentation on Healthy Village. Can we all give a huge round of applause for the dignitaries on dais, please? We have Mrs. Vasant Balaji from Women and Child Development. We have the representative from UNICEF. I request Madam to kindly come on the dais, please. We have Ms. Salima from UNICEF. Kindly come on the dais, please. Can we give a huge round of applause once again for the eminent dignitaries on dais? And ladies and gentlemen, we also have Dr. C.S. Kumar, Additional Secretary, Ministry of Panchayati Raj, Government of India, with us on the dais. A huge round of applause once again for the dignitaries on dais. And moving further, I would like to invite Dr. K.S. Jawahar Reddy, the Chief Secretary, Government of Andhra Pradesh, to kindly express his views. So at the onset for the keynote address, I would like to invite Dr. K.S. Jawahar Reddy, sir, Chief Secretary, Government of Andhra Pradesh, for his keynote address. May we all give a huge round of applause to Dr. K.S. Jawahar Reddy, sir.
Good morning, friends. My dear friend Vivek, my colleague Rajshekhar and other dignitaries on the dais. I was supposed to be here yesterday because of some contingency. I couldn't come yesterday. I think I am qualified to speak on this topic because of two reasons. One is I was Principal Secretary Panchayat Raj and Rural Development for 5 years. So I think I have that background, and I was also Health Secretary during the first wave of COVID. So with these two qualifications, when my good friend Vivek and myself, we are batchmates. So when he said that we are organizing in Tirupati, I said, okay, I would like to come and participate. I have to catch a flight at 11, so I will not be here for too long. So 10 minutes I will speak. We are talking about the healthy village. So the two determinants of the health which we are already addressing as a nation the drinking water and the sanitation. So if you look at these two programs, sanitation we address first in the form of Swachh Bharat Abhiyan. So now we have built a large number of toilets, individual household toilets in the entire country. All villages, most of the districts have been declared as open defecation free. And we are now in the ODF plus. The ODF plus activities are solid and liquid waste management. Solid waste management we used to call as solid wealth management, because all of them can be converted into some useful thing. So there are, I think, 10 to 12 different items. I am sure my colleagues, they will be making that presentation. How does the solid wealth, the waste can be generated into wealth, and then the villages can be kept clean. But the one challenge remains the legacy waste. So we are trying to now address in the urban areas, but an issue is there in the rural areas. We need to find a solution. It can be done. Once we find a solution on a day-to-day collection of the solid waste, so we have a solution for the legacy waste also. We have most of it all plastics. All of these dumps welcome you as soon as they enter a village. So those legacy waste can be handled, and we try to do little bit. In fact, my colleagues are there, additional commissioners. So they all worked very hard on the solid wealth creation. We have created sheds in most of the villages. So all that we need to do is have some system of collection and then take it to that spot and then see that they have been segregated. Once you segregate, there is a value. There is iron pieces, the glass pieces, and the decomposable waste. So all these things are there, they can be easily handled. Coming to liquid waste. The liquid waste, the best would be where the village is small. You will have these individual household soak pits rather than going for a drainage line, open drainage. Open drainage, most of villages, our experience that we have a challenge in maintenance, especially the uncovered ones. The covered ones is better. But there are some sarpanches who try to do an underground drainage in the village. It is only the grey water, not the black water, because we have got the toilets. The black water gets into the individual household toilet. But the grey water consisting of the kitchen water and the washroom water, bathroom water, it's called grey water. So it can be managed through underground drainage. Very simple technology. There are some models. We tried. In fact, I picked up this model from a sarpanch. Myself, I was MD Water Board Hyderabad in the combined state. But there it's a mixing of both grey and black water. It's a huge challenge. But the handling grey water through a subsurface cement pipes is achievable, but some discipline on the part of the community is required, so that nothing gets into that drainage. We tried in few villages. It is successful. A model is there. We can think about that. So I'll stop. Then the next is drinking water. So now we have got the Jal Jeevan mission. So now the functional household tap connection, FHTC, it's being given. So it's more or less in next couple of years, I think the saturation we can achieve. That's a huge relief, because recently we had a Chief Secretary's conference on ease of living. The theme is ease of living. So there, the SBM and the JJM has really lifted the life of lot of people. It has enhanced their honor, and the women are now not required to go miles and miles to fetch water. So they have a decent toilet, so they don't have to go out for this thing. So the ease of living and the JJM, through JJM and SBM we were able to achieve. But one challenge remains in this rural water supply, ensuring the disinfection through chlorination. The chlorination, few challenges are there. We tried some model. In fact, we presented that in the Chief Secretary's conference also. This is inline chlorination or online chlorination. Simple technique. I am sure Rajashekar would be talking about it. Why it is important means, according to Nobel laureate Michael Kremer, that chlorination alone can reduce under 5 children mortality by 30%. So there are studies to that effect. So this is an important point. Having water is one aspect, but giving a disinfectant, potable water is a challenge. So this simple technique can ensure that this inline chlorination is not a very great technique involved. It is a simple technology. Your village level pump operator can do, a village level plumber can do this little bit of change in your pipeline network. So these two things on the health and drinking water and sanitation. Moving on to health per se, especially the preventive health. In Andhra Pradesh, I am sure yesterday that topic would have come. We have established a new administrative structure in the village. It is called Village Secretariat. In Telugu, we can call it as a Gram Sachivalayam. We have given, when I was Panchayat Secretary, I was thinking that one secretary for a group of villages is not sufficient. At least I should have 3-4 functionaries in the Panchayat. Now we have got 10 functionaries in a village secretariat for every 2,000 population. It is not coterminous with panchayats. If the bigger panchayats have got 3-4 village secretariats, but one village secretary is, there is a small panchayat, it is catering 2-3 smaller panchayats. But I think over a period of time, we should really fix the size of the panchayat also. It is too skewed. So there should be some norm, national norm, with some range, 2,000 to 5,000 or 3,000. Some norm is required, otherwise, once it gets into politics, they declare tandas as panchayats, and then there's all kinds of things happen. So we should have a decent size for panchayat. So if you have a village secretariat or Gram Sachivalay, and then along with that, I mentioned about 10 staff. So one of them would be your engineering assistant, which can take care of the drinking water schemes and these small engineering works. But we also created another structure for village. It's called, those of you from north, we talk about this Arogya Mandir under Ayushman Bharat. So we are calling locally village health clinics. Village health clinic, making a health functionary available to the household level, is a very, very crucial in terms of preventive health. Because most of the challenges or the health problems, what starts as a small health issue, if not attended, will result in a severe complication requiring a tertiary care. And it also reduces the presence of a health functionary and a qualified nursing graduate will definitely reduce the out-of-pocket expenditure of people going out of the village for getting the medical attention. So we have got village health clinic, which is manned by a ANM and a CHO, community health officer, who is a BSc nursing student. And there are facilities for conducting 14 different tests, and there is a medicine availability of more than 100. All essential medicines required at the primary care, and all of them are connected with a teleconsultation by a telehub located in the district medical college. So there are good consultations that's happening. In fact, by the way, we have connected all panchayats through fiber optic line, Vivek. I think IP, the first state, we have connected all Gram Panchayats. So now I can have a video conference facility also for the village panchayats. So this CHO and the ANM, and they are doing, in fact, we have screened the entire population because we are all fresh in our memory about the COVID. The COVID, if you look at the number of deaths that have happened during the first or second wave, whatever that is, if it is X is the number, by way of non-communicable diseases, whether it is diabetes, hypertension, or cardiac problems, the number of death that happens is 10x. X is this number, I think almost 10x is the number that deaths happen because of the NCDs. So NCD, if detected early, put on a proper medication, I think we can avoid a lot of stress on the tertiary care. So we have screened the entire population with the help of this village health clinic, and we also have a family doctor visiting this also twice a month, all villages. I think my colleague would be explaining about the family doctor. So with this we have screened the entire population. We have almost done the confirmatory tests. We know how many cases of diabetes are there, hypertension are there, and in each village we know the details, and we have put them on medication. And we are also monitoring their progress. So this health intervention at the village level, we need to have a structure there, and we need to have the presence of these health functionaries, and then this would be communicating or coordinating. They should be working with this village community on a 24/7 basis. Then only we can really achieve on this good progress on this, both communicable as well as non-communicable. And I forgot to mention, there is also in the part of village secretariat, there is one volunteer for 50 households. He will take care of 50 households, 50 houses. And these volunteers really helped us during the COVID. Because whenever we wanted to check any outsider has come, because initial stage of the COVID, we were worried about those who came from foreign, who were carrying the virus. So we were analyzing who are the foreign returns. And there was some problem in Delhi. And a lot of people came all over the country from Delhi, Tablis or some convocation. And we were tracking who are the people who came from Delhi. And then when we wanted to do fever survey, again the A&M village level and the volunteers really helped us in conducting this and supplying the kits from home for home isolation cases also. These village functionaries were of great help. So there is a strong need to have a village level health institution. It can be a panchayat level or a habitation level if it is a bigger size. So Andhra has shown this model. It is a little costly, but I think we need to spend decent percentage of our budget or GDP on health and education. Moving on to this one, your themes. I think I am learnt, Vivek, that Ministry of Panchayat Raj is working on localizing the SDGs. You have identified 17 SDGs and then working on 9 themes. I'll just make one small this thing on the healthy village. Theme 2 is the healthy village. Next slide, Babu. Yeah. I'll just show. We monitor 8 high priority indicators on the SDGs. This slide talks about 4 pertaining to health and the 4 pertaining to education. See, for us to achieve these SDGs, at the SDG is a global Sustainable Development Goal as UN declaration. So we have got national level indicators, we have got the state level indicators, district level, mandal level. So up to mandal level or block level, it can be numbers. But when you go to panchayat, numbers are to be substituted with names. That is the biggest problem. So if you have numbers converted into names, then we have our task cut out. So we have been harping on this issue. We have been driving the district administration for last 2.5 years to 3 years, so that we know for these 4 indicators, there we are showing anemic in the 15 to 49 age group, and the adolescent girls, and the stunting as well as underweight. These 4 I am taking because of the context of the healthy village. So these 4 topics, these 4 indicators, we have got the names at the panchayat level, at the village level. Our village health functionaries, including the Anganwadi and our own A&M and the CHO, they have got the names. And our village level other functionaries also have got the names. So we in fact screened all the pregnant women and 15 to 49 age group, wherever at least they are in the pregnancy. So all interventions that are there, iron, folic acid, sucrose, iron sucrose injections, and for the girls, we have got this portion of yarn, midday meal, then special supplementation through Chekki. Rashekar will talk about the ragi java also that we are supplying, the chikki that we are giving. So then we are tracking. So I am happy to show that if you see, we were at 53.7 somewhere in 1920. So today, in last December, we have achieved these pregnant women something like around 25. Similarly, the girls, again at 60%, we have come down to 51. The target is 14.2. So there we need to really address. And the percent of children under 5. So from 29.6 we have come to 4.2. Children under 5 years who are stunted. So from 31 we have come around 7. So if you go to any village, our functionaries can show who are these number in that village and what are the interventions. So that much of understanding is there. And this understanding, if we can give it to the Panchayat Raj elected representatives, we are educating all of them. If all these elected representatives and also the women's self-help groups and the teaching community in the village and our health functionaries and secretariat staff, if all of them are aligned to these numbers and the interventions, I am sure we will be able to achieve the healthy village. I stop at this. Thank you very much.
Thank you so much, sir. Dr. K.S. Jawahar Reddy, sir, respected Chief Secretary, Government of Andhra Pradesh, for your impactful keynote address. Now moving ahead, I would request Shri Vivek Bhardwaj, the Secretary, Ministry of Panchayati Raj, Government of India, to kindly felicitate Dr. K.S. Jawahar Reddy, sir, Chief Secretary, Government of Andhra Pradesh. A huge round of applause. Thank you so much, sir, for taking out your valuable time for all of us. It really means a lot. Thank you so much, sir. Thank you so much for being there, for your benign presence. Once again, can we have a huge round of applause for our respected Chief Secretary, sir, please? Now, people, I would like to tell you that next we will have the Commissioner, Health and Family Welfare, Mr. Jenivas, sir, for his kind address. And thereafter, we also have the video presentation by the Panchayati Raj and Rural Development Department, Government of Andhra Pradesh. We also have Madam Salima from UNICEF with us. Can we give a huge round of applause for Madam Salima from UNICEF? And we have one Sarpanch, Sunita Mansingh. I would ask the Sarpanch to kindly come forward and take a seat on the dais, please. Sunita Mansingh. Can we give a huge round of applause for Ms. Sunita Mansingh from Andhra Pradesh? Let me tell you, people, that here in this 2 days national level workshop, we have a lot of things to learn. Especially we talk about the best practices. Andhra Pradesh is really doing well. All the Gram Panchayats are coming up with something or the other new activities, and which is actually following all the 9 themes which have been proposed by SDG. And I must say that's really a proud moment for all of us to be here and be a part of this impressive 3 days national level workshop where people from entire India have come here, be it the elected representatives or the officials from the Department of Panchayati Raj and Rural Development, and this really ensures the unity and diversity as well. And of course, there's a lot of things that we all can learn and replicate in our own Gram Panchayat. तो ग्राम पंचायत की यदि बात करें तो ये बहुत ही अहम भूमिका निभाता है, और आज के समय में जो भी ग्राम प्रधान है वो ग्राम स्तर पे चीज़ों को सुदृढ़ीकरण के मामले में उसको मजबूत करता है, अपने गांव को मजबूती प्रदान करता है. And can we also give a huge round of applause for Shri Vivek Bhardwaj, sir? He is the Secretary, Ministry of Panchayati Raj. A huge round of applause for sir. And we also have our Additional Secretary, MOPR, sir, with us. Now, people, moving ahead, I would like to call upon the Commissioner Health and Family Welfare, Mr. Jenivas, for his kind address, please. A huge round of applause for Mr. Jenivas, sir. I'm sorry with the messed up.
So, warm welcome to respected Vivek Bharadwaj, sir, Secretary, Panchayat Raj and Rural Development, Government of India. A warm welcome to Additional Secretary Chandrasekhar Kumar, sir, from Government of India, Ministry of Rural Development. And I welcome Secretary, Special CS for Panchayat Raj and Rural Development, Rajshekhar, sir, and my colleague, Commissioner Panchayat Raj, Surya Kumari Garu, and Salima from UNICEF. And thanks for giving me this opportunity for making this presentation on the healthy village and the role and the coordination of health department with the Panchayat Raj institutions. Yeah. Next. Yeah. Next. I would like to start my presentation with the I'd like to start my presentation with the base, the setup which we have at the village level, which is the village clinic. As our Chief Secretary sir has told about the establishment of the village secretariats for decentralized administration. On the same lines, we have established the village clinics, 10,032 in number, in all the village, almost in all the panchayats, covering all the panchayats, we have established the village clinics. And these village clinics, apart from the CHO and A&M, we have our ASHAs. 3 to 4 ASHAs are there in each village clinic. Now, each village clinic, now we have constructed a building. And this building, this unique feature of the building is that this building has got the residential accommodation for the CHO as well. So any village functionary, the first thing is that for them to stay at the village is important. So we made a provision in the building design itself. It's a very comfortable stay they can have. So we are at the process of constructing 8,321 buildings. Around 3,000 buildings are completed. The rest also will be completed very shortly. And Andhra Pradesh will be having a proper infrastructure at the village level. Now the village clinics, they offer 12 services to the citizens in the village. Now it varies from, as we can see, from the maternal care, child care, and also the adolescent health, and also family planning services. And the most important thing which is being done at the village level is for the management of the communicable diseases, and how in Andhra Pradesh is making a headway in handling the communicable and non-communicable diseases also we will be explaining in the coming slides. And also we are taking care of the other the segments of health, including the ophthalmic, oral, palliative care, and also the basic training and trauma care is also administered to all our MLHPs. They have been trained with CPR in all our village clinics and the MLHPs. And also mental health also we are focusing, and we have given basic training for them to identify the mental ailments at the village level itself. Now, the one more unique feature in Andhra Pradesh is the establishing a proper setup. In many places, the PHCs, the primary health centers, you will be knowing, they have been established, but the proper connect with the village clinics is not there in many places. So in Andhra Pradesh, what we did, in Andhra Pradesh, we had made the structure properly. So one PHC, we have alerted to only 12 to 13 village clinics. Thereby, a proper monitoring, a proper workflow, and then the work distribution is also happening. So if you can see, we made position 2 medical officers for each PHC. So de facto, each medical officer is responsible for only 6 villages. So for these 6 villages, this medical officer is being called as the family doctor. Now we can imagine how decentralized the healthcare is being given at the village level. And this doctor goes to these 6 villages twice in a month. So on an average, he travels to 12 to 13 days in the village, to the village, and along with the required medicines. So that is the concept of the family doctor. As our CSR has told, the village health clinics not only providing the 12 services, through telemedicine, we are also providing the specialist consultations also. In Andhra Pradesh, we are conducting almost about 75,000 teleconsultations every day. I'm proud to say it is the highest in the country in terms of teleconsultation, what we are doing today. And so after strengthening these PHCs, and then we started the family doctor program. Now, the family doctor program, so as I've just explained, after doing all the structural changes, and then we have given the task for the family doctor, the basic things which the family doctor has to look into the village. So the family doctor, he is tasked with identifying and treating the general outpatients who are coming to the village clinics, and also the main important task for the family doctor is NCD management, the non-communicable diseases. People who are suffering with hypertension and diabetes, they are being followed up regularly by the family doctor during the visits. And also the maternal care, the people who are the pregnant women and the women who have given the birth, both the antenatal and postnatal women are being consulted by the family doctor. And you know, earlier the ANC checkups, the antenatal checkups, used to happen in the PHCs. So due to which the women used to miss the antenatal checkups. Now, because of this, the antenatal checkups are happening in the village. So our antenatal checkups conducting percentage has increased tremendously due to the family doctor concept. Now, in the morning, the doctor also visits the Anganwadi centers. And while he goes to the Anganwadi center, he screens the children, the newborn children, and also the children who are at the Anganwadis for any birth defects and also any signs of malnutrition or any signs of any other birth defects or deficiencies, and that is being identified in the children, and then immediately they are being referred. So after completing the Anganwadi visit, in the afternoon, the doctor also visits the schools. When he goes to the school, he conducts the screening of all the school children, and then they have been identified for if they are having any deficiencies, diseases, and any deformities that is there present in the children, and then they are being given the proper treatment. And the most important component of the family doctor, also one of the most important, is that we are giving palliative care at the village level. People who are bedridden, you may be noticed in the village level, they are there. There, for them to reach to a medical facility is tough. So the family doctor, while going to the village, he also visits the bedridden patients in the village level itself and gives them the necessary treatment and palliative treatment at the village level. So this is another unique concept of the family doctor. And also, this is the healthy village concept where the role of PRIs and health we are talking about. The family doctor also plays an important role in the village health and sanitation. While he goes, he also identifies any sanitation issues in the village and also coordinates with the MPDO and clears those issues as well. Now, I would like to highlight some of the important functions which the health department also does in coordination with the PRI department. One of the important, let's say, the coordination committee that is happening at the village level is the Village Health and Sanitation and Nutrition Committee. So this committee, we are taking all efforts to conduct the meetings regularly at all the village level. The ASHA is the convener for the committee and the Sarpanch is the chairman for the committee. So under this committee, the committee discusses the sanitation issues in the village level and then the functioning of the health clinic or the Ayushman Bharat Arogya Mandirs and also the Anganwadi centers working, and also in the committee, the school teacher is also a member. So the school functioning and the health needs of the children at the school level also is discussed in the committee, and any intervention that is required, there is a sum of 10,000 rupees is given for the committee to make any intervention that is immediately required for upkeeping of the sanitation or any other work at the village level. The other important committee which I would like to explain about is the Jan Arogya Samiti. This is a very recent one. After the establishment of Ayushman Bharat Health and Wellness Centers, these committees are also existing in the village, in addition to the Village Health and Sanitation Nutrition Committee. These Arogya Samitis are headed by the Sarpanch, but in the place of ANM, we have the MLHP, the CHO taking the lead here, and then the other members of the committee, we have the medical officer also, and also the ASHAs and ANMs are also there in the committee. Now, this committee monitors the functioning of the Ayushman Arogya Mandirs in the village, whether the necessary drugs are there, the diagnostics are there in the village level, and the telemedicine, how is it happening, and whether this village clinic, how the non-communicable diseases or sanitation issues are being addressed properly or not. Entire issues are being addressed through this committee. Now, this committee also, we are giving a fund from the NHM, 20,000 rupees every year to this committee. So we can say 30,000 rupees to each and to the village level being provided by the health department for upkeep of the sanitation and the other issues at the village level. Now, having highlighted the role of the Panchayat Raj department, I would like to move upon on the role of the PRI and the health department in handling the communicable diseases. In the communicable diseases, the first thing I would like to highlight the role of the PRI department and health in the COVID management. Briefly, it was explained by our Chief Secretary, sir, and I don't want to dwell upon much here, but I would like to put up the statistics that the fever surveys, we have conducted 50 rounds of fever survey, and through this volunteer network, in some times we could conduct the survey for the entire population in 2 to 3 days. We could complete the entire population survey with a volunteer and identified the symptomatic cases and treated them, and which is unique in the country. And because of this, the COVID wave was handled effectively in the state of Andhra Pradesh. So, as you can see, 35,000 people have been identified close to, and they have been successfully treated and discharged. Now, as CSR has told, the volunteers helped in identifying the people and giving them the treatment, and also the home isolation kit provision also they have told, and they have been they played a great role, the volunteers and also the panchayat secretaries at the village level. Now, another important concept, unique thing which we are doing in Andhra Pradesh is the water quality testing coordination with the health department. So what we are doing here is that in the health clinic, we have provisioned H2S bottles. So through this bottle, the village level CHO, she collects the water sample apart from the regular testing that is being done by the Panchayat Raj department. She collects the sample and tests in the H2S bottle. If there is any contaminant, biological contaminant is present in the water sample, it will change color in 48 hours. It will change color to black. So it's a very simple test and it's very effective. So whichever sample it is not as per standard or it is contaminated, immediately the data is being uploaded and the data is shared to the Panchayat Secretary. And it is those water sources are immediately rectified by the Panchayat Secretaries, and we get a confirmation for that also. As you can see here, we have conducted close to about 234,862 water sources tested in this year, in 23-24, and 5,862 the sources we have rectified in this process. And the other innovative concept which we are again implementing with the help of Panchayat Raj department is observance of Friday, Dry Day and Vector Hygiene app. So what we do is that every Friday, the village level functionaries, Panchayat secretaries and the ANMs and CHO, they move along each and every household and also among the community and create awareness about any water stagnation points. And if there is any water stagnation point, they clear it then and there. And also create awareness that this stagnation leads to breeding. So as you can see here, this has been a very, very effective program. Every 52, every year we are conducting, every week we are conducting this program. And we could repeat households, we could cover almost about 33 crores, like repeat visited, we have these households. And we could rectify almost about, you can see the issues and breeding issues and the garbage heaps which we have rectified. Huge impact it has resulted in the field due to this Friday Dry Day activity. The other important the function which we do in coordination with the Panchayat department is the Vector Hygiene and Control app. This app again, it makes a very structured kind of an attempt to clear the stagnation points in the village. The ANM identifies any water stagnation point or any sanitation issue in the village, and she takes a photo of that and uploads in the app, and then that automatically goes to the Panchayat Secretary. The Panchayat Secretary sees that and he rectifies the the issue, and then he uploads the rectified photo. And if the issue is really rectified in the field, the A&M finally confirms it. So you can see in the field how the issue is being rectified. So you can see, like, through this almost we could rectify 6,02,000 issues at all the village level with the coordination of the Panchayat Raj department through this app. And now, having completed the communicable disease management, I would like to highlight quickly upon the non-communicable diseases management with the role of, and support of the Panchayat Raj department. Now, as our special CS sir has told about the family doctor program, now sir has mentioned about the screening. Now, this screening we have taken up very seriously, and then this screening was done on a household to household mode, which means every household our A&M was visited, CHOs visited, and identified the people who are having any non-communicable diseases. In this process, we have screened 4 crore households and identified suspects of 64 lakh, and finally 22 lakh people in the rural area we have brought under treatment. And these people are being regularly treated by the family doctor when he visits the village, as you can see here. So this is the data of the family doctor program which we have been treated. Almost 95% of all the known cases of hypertension and diabetes which we have identified, these 22 lakh people, are being regularly treated by the family doctor, and which is unique in the country. And AP is the first state to have done completed the comprehensive screening of the entire population, and also putting more than 95% of the known case of NCD on treatment. So this is possible through the family doctor program. Yeah. And our CSR had mentioned about the SDG, and you can see that the anemia percentage has reduced from 53.5% in the pregnant woman, and it has fallen down to 24.66%. Now, how was it possible? Now, it was possible through the village level coordination between all the departments, including the panchayats and also the panchayat secretary. Now, what we did, the A&M regularly tests the pregnant woman for anemia. Now, what happens is that there is no coordination between 2 departments. Now, I have the data of a pregnant woman, but the intervention has to be done, much of the intervention has to be done by in terms of nutrition, by the Women and Child Welfare Department. But they don't know which woman is anemic. So what we did, we transferred the data in an online mode to the Anganwadi worker. These are the pregnant women who are anemic. So you please provide additional nutrition, or please take care of them properly and ensure that they take the nutrition. So through this process, this nutrition was ensured to the pregnant woman. And also I'm happy to state, Andhra Pradesh is implementing YSR Sampurna Poshana and YSR Sampurna Poshana Plus to all the pregnant women, apart from whatever the support from Government of India. Now, in these 2 nutrition kits, through these 2 nutrition kits, we could largely impact on the nutrition status of the anemic pregnant woman. And also, you can see under the Sampurna Poshana, we are giving these items: ragi, rice flake, jaggery, chikki, and dry dates. And then the Sampurna Poshana Plus, we are giving in the tribal areas, which is an additional nutrition which are giving for the tribal areas, which you can see. So this has impacted coordinated effort, sharing of data, and also continuous monitoring of the pregnant woman has resulted in along with the support of Panchayat Raj department, it has resulted in the reduction of anemia among the pregnant women. Now, the other important sector which we have to still work upon is the adolescent girls, prevalence of anemia among adolescent girls. Now, we can see 60% of the adolescent girls are anemic, so it's a very large number. So here we adopted the coordination with the education department. Here also same issue was there. The school department do not know which children are anemic. So what we did, we tested the adolescent girls once in every 3 months, and we shared the data to the school education department. They ensure, whether they are getting the midday meals, and these children are also being provided IFA tablets every day. That is being ensured by the school teacher. So this coordination has resulted, as you can see, a 10% decrease in the anemia prevalence in the adolescent girls. So we have been largely working with the data, and also we have been with the coordinated efforts we are following, and then which has resulted in this reduction. Okay. And also I would like to, I've come to my last part. I would like to highlight upon the unique campaign which has been taken up by the government of Andhra Pradesh under the name of Jaganana Arogya Suraksha. This was almost on the lines of Ayushman Bharat Health Melas, but we did some more additions to it and then implemented in the state of Andhra Pradesh. So what we did in this campaign, Jaganana Arogya Suraksha campaign, for a period of 50 days, we screened the entire households for 7 tests: hypertension, diabetes, urine, sputum test, dengue, malaria, and then all put together 7 tests, we screened them. And then the screened people whom are all having issues, they have been brought to the medical camp. Now here the Panchayat Raj department has helped us and played a very, very major role in organizing these camps, and also the volunteers identifying the people and also who are having the issues, they brought to the camps. This was a very, very successful campaign, and through this campaign we could do almost about 6.4 crore tests we conducted for the entire population. We screened almost the entire population, and we have conducted 10,000 camps entire in the rural areas, and 60 lakh people have turned out in the camps. So 60 lakh people came to the camps and got the benefit. 2 specialists were put for every camp apart from 2 medical officers. So they identified the people who are coming, whether they are having any issues, and then they referred them. So 80,000, close to 86,000 people, they have gone the referral treatment. And most importantly, cataract and eye spectacles also we took as an important part. And also we can see here 79,000 people are identified the cataracts, and also surgery is being completed, and over to 5 lakh people we have given the spectacles. So this campaign was a massive success, and after the success of the program, with the support of Panchayat Raj department, the MPDOs have played a great role, and I thank all the MPDOs using this arena who have participated in this meeting for the success of the campaign. On my last slide, I would like to mention about the unique feature of Andhra Pradesh, which is the Arogya Shri program. Now, Arogya Shri program, how is it different from the other states' insurance program? Under Arogya Shri, now the coverage has increased from 5 lakhs to 25 lakhs. Any ailment which requires a treatment up to 25 lakhs is also being covered currently under Arogya Shri. And the eligibility criteria for Arogya Shri, in many states, the eligibility criteria is only up to 1 lakh or so. But in Andhra Pradesh, the income limit is up to 5 lakhs. And even if you have more land holdings also, it is not a bar for getting the health facility. So that is the unique feature of this Arogya Shri program, with which we have about 87% of the population of the households being brought under the health insurance or health insurance net, which is one of the highest in the country in terms of the health insurance coverage in the country. Now, in the Arogya Shri, we are having again one of the highest procedures in the country, 3,257 procedures, including cancer treatment is being, we have made a provision under Arogya Shri. And one unique feature of Arogya Shri, which no other state has implemented, is Arogya Asara. What is this Arogya Asara? This Arogya Asara is basically a patient recovery allowance. A patient having undergone any major surgery, he requires a minimum period where he will be losing his livelihood. So this period also, the government is giving them an Arogya Asara, and up to it, for every for certain cases, this Arogya Asara is given up to 6 months, and on average up to 5,000 rupees every month for this people to recuperate is being given under Arogya Asara, which is unique in the country. So this again, last thing I would like to mention is that this Arogya Shri card facilitation is being done at the village level by our panchayat secretaries, by our digital assistants, which is nowhere, and in the majorly it is not there in the any other place. Means for applying in the village level and also getting your card at the village level. So this is also being done with the support of the Panchayat Raj department. So I thanks for the opportunity. I hope I have made my attempt in explaining the efforts of Andhra Pradesh in coordinating with the Panchayat Raj department. And I thank you for your patient hearing, and thank you one and all.
Thank you so much, Mr. Jenivas, Commissioner Health and Family Welfare, Government of Andhra Pradesh, for your unmatched presentation. Now, moving further, I would like to call upon Shri J. Murli sir, Director SIRD, Government of Andhra Pradesh, to kindly come up upon the dais, sir. Shri J. Murli sir, can we give a huge round of applause for the respected Director SIRD, Government of Andhra Pradesh, Shri J. Murli sir. And I would like to request Shri J. Murli sir to kindly felicitate Secretary MOPR, Shri Vivek Bhardwaj. A huge round of applause for respected Secretary, Ministry of Panchayati Raj, Shri Vivek Bhardwaj. A huge round of applause. I would request Shri J. Murli sir to kindly felicitate Dr. C.S. Kumar sir, Additional Secretary, Ministry of Panchayati Raj, Government of India, please. A huge round of applause. Thank you so much, sir. I would request Shri J. Murli sir to kindly be seated, sir. I'll request you to kindly be seated on the dais, please. Thank you so much. Well, people, today we are here to explore the vital topic of creating and maintaining healthy villages. And a healthy village isn't just a collection of homes. It's a cornerstone for overall community well-being. And to shed light on this crucial subject, we have gathered experts, community leaders, and individuals dedicated to fostering wellness at the grassroots level. And having said this, now is the time for us to watch the video presentation on Healthy Village presented by Panchayati Raj and Rural Development Department, Government of Andhra Pradesh. Can we have the video, please?
New era in village administration. With the spirit of 73rd Constitutional Amendment, the Andhra Pradesh State Government has strengthened the Gram Panchayats with an aim to deliver the services to the doorsteps of the people as part of decentralization of administration. In the state, for every minor panchayat for a population of 2,000 and in every major panchayat for a population of 4,000, a panchayat secretary, digital assistant, welfare and education assistant, surveyor, agricultural, veterinary, fisheries assistant, women protection secretary, energy assistant, village revenue officer, ANM and others totaling around 1.4 lakh employees have been appointed. Not only these, to conduct different data collection or to deliver the government services to the doorsteps of the people, a volunteer has been appointed for every 50 households. As a result of this, 540 services belonging to 35 government departments are being delivered at village level itself. Around 30 DBT schemes belonging to state and the central governments are being handled by Gram Panchayats. 13,546 Citizen Service Centers, CSS, have been established at the village level. To facilitate Aadhaar services at the village level, 500 Aadhaar services have also been set up as a pilot. Citizens of those panchayats can modify or update their Aadhaar or apply for a new Aadhaar for their children. The information pertaining to state and central government schemes, posters, list of eligible beneficiaries of government schemes are being exhibited in a transparent manner in the Gram Panchayat offices. The details of ineligible beneficiaries too are being displayed along with the reasons for their ineligibility. It used to take months together to get a ration card. It used to take 2 years for sanction of pension. One had to do innumerable rounds to offices to obtain caste certificate. Many would get certificates like birth, death after many rounds to block level or village level offices. All this is a thing of past. All government services have now arrived at the village itself with a SLA period. Now they are available at the doorsteps of the people. This is the result of strengthening of panchayats at the village level. As a result of this, there is no scope for human errors. This information is useful for selection of eligible beneficiaries for each scheme by Gram Panchayats through 6-step validation in a transparent manner, thereby eliminating human intervention.
సచివాలయ వ్యవస్థ సిబ్బంది నభూతో నా భవిష్యత్ చాలా మంచిది ఇది చాలా సుపరిపాలన.
As a result of appointment of energy assistants at Gram Panchayat level, problems relating to electricity are being rectified immediately, and this system is unparalleled. Plans have been prepared to attain 8 sustainable development goals at village level. Among these, anemia, malnourishment, enrollment, improvement of basic infrastructure in schools have been accorded top priority. These 8 indicators have been divided into 58 items of state and central governments and are being regularly monitored through a special dashboard visible to them. As a result of this, percentage of adolescent girls who are anemic in 1 year has decreased from 70.7 to 47.66. At the same time, percentage of pregnant women who are anemic in the last 9 months has come down from 29.55 to 24.75. Similarly, the percentage of underweight children in the last 9 months has decreased from 5.28 to 4.23. In the last 9 months, the percentage of stunted children has decreased from 9.45 to 6.91. All the above indicators are being continuously monitored by ANM, Women Protection Secretary, and other staff working at village level through surveys and inspections. The cooperation of concerned departments is being taken to attain desired results.
అంగన్వాడీ విజిట్ చేసి పిల్లల యొక్క ఎత్తు బరువులను పరిశీలించడం అనేది జరుగుతుంది. పిల్లల ఎత్తు బరువులో ఎవరైనా మాల్ న్యూట్రిషన్ బారిన పడితే వారికి వైఎస్ఆర్ సంపూర్ణ పోషణ పథకం ద్వారా కిట్ అందించడం అనేది జరుగుతుంది. అట్లాగే గర్భవతులు బాలింతలకు కూడా వైఎస్ఆర్ సంపూర్ణ పోషణకి కిట్ అందించడం అనేది జరుగుతుంది.
A Raitu Bharosa Kendra, Farmers Facilitation Center, has been set up for every 2,000 population in Gram Panchayats. These centers are supplying seeds and pesticides at subsidized rates, farm machinery, and conducting soil tests at village level. Along with these, 10,032 village health clinics have been established across the state at 1 each for 2,000 population in Gram Panchayat. As a result of these village clinics, round-the-clock medical services are now available at village level. Medical tests are being conducted on every citizen and their health information is being digitalized. Health ID cards are being given to concerned by linking them with Ayushman Bharat scheme. For the first time in the country, the family doctor concept has been brought to the fore and medical services are being rendered through village health clinics in the rural areas. As part of YSR Arogyasri scheme, one can avail free treatment in corporate hospitals if the medical expenses crosses 1,000 rupees. Not only this, treatment can also be availed under Arogyasri in Hyderabad, Chennai and Bangalore. Recently, the government has launched Jagananna Suraksha scheme to deliver quality medical services to the public. As part of the program, village level staff would visit each and every house and would collect the details of those who are suffering from chronic diseases and problems. The information would be digitalized and treatment would be administered by specialists through medical camps set up at the village level itself. Costly medicines for chronic diseases like cancer would also be given for free of cost.
బయట చేసుకోవాలంటే పెట్టాలి, బ్లడ్ టెస్ట్కి అండ్ యూరిన్ టెస్ట్కి అన్నిటికీ అమౌంట్ పెట్టాలి కదా, వీళ్ళన్నీ ఫ్రీగానే చేస్తామని చెప్పినారు.
Special attention has been paid for the safety of women at village level. In times of crisis, if a woman presses SOS button, the location of the phone, 10 seconds length video, audio and other details would reach police control room. The uniqueness of the system is that it would function even if there is no internet. An automatic call will be dispatched to the nearest police protection vehicle from the control room. The vehicle in turn would reach the place of the victim with the help of GPS and would offer immediate assistance. Through this Disha app, it is also possible to dial 100 or 112 to seek assistance. To sum up the functioning style of the village level in the state in one word, government services are now at the doorsteps of the people, transparent administration prevails, and Gram Panchayats are marching to attain SDGs.
Wow, indeed, an incredible video which reflected it all. May we all give a huge round of applause for our former Secretary, Ministry of Panchayati Raj, Sunil Kumar ji is here. I would request you to kindly come on dais, please. A huge round of applause for our former Secretary, Ministry of Panchayati Raj. I would request sir to kindly come upon the dais, sir. Once again, a huge round of applause for our former Secretary, Ministry of Panchayati Raj, जिनके दिशा निर्देश में पंचायती राज ने पूरे देश भर में बहुत बेहतरीन से कार्य किया है और सर का मार्गदर्शन हम सभी को मिलता रहे, इसीलिए सर हमारे बीच में उपस्थित रहते हैं और हम उम्मीद करते हैं कि भविष्य में भी सर के आशीष से हम सभी पंचायती राज व्यवस्था को और अधिक सुदृढ़ कर पाएं. Now moving forward, we'll delve into the symbiotic relationship between a healthy village and sustainable practices. How can eco-friendly initiatives contribute to the well-being of both the residents and the environment? And to throw light upon this, let us all give a huge round of applause and welcome Srimati A. Surya Kumari ji, respected Commissioner, Panchayati Raj and Rural Development, Government of Andhra Pradesh.
Respected dignitaries on the stage, especially Secretary MOPR, former Secretary MOPR, and Special CS Sir, and Commissioner Nivas Sir, Director SIRD, alage Sarpanch Bimidol, and Salima from UNICEF, and all my colleagues in front of me. Very good morning. Breakfast nahi kiya tha. Very good morning. The video itself is a self-explanatory thing, but little more details, as our Chief Secretary Sir said, the numbers at the state level will turn into names at the village level. That is what I am trying to do. Next slide, please. Yeah. Yesterday, when we were having the group discussion about a particular topic, many of our colleagues raised and said that if you want to do something at the village level, the first thing in place should be legislation. So let me start with that. We have legislations right from soon after independence, right from 1950 onwards, we have legislations in place, numerous of them encompassing all the SDGs that we are talking today. The first in place was the three-tier system, the Gram Panchayats, and the Mandal Praja Parishad, what you call blocks, that we call here as Mandal Praja Parishad in 660 numbers, and district level, of course, the Jilla Praja Parishad, which are 13 in number. And these GPs, while recently, as per the direction of the Panchayat Raj Ministry, have taken the sankalps. And this is the importance we have given to the healthy village. And mind you, few of the GPs have taken more than one sankalp. That is 3,651 Gram Panchayats have taken more than one sankalp. And primary importance was given to water sufficient. As we all know, the drinking water scarcity is still lingering around in spite of water table raising up in many parts of Andhra Pradesh. Still the watershed areas are under process, work in progress kind of thing. So water sufficient and clean and green have taken the primary importance. After that comes from poverty free and then healthy village. The institutional framework of Panchayat, as I told you, has been as part of the Act itself, and the Panchayat Sarpanch with this team of the workers gives primary importance to public convenience and safety, that is what we call, as a part of section part 2 and chapter 4 is dedicated to that. And this encompasses the sanitation, water facilities, prevention of epidemics, and then regulation of the markets and the slaughterhouses. All this, as we see today, is broadly covering all the major functions of the GPs. And this has been done in 1994. That is the last amendment that I'm talking about. Since 1950, it had been around us, giving us the support of the legislative framework in order to coherently act ourselves in the public. Even the Mandal Praja Parishad, that is at the block level, we have out of 15 subjects, many of them, health and rural sanitation taking the primary importance, as I have told you, covering the drinking water, and the women welfare takes the second importance. These are the two that are covered at the block level. And Jilla Parishads have 29 subjects out of the Schedule 1, and that encompasses drinking water, health, sanitations, including maintenance of PHCs and dispensaries, and family welfare, all the communicable and non-communicable screening, all those have been put as a subject as Jilla Parishad, and women and child welfare also has been covered in the district level. And the main resource envelope for which we are dependent upon is coming from our own resources as well as 15th Finance Commission, and few of the central funds covered under various aspects. These might be common for you also, but 15th Finance, the devolution subject-wise might be different. And among the own source also, the percentages given in the slide is self-explanatory. 15% of the own source, 50% of drinking water, and Manrega mein wage and material, we are concentrating to recharge the hand pumps as well as Amrit Sarovar, so that the water capacity of the particular village will go up. And sanitation, of course, takes the next 15%, 50%, and Swachh Bharat Mission, of course, has its own funds tied up for this. And health sector comes the third one. And, we also have the central funds, NRHM, Poshan Abhiyan, and RGSA as important contributors towards achievement of these goals. The block level, again, the similar kind of notation is there as to how much that block president has to allocate subject-wise. These are few GOs which have been given in around 2006 and 7, altogether 10 of them. I'm mentioning few, which actually delegated the primary responsibility of health towards the Gram Panchayats and also the other two tiers, so that they feel responsible towards the community as a whole and especially their Panchayat towards health, as well as the second GO, that is the GOMS number 569, which is towards the maintenance of the water works, whether it is hand pump or whether it is ground level or whether it is CPW scheme. The panchayats totally take the responsibility, encompassing all the three tiers in order to maintain and in order to deliver the safe drinking water, including chlorination as well as the testing. And GOMS number 41, which is encompassing the, again, women development, takes into account the implementation of the various schemes for their safety as well as welfare as well as their upliftment. And this also includes the buildings towards Anganwadis and other infrastructure. Yeah. This we are towards the GPDP. These are the theme we have selected. What we are doing towards achievement of life as well as prevention of early marriages, anemia, and maintenance of the infrastructure. These are encompassing all those, and each village will sit down and draw their GPDP plan, the developmental plan. If there is any specific problem for that, that will take into account along with this also. The other themes, each of these themes will be covering the SDGs to the maximum extent, and the emphasis, of course, is on removal of poverty and again health. There is the maximum convergence, what we can see in the video which we have exhibited just now. The PRI interface with the line department, especially the two pivotal departments, that is the health and family welfare as well as the women welfare. These two become the pivotal for the maintenance of the healthy village, right from infancy, or rather prenatal to postnatal, adolescent, and aged women and men too. As you have seen in the video, the village secretariat or Sachivalayam system is a newly introduced one after the new government has taken charge. And the ratio is very, very workable ratio, very, in the ratio of 1:2000 population, the secretariat is established. And the workforce in this is up to 11 functionaries. When you go to the field tomorrow, you can actually see in person yourself who are these, what are they doing, how are they delivering this. And below them, we have the volunteers. Up to 50 households, each volunteer will be responsible, and they become the bridge between that population and the government in charge. If you see what are the delivery system at the village secretariat level, these are the numbers. In fact, urban has 540, rural has 488 systems developed to be delivered at the village level. I just have one question. If you want to have a copy of the Pahani or the revenue record, where does your citizen go? In your state, where does the citizen go? To the Tahsil office or the village level? Maybe few states must be having village level also, but here for us, in revenue department, we have 88 services delivered at the village level, including the EC, encumbrance certificate, which is required to purchase or sell property. That can be obtained at the village level itself. Now, we did not count that service. Actually, we are work in progress kind. The pilot has been rolled out, but it is not totally escalated, so we did not show. Ongoing, we want to start the registration process at the village level itself. The village Sachivalayam will take all the documents which are required for registration process and initiate it, and online it will go to the sub-registrar, and there it will be approved, and the registered document will be given to the citizen or buyer or seller at the village level itself. This is one of its kind, I can vouch, in the entire country. The energy department, whenever you want a new line or a street light or a transformer or maybe some repair, tiny repair which is hampering the lighting of the either house or the street, that will be addressed at the village level. So the response turnover time has been changed to 48 hours to as less as 1 hour. The transport department and the PR department next comes fourth in there. The number is huge. When you go to field tomorrow, when you visit the secretariat, kindly cross-check whatever I am saying, whether they are really delivered or not. The functionaries, if we talk about the 11 functionaries who are present there, the panchayat secretary is primary functionary assisting the sarpanch. There is digital assistant. When we are talking about the online services, there is a lot of work to be done digitally, that is online. Many websites are there pertaining to many departments. So the application should be processed and it should be uploaded, and again the services should be downloaded and delivered. So this digital assistant is basically doing that job. So he is also a pivotal employee belonging to PR department. And the engineering assistant basically works along with Manrega, JJM, other PR works, GP works, either through own source or 15 finance. He does the estimates as well as recording as well as the quality check whenever required. So the engineering assistant is almost like SCPR of that village. The welfare and education assistant takes care of the dropouts. That is the reason we were able to achieve the 100% of enrollment. There will be no dropout allowed in the village. If somebody is not interested to continue in the formal education, we will be guiding them to the livelihoods so that he becomes self-sufficient to earn his living. The survey assistant belongs to revenue as well as the VRO also. They report to Sarpanch or the secretariat there. And next comes the agriculture, horticulture and fisheries assistants. They have a separate office called RBK, that is Raitu Bharosa Kendra, which is a single window for all the farmers there, whether they are horticulturists or whether they are agriculturists. They can order the fertilizers, pesticides there, seed there on subsidy, and all the insurance schemes, whatever have to be implemented at the village level, they will be responsible for that. There is one more addition, that is a Grama Mahila Samrakshana Karyadarshi. She takes care of the safety, as you have seen in the village, the SOS kind of button which has to be pressed while the woman is in distress. She will be also implementing the DV Act, that is a Domestic Violence Act. She will be doing the counseling whenever it is required in the family issues, and if there are any girls who are actually getting early marriages, that is at the conception of the idea itself, the family will be called and they will be counseled, and that kind of prevention will be there. And they will also be guiding the Anganwadi worker, monitoring them, whether the goods are actually delivered on time, and also monitor the quality of them also. And she will also be taking care of the midday meal. The midday meal quality, and as well as whether the kids are consuming it in proper manner, that will be a responsibility of this Mahila Karyadasi. Energy assistant already we touch based. ANM is there as a part of the group, and village revenue secretary is available at 1:1 GP. And this kind of, I'm not going into detail what are the SDGs we are implementing. All of you, I'm sure, are aware of it. But I will tell you that this kind of dashboard at the village level definitely is a rare thing, which is to be noticed when you go tomorrow at the village level. This SDG dashboard will help each of the Gram Panchayat functionary to know where his clientele are standing. So the line-wise or the name-wise details are available there, and the monitoring is also available right up to HOD to Chief Secretary level. So these are the interventions which we do for each SDG. I am not going into detail because I am enthusiastic to show you the progress of the SDG. So for the last few months, there are 2 screenings which have been done, and the anemia among the adults and girls has been dropped from 70.7% to 47.6%. Maybe CSR slide is showing the updated ones, a slight difference is there. But we see that one-to-one monitoring, including the Mandal Praja Parishad public representatives, and if required, Jilla Parishad public representative, we are cajoling them to the NRCs, we are cajoling them to stick to whatever recipes they give there, and not only that, to send every kid to the Anganwadi center if they are suitable at that age, to take the diet which is given to them. In the beginning, they were little hesitant to consume the egg or the greens. So after explaining them the importance, the public representatives plunged into action, and they also have helped the staff over there, and this has resulted in this magical decrease. And this has been not stopped here. Every Thursday, our Chief Secretary goes in detailed review of district by district, whether the progress is positive or if there are any additional requirements for that particular district, especially the tribal districts of ASR and Parvatipuram Manyam. The YSR Sampurna Poshana or village Sampurna Poshana Plus, this is especially to the anemic kids and women. These additional food items are given which will take care of their needs, and establishment of village health clinics and renovation of the old clinics into new, and Jagananna Gorumudda, which is named for the midday meal with additional items, and the Disha app. These are all interventions which has resulted this. And adolescent females are concentrated upon, and pregnant women screening too. We are trying our level best to do 100% and also counsel them and see that whatever is given to them is consumed. So this is the result we were able to achieve among the anemic pregnant women. So prior to the interventions, it was 29.5, and after the intervention, you can see within few months it has decreased to 24.75. So these are the month-wise details. And if you take the underweighing children who are present in the Anganwadis, even their progress has been so positive. From 5.28 to 4.23, it has been improved. And this is work in progress. We are not saying that we are happy with this. This is only work in progress. So if you can see the stunted kids, it has decreased from 9.45 to 6.91. This is month-wise details. So how did we achieve this? There is a particular procedure laid down, standard operating procedures, which department functionary does what and which level. This is a slide which will explain you that. At village level, the convergence is present between ANM, MLHP, as well as medical officer under supervision of medical officer and CDPO of women development. The entire team will touch base those kids and those women who are in need, basing on mild, severe, and moderate. The severe women are concentrated upon, and they are called for the counseling again and again. We are monitoring how many of them have consumed the food given by us and how many are not doing it and the reasons thereon. The activity is anemia surveillance and as well as testing management is basically the work of this one. See, many of the women are not coming forth for the testing even, so the availability of the kits in sufficient number and month on month the testing is a collective responsibility of this entire team. The visit schedules are planned together and they compare the line list between each department and then they go forth into the field. So, at the district level, we have the district officer supervising these teams. This has been already explained to you. The safety of the woman as well as the nourishment of the woman again is taken care. The maintenance of sanitation in the village as well as the places where they take food, especially Anganwadis. And the quality of the food stock is a responsibility of this Mahila Police as well as Anganwadis. And while they are uploading the apps also, it is seen that they are not doing in a hurried manner and uploading the wrong data, but they cross-check each other and see that the correct data is uploaded. And then they also see that this hot-cooked meal is accepted and received by every woman in the village, irrespective of their caste and also social status. This is again the deworming process, which is very important in monitoring the anemia. All the schools, whether they are private or the public schools, the village level, the health, ANM, ASHA and the medical officer, along with the panchayat secretary, they go around the schools and then distribute it on a fixed days. So everybody knows which village have to be visited, and along with that, they also have, as Commissioner Health and Family Welfare has explained just before, the village level clinics where the diagnostics are being done and the post-operative care also being done. This is how we are working, and as I have said, this is only work in progress, and this will be, we will be together with all the departments under the leadership of the Panchayat Raj Ministry at both GOAP as well as GOI level. We will be striving for much further to achieve the best result possible, and our aim is to come out of the aspirational districts as well as blocks. Thank you.
Thank you so much, ma'am, for your vital and in-depth presentation, which gave a clear picture about the successful healthy villages at Andhra Pradesh. And you rightly said that the Women and Child Welfare Department indeed plays a crucial role in fostering healthy villages by focusing on maternal and child health, education and overall well-being. They implement programs to empower women, provide healthcare services, ensure proper nutrition and enhance educational opportunities for children, contributing to the overall development of the rural communities. Now, having said this, I would request Mrs. Rosa Rani from Women Development and Child Welfare Department, Government of Andhra Pradesh, for her kind presentation, please. May we have a huge round of applause for Srimati Rosa Rani.
Good morning, everybody, all the participants and the dignitaries occupied the dais. And this is the presentation from Women Welfare Department. And as you all know that Women Welfare Department providing 6 services which majorly linked with healthy village, and department is committed to achieve sustainable development goals. So these are directly linked to theme 2 of healthy village concept. The 6 services provided through Women Welfare Department are supplementary nutrition and preschool education and nutrition health education. These 3 are directly linked with Women Welfare Department, and the other 3 services providing through in coordination with Health Department, that are immunization, health checkups and referral services. So here the coordination between Health and Health Family Welfare Department, we are as such, ICDS goal itself having the coordination with Health Family Welfare Department, and during the implementation, department is coordinating with Gram Panchayats and also the self-help group members. And here the next slide. The department is implementing these 6 services through 55,607 Anganwadi centers spread over the 2,205 sectors covered in 257 projects in AP state. And the beneficiary coverage for supplementary nutrition program for pregnant, lactating and children below 6 years are around 34 lakhs 9,000. Next slide, please. And the programs, the department is committed to achieve these SDG goals, SDG 2 and 3, and which are directly connected to Healthy Village theme. The following, the ICDS scheme and ICPS scheme and Poshan Abhiyan. These 3 schemes are directly... Okay, thank you. These 3 schemes are directly linked to the Achieving Healthy Villages concept. So through ICDS, providing supplementary nutrition and preschool education and nutrition and health education. So to improve the nutritional status and for holistic development of children through preschool education and nutrition and health education to improve the to educate the parents and community members and community at large, the Gram Panchayat members and all village elders. Through Poshan Abhiyan, focusing majorly on maternal, infant and young child feeding practices and identified SAM children, treatment of children with severe acute malnutrition and wellness through Ayush. And the major pillars of Poshan Abhiyan are convergence, governance and capacity building. And through ICPS, Integrated Child Protection Scheme, focusing on providing sponsorship support to HIV orphans and for prevention of early child marriages, organizing awareness programs to educate parents, adults and girls and other community members. And recently, with the instructions of Chief Secretary, sir, identified the hotspot centers to intensify the camps to identify the early child marriages. And also the CMPOs from different departments are trained and reviewed on periodic basis. And apart from this, we are also coordinating with other departments. Like for health family welfare, we are mobilizing and educating the pregnant women to utilize the Pradhan Mantri Matru Vandana Yojana cash benefits to the mothers, and also the mobilizing the children for Mission Indradhanush for 100% immunization and promoting yoga through for pregnant women for easy and normal delivery during Jana Andolan activities to educate the community at large through National Ayush Mission and construction of toilets through Swachh Bharat Mission and safe drinking water through Jal Jeevan Mission. So these are all directly and in coordination with other departments, the department is implementing which are contributing for healthy village theme. And the local goals set for achieving the healthy villages are elimination of anemia and elimination of undernutrition, which is having 3 indices: stunting, wasting and underweight, and promotion of Nutri Gardens, that is Poshan Vatikas. So for elimination of anemia, majorly focusing on educating the adults and girls and pregnant women. Women Welfare Department is providing nutrition interventions and supplementation of IFA tablets and folic acid tablets from Health Department, and promotion of safe drinking water, sanitation and hygiene practices through Gram Panchayats, and awareness generation through elderly members and village heads from Gram Panchayats and village organizations and SHG members. And as Nivas sir has already mentioned, that data integration is happening for identification and tracking of anemic pregnant women, and also the data sharing was done to these self-help groups through SERP for mobilization and utilization and for behavior change communication. And for elimination of underweight, that is 3 indices: stunting, wasting, underweight, the major focus is on adolescent, maternal and child health, infant and young child feeding practices, and sanitation and hygiene practices. So with regard to sanitation, you all know the utilization of toilets, especially for below 6 months children, the fecal matter was thrown out, but they need to push it in the toilet. So these kind of behaviors needs to be focused through community, gram panchayats and self-help group members by educating them. And for prevention of infections also, we need to do that. Food and feeding demonstrations during several camps and occasions. It was done. Food demonstrations, what kind of foods they need to consume, and feeding demonstrations for to promote infant and young child feeding practices. And data sharing is also happening with health department and to the SERP for especially with the health department, the severe acute malnutrition children, for referring to NRCs, and to the SERP to share it with the community level SHGs and BOs for mobilization and utilization of services at Anganwadi center and health services, and also to bring that behavior change at household level through SHGs and VO members. And promotion of Nutri Gardens, Poshan Vatikas, majorly focusing on calcium. We all know that anemia is a major problem, and also undernutrition, that is a hidden hunger is there with the different kinds of deficiencies of nutrients. So majorly focusing on iron, calcium, vitamin A, vitamin C and folic acid rich foods. That information was shared with community level with Anganwadi workers to educate the community members and mothers to make it, to grow them in their backyards and at Anganwadi centers, especially for reduction of anemia and hidden hunger. And so majorly, maybe you might have seen these pictures in recent Jaganan Arogya Suraksha campaigns also, to educate the adolescent girls and community at large what needs to be eaten by them and what they are taking and what exactly they have to take. So from 5 different food groups, and how much, the half of the plate what needs to be taken and rest of the plate what needs to be taken. Maybe if you can see the picture, you will be able to identify and understand. And especially the people in food pyramid also, what kind of foods we need to eat adequately and generously and with moderate quantities and with sparingly we have to see and eat. But generally whatever the recommendations are there to see it very eat very sparingly, that generally we eat very generously. What kind of foods generously we need to eat, that we are eating very limitedly. So greens and leafy vegetables, fruits and all, we are eating very sparingly. Those observations are come from the NIN surveys and reports. So we need to have that kind of understanding what needs to be taken to have that, to eliminate anemia and undernutrition. We need to understand and we need to educate. This kind of information is going through Anganwadi workers and other supervisory cadre to the community level. And to disseminate all these things, the strategies adopted by the Women Welfare Department are growth monitoring and nutrition health education. So growth monitoring will be done to the children below 6 years on monthly basis and educate the parents on the status of children with regard to their malnutrition, and also educate pregnant and lactating women whatever they provide through Anganwadi center. Sir has already mentioned and showed pictures, and madam also showed pictures for the department through Sampurna Poshana and Sampurna Poshana plus the foods given to the Anganwadi center. So those things they need to eat. So which we are providing to pregnant and lactating and children, but it is diluted at household level and eating everybody. So if they can understand why these foods are given, then only we'll be able to improve the nutritional status of the pregnant or children, whoever is targeted for that food. And importance of deworming, especially people have many myths and misconceptions about having this deworming. So we need to focus on that. And also the consumption of IFA syrup providing IFA syrup, and counseling on the importance of consumption of IFA and consequences of undernutrition also we need to focus. And during home visits, focusing on household level feeding practices, whatever we are saying that infant and young child feeding practices, so the practices needs to be observed and provide appropriate inputs to the mothers or parents or community members. And convergence, with already mentioned about this convergence, to provide those services, Women Welfare Department is at grassroots level, Anganwadi worker and A&M are working together and ensuring that IFA tablets reaching to pregnant and lactating women and IFA syrup to the children below 6 years. And data integration is happening, already mentioned about it. So all these services and behaviors are communicated through different behavior change communication platforms. And also department is conducting different community-based events, community-based Srimantalu, Annaprasana, Aksharabhyasam, like this, so many community-based events are there. So through these events, community is educated. During those platforms, these Gram Panchayat members were invited, and also through them also these messages were disseminated. And Srimantam, especially, generally you all know that it's like an event conducting to celebrate, but when department is conducting this, we need to focus on the provision of IFA tablet and importance of consumption of IFA tablet and what kind of food they need to have. And also Women Welfare Department is providing eggs, but so many pregnant women and lactating women have myths and misconceptions not to eat egg, and they will not provide even below 1 year children eggs they are not giving in some areas when we see that. So to avoid and to make them understand the importance of those foods and those myths, and to minimize those myths and misconceptions, we need to address during those Srimantams and Annaprasana activities. But we all need to focus on that, the importance of educating them during those events, just not to celebrate. Celebration is one part. During celebration, educating them is the important point we need to consider. So the behaviors and processes adopting to achieve this healthy village theme and to achieve the sustainable development goals at Anganwadi center level. So ensuring early registration. Early registration is also important because generally at 3 months and at the month of 4, pregnant women are registering. You all know that due to various myths and misconceptions, if they can register early, they can have that folic acid tablet up to 3 months, which will avoid the neural tube defects. Those are majorly cleft lip and cleft palate, all those things. But people, they don't know about the consequences of not registering it early. We need to make them understand, and department is focusing on that. And providing nutritious food through Sampurna Poshana and Poshana Plus in tribal and rural areas. And immunization for prevention of infections. So already told that early initiation of I mentioned about infant and young child feeding practices, which is having early initiation of colostrum feeding, exclusive breastfeeding, appropriate complementary feeding. All these things needs to be focused. Department is already focusing on during home visits and village health nutrition days, and promotion of dietary diversity and safe drinking water, sanitation and hygiene practices for prevention of infections. So all these interventions are provided and educated during VHSNDs, home visits, ECCE days, and food and feeding demonstrations happening in different platforms. So these are the community-based events conducted at different platforms, different Annaprasana, Aksharabhyasam and Srimantalu and all. And I think we can see one video how Gram Panchayat is operating, supporting each other. And also one more video for with regard to ICDS services, how well Anganwadi worker, even though the center is very small, how well organized her center.
We'll have the video now. The video now.
Yes. I already told him.
అందరికీ నమస్కారం అండి. నా పేరు శాంతి అండి. మాది కాసిబుగ్గ ప్రాజెక్టు మొక్కపల్లి సెక్టారు ఎమ్గడూరు అంగన్వాడీ సెంటర్ అండి. ఇక్కడ మా హెల్పర్ అండి.
అందరికీ నమస్కారం అండి. నా పేరు జోగి లక్ష్మి గారు. నేను అంగన్వాడీ హెల్పర్ అండి.
ఇది మా అంగన్వాడీ అండి. ఇది బయట ఓపెన్ హాల్ అండి. అలాగే లోపలికి వెళ్ళి చూద్దాం రండి. ఇది మా లోపల డెకరేషన్ చేసుకున్న ప్రీ స్కూల్ మెటీరియల్ అండి. ఇవన్నీ మేము ప్రతి ఈవెంట్ చేస్తుంటాం కదా, ఆ ఈవెంట్ తాలూకా పిక్స్ అండి. ఇవన్నీ ఆ ఈవెంట్ తాలూకా పిక్స్ ఇవన్నీ చేయడం జరిగింది. అలాగే ప్రీ స్కూల్ పిల్లలకి అనేసి లెటర్స్ రాసి పెట్టడం జరిగిందండి. అలాగే ఇక్కడ ప్రీ స్కూల్ మొత్తం ఐటమ్స్ అన్ని ఎగ్జిబిషన్ లాగా మేము డెకరేషన్ చేసుకున్నామండి. ఇవన్నీ ప్రీ స్కూల్ కిట్స్ ఇవన్నీ వచ్చినవేనండి. ఇవన్నీ అలాగే ఇక్కడ కూడాను మేము కొన్ని యాక్టివిటీస్ ఇవన్నీ చేసి పెట్టుకున్న ప్రీ స్కూల్ ఐటమ్స్ అండి ఇవన్నీ. అలాగే ఇక్కడికి వచ్చేటప్పటికి ప్రతి ఈవెంట్ చేసిన ఫొటోస్ నాకు పేపర్లో వచ్చిన పిక్స్ అండి ఇవన్నీ. ఇవన్నీ ఇలా పెట్టించుకున్నాము. అలాగే మాకు ఇక్కడ వేయింగ్ మిషన్స్, నెక్స్ట్ హైట్ చూస్తున్న స్టేడియోమీటరు, అలాగే ఇక్కడ ఇంపెంటోమీటర్ అన్నీ ఇక్కడ మేము డెకరేషన్ చేసుకున్నామండి. అలాగే ఇక్కడ మేము పిల్లలు గేమ్స్, బాస్కెట్బాల్ గేమ్స్ ఇక్కడ రిస్క్ పిల్లలు గేమ్స్ ఆడడానికి కలిసి ఇక్కడ గోడకి లిఫ్ట్ చేసుకున్నామండి, అటాచ్ చేసుకున్నాము. అలాగే శ్రీకాంత్ కార్యక్రమాలు చేసి తీసుకున్నాము. అలాగే మా ప్రీ స్కూల్ పిల్లలు ఇవన్నీ యాక్టివిటీస్ ఇవన్నీ డ్రాయింగ్స్ మా పిల్లలు వేసుకునేవేనండి. ఇవన్నీ ఈ యాక్టివిటీస్ ఇవన్నీ మా పిల్లలతో చేయించేసి ఇక్కడ డెకరేషన్ చేసుకున్నానండి. నా స్టోరేజ్ సెల్ఫ్ అండి. ఇక్కడ మేము బుక్స్ పెట్టుకుంటున్నాము. అలాగే ఇక్కడ మాకు ప్రభుత్వంలో వచ్చినటువంటి బుక్స్ కూడా ఇక్కడ మేము పెట్టుకోవడం జరిగింది. అలాగే ఇక్కడ మాకు ఇచ్చిన మెనూ అండి. రోజువారీగా ఏమేమి ఐటమ్స్ వండేసి మా పిల్లలకి పెట్టాలనేది ఇక్కడ మెనూ అప్పుడు ఈ మెనూ ప్రకారంగా చేసుకుంటాము రోజువారీగా. అలాగే ఇక్కడ మాకు ప్రభుత్వం నుండి వచ్చినటువంటి మిల్క్, ఎగ్స్ చేసుకోవడం జరుగుతుంది. అలాగే
Open the other video for 2 minutes. Ma'am, can we have that panchayat regarding video also for 2 minutes?
Yeah, it's okay. Thank you.
Okay. So, just let's finish. Okay. So, I think with regard to 1 minute, I'll close this. So, with regard to this, close this. So due to time constraint, we need to close this, and we have one more video of having Gram Panchayat support in implementation of different activities at Anganwadi center level. And at present, for the sake of audience who doesn't know in Telugu, Anganwadi worker is showing her Anganwadi center, whatever preschool activities she is doing with the children below 6 years, and which are right now with national education policy, what is emphasizing, all those activities are doing, but still it needs to be strengthened. Yeah. So needs to be strengthened further, and for strengthening of those activities at village level also, we need support from Gram Panchayat members for mobilization of children, because these many kind of activities are going on at village level. For yesterday sir has mentioned, Rajashekar sir has mentioned, health is not merely absence of disease, it's a mental and emotional and physical well-being, social and physical well-being. So all those things are focused in these preschool activities. So whatever will be able to focus, we are focusing on that. So thank you so much.
Thank you so much, ma'am, and sorry to cut you short because we need to follow the time tangent as well, and I request all the other speakers also to please express in limited time frame. Well, moving ahead, we have with us Ms. Salima from UNICEF, and as we all know that UNICEF plays a pivotal role in fostering healthy village within Gram Panchayats by implementing various initiatives. So to throw light upon this, I would like to straight away call upon Ms. Salima from UNICEF. A huge round of applause for her.
Thank you, everyone. I would immediately like to take you right now to a small district in AP called Vizianagaram. Let's see what the panchayats in Vizianagaram have to say. Can we have the video, please?
Vizianagaram is a largely tribal and erstwhile aspirational district in the state of Andhra Pradesh. To address challenges such as anemia, low immunization coverage, lack of community awareness on health, and poor health-seeking behaviors, Government of Andhra Pradesh initiated the Comprehensive Primary Healthcare Project in collaboration with UNICEF and Nature. One of the vital components of the project was working closely with panchayats for community engagement. This included adoption of healthy practices, increasing uptake, demand of available health services and benefits.
నేను సర్పంచ్ అయిన తర్వాత నోటీస్ చేస్తూ అవేర్నెస్ చేస్తూ నేను తల్లి బిడ్డల ఎక్స్ప్రెస్ ఉంది బిఫోర్గా ఉన్న కష్టాలు ఈ అవేర్నెస్ వల్ల ఈ తర్వాత గవర్నమెంట్ ప్రొవైడ్ చేసిన తల్లి బిడ్డల ఎక్స్ప్రెస్ వల్ల వల్ల అవేర్నెస్ పెరిగిందమ్మా.
9th డే ఇంటికి తల్లి బిడ్డ ఎక్స్ప్రెస్ ద్వారా ఇంటికి డ్రాప్ చేశారు.
ఈ మెడికల్ క్యాంప్స్ వల్ల ఏంటి అంటే ఫస్ట్ మేము వస్తాము అన్నది పీపుల్ కి బాగా తెలుసు. లైక్ మేము ఇక్కడికి వస్తున్నాము అంటే ముందు రోజుగానే ఊర్లో దండోన వేపిస్తున్నారు విత్ ద హెల్ప్ ఆఫ్ లోకల్ రిప్రజెంటేటివ్ సర్పంచ్ వాళ్ళు ఉంటారు. ఈ ఊర్లో సర్పంచ్ అప్పారావు గారి హెల్ప్ వల్ల సో మీ ప్రోగ్రామ్ కండక్ట్ చేయగలుగుతున్నాం.
పిహెచ్సి పరిధిలో కూడా న్యూట్రిషన్ ఫుడ్ ఇవ్వడము, న్యూట్రిఫ్ ఇండియా గవర్నమెంట్ సపోర్ట్ చేయడం, దానికి మా పర్సనల్ గా కొంత హెల్ప్ చేయడం కూడా జరిగింది.
మా పంచాయతీ తరఫున అయితే మా పిహెచ్సిలో మా సహకారం ఎప్పుడు కూడా మా పంచాయతీ సిబ్బంది వెళ్ళి ఆ పిహెచ్సి క్లీన్ చేయడం, చెత్తను తోటకెళ్ళి మేము మా డంపింగ్ యార్డ్ తీసుకెళ్ళడం, ఈ యూనిసెఫ్ నేచర్ ద్వారా మా గ్రామాల్లో ఆరోగ్య విషయాల మీద కళాజాతర కార్యక్రమం కూడా చేయడం జరిగింది.
పంచాయతీ రాజులు మాకు బాగా హెల్ప్ చేస్తారు. నిజంగా వాళ్ళ హెల్ప్ అనేది చాలా గ్రేట్. మేము చేసిన వర్క్ బ్యాక్గ్రౌండ్ వర్క్ అంతా పంచాయతీ రాజు వాళ్ళు చేసిందే నిజంగా చెప్పాలంటే.
ఇమ్యునైజేషన్ మా జరుగుతూ ఉందండి. సామూహిక శ్రీమంతాలు అనేది మా పోస్ట్పాటం పంచాయతీలో కంపల్సరీగా జరుగుతూ ఉన్నాయండి.
పంచాయతీ రాజు వాళ్ళు చేసిన హెల్ప్ ఏంటంటే జనరల్ వేసుకునేటప్పుడు వాళ్ళే కార్డ్ తెప్పించి డైలీ క్లీన్ చేపిస్తూ ఉంటారు. మా చుట్టూ ఇండస్ట్రీస్ ఉన్నాయి పిహెచ్సి చుట్టూ. ఆ ఇండస్ట్రీస్ తో వాళ్ళు ఏమైనా ఫైనాన్షియల్ గా సిఎస్ఆర్ గ్రౌండ్స్ తో మాట్లాడి మాకు వాటర్ ఫెసిలిటీస్ కానీ వాష్రూమ్స్ అవి రిపేర్ చేయించడం హెల్ప్ చేస్తారు.
యాంటీనాటల్ చెకప్స్ అయినా, పోస్ట్ నాటల్ చెకప్స్, NCD/CD స్క్రీనింగ్స్, బెడ్ రిడెన్ పేషెంట్స్, అంగన్వాడీ విజిట్స్, స్కూల్ విజిట్స్, ఎల్డర్లీ సీనియర్ సిటిజన్స్ స్క్రీనింగ్ ఏవైనా ఉన్నా, టీబీ ఇవన్నీ కూడా కాంప్రహెన్సివ్ ప్రైమరీ హెల్త్ కేర్ సిస్టమ్.
రేపు ఊర్లో పందులు బండి వస్తుంది కాబట్టి జనమందరూ వెళ్ళాల్సిందమ్మో.
Well, so this was a small village, a small area in Vizianagaram district, and it was part of a comprehensive primary healthcare project that was initiated by, we have Department of Health here, Nivas sir, and at that time Sirukumari ma'am was the collector of that district. So this was initiated in that district. Now what do we want to take back, and that's what we want to reflect on. What did the Sarpanch help with? 1. Raising awareness of government health schemes that we've been speaking about. 2. He brought in corporates in the area to actually influence and look at the needs. Sir spoke of Jan Arogya Samitis. The Sarpanch was a part of the Jan Arogya Samiti there, and he realized that the RO plant was not available. So he brought in corporates in the area and tried to bring in the support that was needed at the PHC level. So you use local culture, you use kalajatras, you use whatever is locally available, you use drums to ensure that you bring in people for help, you raise awareness, and you also try and look at corporate social responsibilities. So these are some of the broad things that we heard from the video. Can I have my presentation, please? As UNICEF, we are very privileged to be working with Ministry of Panchayati Raj for a whole range of issues on localization of SDGs. We also work with the NIRD at Hyderabad for working and for building capacities of panchayats. How do we look at Mahila and Bal Sabha, and how do we integrate Mahila and Bal Sabha? So I will, excuse me, can I have my presentation? Okay, sorry. So I'm not going to go into all that. Okay, what we do is not important. What is important here is you look at this slide. Yesterday, Vivek sir pointed out and Minister sir pointed out that 5% of the panchayats are doing something on health, are prioritizing health. One way of looking at it is what kind of expenditure out of your own budget you're doing on health. Look at your own expenditure and try and see what can be done for health out of your budgets. And are we, in the last 2 days, this presentation is basically focusing on what have we been talking about in the last few days, and is it enough? Or do we need to do anything more for health? We've spoken about raising awareness camps. We've spoken about women and child development. We've spoken about nutrition. But we have to also speak about mapping the vulnerable population. So for example, that last mile, that last child who is not getting the service, as GPDP, when we are preparing our GPDPs, are we able to reach that last child? That is what will make the big difference. Government of India came up with the Ayushman blocks program or the aspirational district program, understanding that the last mile needs to be reached. So as Sarpanches, what we can think of is how do we reach that last house whom we are not able to reach? The second point about it is, you can't do anything alone. You will need participation of people around you. And what participation? Who all can we look at? We look at self-help groups, we look at corporates, we have an example there. We look at the local NGOs. Nature was a local NGO that the panchayat brought in. So that's the kind of cooperation that we look at. Lastly, we also look at social accountability, and that is very, very critical. As Jan Arogya Samiti members, as Village Health Sanitation Nutrition Committee members, it is your responsibility to look at, is my center giving the services that that center is supposed to give? Can we talk to somebody? If you look at this book, and I really would love you to go through this book, it gives you checklists. As a Sarpanch, what do I need to see in my health and wellness center? Is it happening? Is it not? What can we do? So those are some of the things. And then when we look at grievance redressal, do we have a way of making sure that the pregnant woman, if she has gone to the health facility or somewhere and she's not got the services, is there a way that we can go back? So these are some of the areas that we can look on. We've already spoken about the, Nivas already spoke about that we have 3 levels and where all you all can fit in. But these are some more points. In Vizianagaram again, there is a project called Sakhi, where we have adolescent girls who have been formed into collectives. So you have 3,000 collectives of adolescent girls. How can you prevent a child marriage? What is your role? Or what is the role of Sarpanches in preventing child marriages in your community? One is raising the awareness. But more importantly, you should create an atmosphere that if there is a girl who is, somebody comes to see the girl can reach out and actually share her experience with the Sarpanch or with someone nearby and say that, somebody is coming to see me and I don't want to get married. And then the intervention is at the level of the panchayat speaking to the family and influencing the family decision. That is all in your hands. Whatever I'm trying to share over here are things that you as panchayats can do within your powers, and you don't need additional things to do it. Similarly, your Anganwadi centers, so we all have, at Anganwadi center, we say we have to do checkups of pregnant women. But are we giving her privacy in the Anganwadi center? That pregnant woman, when she comes to the Anganwadi center, is she actually getting a table to lie on? Can the A&M even examine her properly? Unless we are able to do that basic work as an, as a sarpanch, if you are not able to develop your Anganwadi to make sure that the pregnant woman feels comfortable to come to the Anganwadi, you will never be able to reach the saturation that we are trying to reach. Similarly, citizen charters. Are you aware, has your PHC put up a citizen charter? कि यहाँ पे क्या क्या मिल रहा है? What is it that services should we get? And then you can go back and ask them, are the services being provided? Patient support groups. You know, in our country, we have 2.7 crore births every year, 2.7. But we do not have patient support groups for these births. We don't have groups of pregnant women who can actually speak to other pregnant women and influence them, give them guidance, give them, what can be done. So these patient support groups of mothers or adolescent groups, these are the ways forward when we look at it. Immunization. You say you want to improve the immunization coverage. It's a very important indicator. But what role can you play? Your A&M and your ASHA prepares a due list. Your Anganwadi worker prepares a due list. Go to the immunization site at the end of the day and see whether everybody from that due list has come. Has the last child that you know actually, is he featuring on that list? That is the role that you can play in terms of panchayats. You have Bal Sabhas, you have Mahila Sabhas, you have a lot of, Arogya Sabhas now. Are women and child health issues being discussed? These are some things that we can focus on. And this is going to be the last bit that I think everyone should know. This is something that we know, but we are not always cognizant of it. The first 2 years of life. And when I say first 2 years, it is from the time the woman gets pregnant almost, or a little bit preconception. So from that time to the first 2 years, 75% of your brain gets developed. If we are not able to focus on those 2 years, we will never be able to bring in a change. And that is what I feel, we'll have to move on. I understand. So these are newer areas, but we are looking at investment in children for a better tomorrow. And we can't do this until we look at early childhood development. So these are some practical tips that I wanted to share with you. Like I said, it takes a village to raise a child. It cannot be done alone. You need to bring together people. And that was my basic thought process. We have a child rights resource unit that has been set up at NIRDPR. And there are a lot of repositories, what can be done. All that is available, and you can reach out there. Thank you, and I would like to leave you with the thought that you yourself can make a difference. There is no need for somebody to come from outside and make that change. Thank you.
Thank you so much. That was a wonderful presentation. And before I request you all to watch a short video by the Sarpanch Sunita Mansingh from Andhra Pradesh, I would request all the group members to kindly submit your presentations at the console, please. And now can we have the video, please? Sunita Mansingh is there on the stage. Can we give a huge round of applause for the Sarpanch from Andhra Pradesh?
Bhimadol, a vibrant village nestled in the heart of Andhra Pradesh. The Bhimadol Gram Panchayat, located in Bhimadol block of newly formed Eluru district in the state of Andhra Pradesh. The government of Andhra Pradesh has established YSR village health clinics in all the Gram Panchayats, which is a revolution in rural healthcare. Each clinic covers a population of 2,000 and services provided include basic medical care, diagnostic tests and access to health records through Arogyasri cards. Each clinic has a team of dedicated health workers including mid-level health providers, auxiliary nursing midwives and accredited social health activists. They offer 12 basic medical services, 14 types of basic diagnostic tests, 64 types of medicines and 67 types of basic medical equipment. The government of Andhra Pradesh has introduced another novel initiative, the family physician concept, to provide quality healthcare at the village level by bringing physicians to the doorsteps of the people. The doctor of a PHC will visit villages mapped on alternative days and twice a month in mobile medical unit. With a non-communicable diseases survey will be done in the village and report will be provided to the family physician and they will give most preference to the patients notified in the NCD survey. The visiting doctor will take care of the health of social children and Anganwadi children. They also visit bedridden patients who need referral treatment under Ayushman Bharat and Arogyasri services. In Bhimadol Gram Panchayat, under the dynamic and responsive leadership of Sarpanch Srimati Pamu Sunita.
I am Pamu Sunita Mansi, Sarpanch of Bhimadol village, Veluru district of Andhra Pradesh. We are having 3 health clinics. We are providing health services for community through 3 Ayushman Arogya Mandirs health and wellness centers located in our Gram Panchayat. There are 4 ANMs, 2 main health assistants, 3 CHOs, 12 ASHAs are working in our Bhimadoli village.
In the Bhimadol Gram Panchayat, the central government flagship programs Ayushman Bharat cards, Janani Suraksha Yojana, Janani Sishu Suraksha Karikram, Pradhana Mantri Matru Vandana Yojana, Navajata Sishu Samrakshana Karikram, Nikshay Poshana Yojana, Pradhana Mantri Surakshit Mantritva Abhiyan, the state government schemes and programs YSR Arogyasri, YSR Arogya Asara, 108 Service, 104 Service, Mother and Child Express, 102 Service, YSR Kanti Velugu are also being implemented effectively in the Bhimadol Gram Panchayat for the benefit of the villagers. To improve the nutritional status of children and simultaneously to improve the health of children, midday meal program is being implemented in the name of Jagananna Gorumudda. Free albendazole tablets are being supplied to children between the ages of 1 and 19 years on National Deworming Day to prevent parasitic worm infection. Free iron and folic acid supplements are being supplied to children and adolescents to prevent anemia through WIFS. Swecha scheme is being implemented in which 10 sanitary napkins are being supplied every month to all the adolescent girls studying in government schools and colleges. Comprehensive care to pregnant women to improve maternal and child health is in the Bhimadol Gram Panchayat is the maintenance of the Solid Wealth Processing Center. The wet and dry waste is being collected and transported to the Solid Wealth Processing Center, where the waste will be segregated and wet waste will be converted into vermicompost and dry waste will be disposed thereof. The Bhimadol Gram Panchayat exemplifies what a healthy village can achieve and continue to working to provide the basic, inclusive and quality health services to the utmost satisfaction of all the villagers.
And that was a wonderful video. And people, as the dignitaries on dais have continuously been guiding us through their unsurpassed knowledge, we wish to felicitate them. To begin with, I would request Sri B. Rajshekhar Sir, Special Chief Secretary, Government of Andhra Pradesh, to kindly felicitate former Secretary, Ministry of Panchayati Raj, Sri Sunil Kumarji. A huge round of applause for our former Secretary, Ministry of Panchayati Raj. Can we give a huge round of applause for our former Secretary? Would request our former Secretary MOPR, Shri Sunil Kumar ji, to kindly felicitate Shri B. Rajshekhar sir, Special Chief Secretary, RD and PR, Government of Andhra Pradesh. Would request Shri Sunil Kumar ji to kindly felicitate Shri J. Nivas sir, Commissioner Health and Family Welfare, Government of Andhra Pradesh, please. A huge round of applause for Shri J. Nivas ji. Would request Shri Sunil Kumar sir to kindly felicitate Srimati A. Surya Kumari, Commissioner PR and RD, Government of Andhra Pradesh, please. A huge round of applause for Madam Srimati A. Surya Kumari. Would request Director SIRD Shri J. Murali sir to kindly felicitate Srimati Rosa Rani, Department of Women Development and Child Welfare, Government of Andhra Pradesh, please. A huge round of applause. Srimati Rosa Rani, to kindly come on stage, please. So, would request the Director SIRD Shri J. Murali sir to kindly felicitate Srimati Rosa Rani. Would request Shri J. Murali sir to kindly felicitate Ms. Salima from UNICEF, please. A huge round of applause. Would request Srimati Surya Kumari ji to kindly felicitate the Sarpanch Srimati Sunita Mansingh. A huge round of applause. And last but not the least, would request respected Sunil Kumar sir to kindly felicitate Director SIRD Mr. J. Murali sir. A huge round of applause. Thank you so much, respected dignitaries, to have guided us throughout this panel discussion. Now, moving ahead, would like to call upon Shri Vipul Ujjwal sir to kindly take this further, please.
Thank you, everyone. Just इसके बाद आफ्टर दिस सेशन हम शुरू करने वाले हैं हमारे जो स्टेट के प्रेजेंटेशन थे वो सारे डिस्कशन ऑल दोज डिस्कशन विच यू हैड इन योर groups about different topics where you have suggested certain things and also you have discussed various concerns of yours जिनके presentation तैयार हो गए हैं, you have made presentation of them. अब हम शुरू करने जा रहे हैं. So kindly for every group, the resource person of every group has to see that the people who have to present should be brought to the stage and they should present it properly. So the group one, Shri Sudhakar Rao ji और Shri Keshwa Reddy जी हैं बैठे हैं यहाँ. So आप अपने ग्रुप को, अपने 5 लोगों को या 6 लोग जो भी हैं उनको इसके बाद हम 5 मिनट के बाद शुरू करेंगे. So then bring them to the stage. Load हो गया आपका? Okay. The group 2 is Nagarjuna ji and Srimati Shri Devi ji. Are they sitting? Nagarjuna ji and Shri Devi ji जो दूसरे ग्रुप के resource persons for group 2, Nagarjuna VDC and Srimati Shri Devi from SIRD. Are they here? You are here? Group 2. So group 2 इसके बाद you will be presenting. Group 3 is Shri Shamal Santra TRF से and Srimati Neeraj Chandla, Joint Secretary Himachal Pradesh से. Are you here, please? For group 4, Pallavi Kumar ma'am and Shri Rajiv Madan from SIRD, Punjab. Okay. Group 5 is BP Nirmala and Shri Pavitra Kalita. ये बैठे हैं. Group 6 is Satendra Kumar ji and Mallinath ji Kalshetty ji. And group 7 में Amrut Raj ji, group 7. Where is Amrut Raj ji from Kerala? Kila. Okay. So the point here is that आप सारे resource person just get your participant who want to present. Please understand that we have to present the presentation in 10 minutes. 7 मिनट्स के बाद आप रैप अप करना शुरू करेंगे एंड 10 मिनट्स के बाद द प्रेजेंटेशन विल बी ओवर। अगर आप पूरा प्रेजेंटेशन नहीं कर पाए, जहां पे भी आप होंगे, वी विल स्टॉप इट एंड वी विल स्टार्ट अनदर प्रेजेंटेशन। सो जस्ट टेल योर पार्टिसिपेंट जो यहां पे आगे प्रेजेंट करने वाले हैं, कीप इट ब्रीफ एंड स्टे ऑन टाइम। चाय के लिए द टी इज सर्व्ड आउटसाइड। हम लगातार 5 मिनट के बाद, अभी 12:10 12:15 पे विल स्टार्ट द प्रोसेस ऑफ प्रेजेंटेशन ऑफ ग्रुप फर्स्ट। यू कैन गो हैव योर टी, कम बैक, क्योंकि अगर हमने ब्रेक कर दिया तो फिर सारों को इकट्ठा करना मुश्किल है। सो 5 minutes, no, we will not be breaking for tea. So people can go out, have tea, come back. And it doesn't mean everybody should go out and have tea. बारी बारी जाके पी के आ जाएं सारे एक साथ।
I think a lot of people have already taken tea. Last 30 minutes I have seen a lot of your queue. So एक तो my request is that whoever people have taken tea, please come in. And whoever not taken, by rotation you go and take tea. We are not breaking up because there is, otherwise you will be delayed and the lunch will be at 3 p.m. है ना, तो we don't want that. We will start the group 1 presentation. Who is the group 1?
Group 1
you be ready within next 10 minutes. If you have not taken tea, go and take tea immediately.
रेडी है, कोई बात नहीं
है ना। So
वहाँ पे टी वालों को भी कहता हूँ कि वहाँ से जो लोग पी गए हैं,
हाँ, उनको बाहर अंदर, एक तो पहले you just see people outside, they get them inside. There are 1,000 people outside. We have taken tea and all. They should come and next 5-10 minutes we will start.
We'll start in 5 minutes. Adjust చేసుకోండి. అక్కడ చూడండి. सारे भी जल्दी तो ये सर बोल रहे स्टार्टिंग ब्रेक किसने दिया रेडी सर, लेकिन वो ऑटोमेटेड है, रोबोट है।
స్టార్ట్ చేయండి. 10 నిమిషాలు ఇస్తుంది. దీంట్లో వచ్చాయి మేడం సార్.
Okay, fine, chalo, fine, anyway.
ఏం చెప్పండి వెళ్ళి
అందరికీ నమస్కారం. Namaskar to all dignitaries here. So the first issue in our presentation is topic role of Gram Panchayat in preventive measures for communicable and non-communicable diseases. We are representing from Andhra Pradesh. Communicable and non-communicable diseases. Slide please. First slide. Major health issues: fever, cough, chikungunya, malaria, dengue, conjunctivitis, generic pain. Malaria, many breeding sources for mosquitoes. First slide please. Many breeding sources for mosquitoes can be easily preventable. HIV, AIDS. Currently, one-day program per month is conducted for high-risk populations. This can be amplified. Dengue. Staff are not trained, needs to training. Tuberculosis, awareness and training needed. Kidney diseases in certain parts of the state like Uddanam in Srikakulam district requires special attention. Non-communicable diseases, diabetes, hypertension, asthma, obesity, alcoholism and drug abuse. Mental health problems, depressions. Current role of Gram Panchayatis in addressing health issues. As regular cleaning of water sources of prevent waterborne diseases is done. Supporting chlorinization of water sources. Supporting the state government in creating awareness for health camps. NCD screening to identify hypertension and diabetes. Some panchayatis are indirectly involved for conducting health nutrition days. Panchayatis are involved with health and wellness centers as part of Jan Arogya Samitis. Supporting chlorinization of water sources. Friday, we conducted dry day observance in many Gram Panchayatis to prevent mosquito breeding. HIV, AIDS, currently one-day program per month is conducted for high-risk population. This can be amplified. Tuberculosis, sputum test needs to be conducted regularly needed. Sanitation surveys can be done. Facilities are available, but this needs to be used. Next slide. Best practices in Gram Panchayatis in mitigating the health issues. Family doctor concept to all population villages, periodical screening, testing, reporting, periodic health checkups and follow-up actions implementing successfully in all panchayatis. Implementation of regular health checkups through Jagananna Arogya Suraksha covering all Gram Panchayatis periodically. Periodic fever survey to identify vector-borne fevers and prevent endemics. IEC activities such as usage of mosquito nets, regular home cleaning, premises cleaning and taking food safety measures, creating awareness in people about physical and mental activities like yoga, sports, ardhamandra, etc. Regular habit of hand washing, compulsory usage of individual households, latrines, IEC activities like taking boiled water, fresh prepared hygienic food. Next slide. Expected support from the state, district, block administration. Clap Mitra. Clap Mitra we call in Andhra Pradesh sanitary workers remuneration. Training and capacity building of functionaries at Gram Panchayat level. More concerned and coordinated community engagement efforts. Waste segregation is done at households and village level. But this needs to be scaled up to all families. Policy measures of banning plastic. Exposure visits to other model Gram Panchayatis on health and sanitation issues. Lack of adequate side drains is a main issue which leads to water stagnation and increased list of malaria and dengue. need to funds for preventive measures such as bleaching, chlorination of water sources, and management of open drains. Low cost, no cost techniques to deal with grey water are to be explored. Proposed engagements for GP in prevention and management of health issues. GP should be oriented to deal with the statutory provisions available in the state Panchayat Raj Acts and Health Acts. 100% coverage of health insurance, continuous training and capacity building of ground level medical and paramedical staff. CSR initiatives and public-private partnerships must be promoted at Gram Panchayatis level to develop a comprehensive and convergent health villages. Expected support, convergence with line departments. Next slides. Village health sanitation nutrition committees needs to be strengthened. More regular involvement is required. Accountability of all participants should be ensured. Reorientation of village and health sanitation nutrition committees is needed. Coordination among panchayatis and line departments on preventive health measures should be ensured by the district administration. Support from veterinary and agriculture, horticulture departments for the development of One Health concept. Role of SIRDs, Panchayat Raj training institutions in capacity building of PRIs, ERs to address the health issues. Regular training programs to be conducted to all village level line departments like ASHA and Anganwadis. Promotion of training to Panchayat staff in identification and screening of lifestyle disorders like breast cancer identification, obesity. Imparting technique trainings to use latest developments like telemedicine to Panchayat level staff. WASH units should be set up in the SIRDs, ETCs to promote regular trainings. Next slide, please. Suggestion and recommendations. There the maximum 3 has been given in this group. Funds could be earmarked for social, physical and mental health. Example, parks, walking tracks, greenery, etc. During any future epidemics, Panchayat resources can be used for isolation if needed, spending of Central Finance Commission funds, health sector components through Panchayat Raj institutions. Thank you one and all. Ma'am, this is from our side. As our mentor, Commissioner Panchayat Raj Ma'am, usually says that health is a way of life. Arogyam ఒక జీవన విధానం అని చెప్పి మా కమిషనర్ పంచాయతీ మేడం చెప్తూ ఉంటుంటారు. పంచాయతీస్కి ఫండ్స్ ఇచ్చినా, గవర్నమెంట్స్ ఫండ్స్ ఇచ్చినా, లేక సర్పంచ్ ఎంపవర్ అయినా అవ్వకపోయినా ఇండివిజువల్స్ ఎప్పుడూ కూడా హెల్త్ జీవన విధానాన్ని అందరూ కూడా భావించాలని చెప్పి మనస్ఫూర్తిగా కోరుకుంటూ ఐ క్యాన్లీ థ్యాంక్స్ ఎవ్రీ వన్ టు గివ్ మీ అన్ ఆపర్చునిటీ టు ద ఆంధ్రప్రదేశ్ ద ప్రజెంటేషన్ వన్. మేడం థ్యాంక్ యూ మ్యామ్. థ్యాంక్ యూ వన్ అండ్ ఆల్.
Thank you so much. And on this note, can we have Group 2? The speaker from Group 2 on stage, please.
I am Anand, OSD Panchayats. Good afternoon to all. Topic given to us is availability and accessibility of quality healthcare services, and Group 2 comprised of officials from PR and RD Department, Medical and Health Department, public representatives like Sarpanchas and Mandal Parishad Presidents, and we had a fruitful deliberation session, and the following are the group's observations. First slide, please. What are the major concerns in quality healthcare services? And these are the suggestions offered by our group members. Next one, please. Next slide, please. Next one. Yes, this one. So major concerns are lack of coordination among line departments and public representatives and the public in general, inadequate resources, both physical and financial, and inadequate human resources as well, lack of access to public health services due to distance, terrain, etc., attitudinal barriers in the public like avoidance of modern medicines and all, misinformation and lack of information about accessibility of health services, social accessibility like exclusion of certain groups due to social stigma, gender issues and discrimination. Next slide, please. Current role of Gram Panchayats in addressing quality healthcare services. Ensuring 100% immunization and vaccination. Previous slide, please. Yes. Right. Next. Previous slide, please. Supply of safe drinking water, village sanitation, SWPs. And the next one is attaining ODF and ODF plus villages, organizing health camps, door-to-door campaigns through volunteers, then information dissemination to public through Gram Sabhas, accessibility to PHCs by providing infrastructure, allocation of Gram Panchayat funds to health and sanitation, ensuring people participation in public health activities and survey, strengthening all functional committees of GPs with people's representatives for convergence with line departments. So these are some of the activities which are taken up by Gram Panchayats towards maintaining better health services in the villages. Then 3 best practices of Gram Panchayats in mitigating issues in quality healthcare services. First one is by creating awareness through local cable services on diabetes and other communicable diseases with special emphasis on diet chart and healthy lifestyle. Chilamattur Mandal, this Gram Panchayat in Satyasai district, Sarpanch is playing a proactive role in disseminating this information. Similarly, establishment of village isolation centers during COVID with the cooperation of local donors, and this was done in Peddapuram Gram Panchayat, Kakinada district. And one Sarpanch in Satyasai district is paying his own amount for providing travel and accommodation expenses to their villages for availing eye care facilities in Bangalore. So these are the 3 best practices which various Sarpanchas are already following and which can be replicated by other Gram Panchayats as well. Next slide, please. Proposed engagement for GP in prevention and management of quality healthcare services. First one of the major preventive activity which can be done by the Gram Panchayat is desilting of drains, vector control operations, implementation of community radio, then GP to provide electronic vehicle cooling chamber for better delivery of vaccination to inaccessible areas. This was one good suggestion given by one medical employee from our group. He suggested that due to lack of last mile connectivity, they are unable to take the vaccines to the farthest areas in that particular village. So this was one very good suggestion. There are some electric vehicles which have a cooling chamber which can help the villagers in carrying the vaccines to the farthest part of the Gram Panchayat. Then the last one is integration of education and ICDS departments along with Gram Panchayats in offering and upgrading the services offered by the Gram Panchayat in general. Next slide, please. Expected support from state, district and block administration. Strengthening of diagnostic services by equipping the district and block level with the advanced machinery like MRI and other diagnostic equipment. This will prevent the exploitation of villagers by the overeager private health sector practitioners. So this was another good suggestion given by the group member. To improve financial resources for maintaining the PHC's medical services and to integrate alternate medical services like Ayush into the PHCs and wellness centers. So promotion of alternative medicines like Ayush and homeopathy was suggested by one group member. This can be explored by various departments. Expected support and convergence with line departments. Convergence with NREGA department. One member suggested that if we can promote piggery units and take it up as one of the shelf of work in under Narega. This helps a lot in maintaining sanitation in the village. Similarly, creating infrastructure at Gram Panchayat level like walking, cycling tracks, recreation parks, thereby mitigating lifestyle diseases. Construction of community soap pits, which was already mentioned by our Honorable Chief Secretary in the morning. So villages which are where the population is less than 1,000 and all, we can easily manage the liquid waste resources through construction of soak pits at the house level. So this was one suggestion given by one of the members. Similarly, scientific disposal of biomedical waste and hazardous waste at the village level. Then enrollment of daily wage labor in health insurance with coordination with labor department. Like Eastern, they have one insurance policy. Similarly, for health insurance, if we can give some kind of a card through the labor department for unorganized sector, that helps a lot in improving the health services delivery at the village level. So this is one of the important suggestions offered by the group member. Then promoting organic food products at village level by providing necessary marketing tie-ups so as to promote healthy dietary activities. This is one of the important suggestions offered by our group member. Next slide, please. Role of SIRDs and PRTs in capacity building of PRIs and ERs to address the quality health care services. Training should be given to all healthcare workers for providing better healthcare services like NCD, geriatric care, etc. Creating high-quality videos on preventive health measures by experts and GPs to play a proactive role in dissemination of these videos at the village level. To arrange community-level workshops involving public representatives and public in PHC through SIRDs. Finally, suggestions and recommendations offered by the group. Sharing of beneficiary experiences on availing the healthcare services at village level in Gram Sabhas, public gatherings, and social media. Similarly, extension of telemedicine services at household level by strengthening digital infrastructure. Already we have a robust health delivery mechanisms at the village level through various agencies like be it the volunteer system or our wellness centers or even the village secretariat services. So if we can make telemedicine a part of that, then definitely we can offer quality service, medical services at the village level. And this is one of the important suggestions which was offered by our group member. Gram Panchayats can play a proactive role in overcoming the issues such as vaccine hesitancy, attitudinal change, in availing the public medical services. So these are the three suggestions which were offered by our group members. So with this presentation, I thank you all, and I am open to any question and answer session. Thank you. Yeah. Thank you, Kanchanji.
Thank you so much, sir, for a wonderful presentation. I would like to call upon Group 3 now. The theme was addressing issues of the malnutrition for women, children and adolescents. I would like the speaker to kindly come on the stage, please. The speaker of Group 3. The team comprised of Uttar Pradesh, Himachal Pradesh, Madhya Pradesh and Jharkhand.
सभी को नमस्कार। उत्तर प्रदेश, मध्य प्रदेश, झारखंड और हिमाचल से हम लोगों ने कल जो हमारा इशू था एड्रेसिंग इश्यूज इन माल न्यूट्रिशन इन वुमेन, चिल्ड्रन एंड एडोलेसेंट, इस पे डिस्कशन किया। जो हम लोगों ने चीज़ें हम लोग को निकल के आई वो प्रेजेंटेशन में है। नेक्स्ट प्लीज। अच्छा ठीक। What is the major concern in malnutrition? क्या हमारी समस्याएं आ रही हैं माल न्यूट्रिशन जो हमें कुपोषण है उसके संबंध में, तो सबसे बड़ी समस्या जो आती है वो है अर्ली मैरिज की, जो हम लोग के डिस्कशन के पॉइंट में रहा। जो कम उम्र में बच्चियों या महिलाओं की शादी हो जाती है और कम उम्र में ही जब वो गर्भवती हो जाती हैं, माता बन जाती हैं, उन्हें प्रॉपर पोषण नहीं मिल पाता, तो इस कारण से महिला तो गर्भवती है, वो तो कुपोषण का शिकार होती ही है, उसकी अगली पीढ़ी जो है, बच्चा है, वो भी कुपोषण का शिकार होता है। ये हम लोग का डिस्कशन का पहला पॉइंट रहा। दूसरा पॉइंट ये रहा कि मल्टीपल चाइल्ड बर्थ होते हैं। यदि एक माँ है, कम ड्यूरेशन पे लगातार चाइल्ड बर्थ हो रही है, ज़्यादा बच्चे पैदा हो रहे हैं, तो उसमें भी दिक्कत आती है और न ही गर्भवती महिला जो है उसको प्रॉपर न्यूट्रिशन मिल पाता है, न ही बच्चों को। तीसरा पॉइंट है एनीमिया का। एनीमिया जो है महिलाओं में बड़ी मात्रा में देखने को मिलता है और बहुत सारी महिलाएं इसके संबंध में जांच भी प्रॉपर समय से नहीं हो पाती है। तो एनीमिया जो है माल न्यूट्रिशन के संबंध में एक महत्वपूर्ण बिंदु बन के आया, चाहे वो गर्भवती महिलाएं हों चाहे किशोरियां हों, सभी में एनीमिया की कारण एनीमिया काफ़ी देखने को मिलती है, जिसमें हीमोग्लोबिन और ब्लड की कमी के कारण माल न्यूट्रिशन की समस्याएं रहती है। लो वेट फॉर हाइट एंड लो हाइट फॉर एज, जो BMI हमारा कैलकुलेशन होता है हाइट, एज और वेट के हिसाब से, उसमें भी हम लोगों को ये देखने को मिलता है कि ये कम रहता है, इसका भी इश्यूज लगातार आते रहते हैं। मेजरमेंट ऑफ पैरामीटर ऑफ ग्रोथ एंड हेल्थ नीड टू बी मोर इंक्लूसिव। नेक्स्ट पॉइंट, लैक ऑफ विटामिन एंड मिनरल्स। बहुत सारी जो गर्भवती महिलाएं हैं, बच्चियां हैं और एडोलसेंट हैं, उनमें समय से न ही प्रॉपर अवेयरनेस हो पाती है, न ही जांच हो पाती है, जिस कारण से यह पता भी नहीं चल पाता कि किन किन विटामिन, मिनरल्स और एमिनो एसिड या किन जरूरी चीज़ों की कमी है। तो इससे अगली पीढ़ी को भी दिक्कत होती है और बच्चों में भविष्य में जा करके भी समस्याएं उत्पन्न होती हैं। फूड एडल्ट्रेशन एंड एक्सेसिव यूज ऑफ केमिकल फर्टिलाइजर्स, ये भी वर्तमान में काफ़ी देखने को मिल रहा है, जिससे भी डायरेक्ट इनडायरेक्ट रूप से कुपोषण की स्थिति आती है। हाइजीन एंड सैनिटेशन प्रैक्टिसेस भी ठीक से ना होने के कारण डायरिया, अन्य बीमारियां आती हैं, जिसके कारण से माल न्यूट्रिशन एवं अन्य दिक्कतें बच्चों में, महिलाओं में काफ़ी देखने को मिलती हैं। गार्बेज डिस्पोजल एंड सॉलिड वेस्ट मैनेजमेंट को भी ज़्यादा प्रभावी बनाना पड़ेगा, जिससे हम लोगों को जो माल न्यूट्रिशन है उसको रोकने में मदद मिल सके। वेस्ट वाटर मैनेजमेंट भी हम लोग के डिस्कशन में एक महत्वपूर्ण बिंदु रहा। यदि वेस्ट वाटर का मैनेजमेंट ठीक से नहीं होगा, कंटेमिनेटेड वाटर यूज किया जाएगा, तो उससे भी बीमारियां एक्सेसिव मात्रा में होंगी ग्रामीणों को, जिससे दिक्कतें बढ़ेंगी और पोषण में समस्या आएगी। इट्स इम्पॉर्टेंट टू ब्रिंग बिहेवियरल चेंज, ये हम लोग के एजेंडा में काफ़ी महत्वपूर्ण बिंदु के रूप में आया। जो बिहेवियर है उसको परिवर्तित करना पड़ेगा, लोगों को पोषण के संबंध में जागरूक करना पड़ेगा और जो व्यवहार परिवर्तन है वो आगे देखने को आवश्यक रहेगा। लैक ऑफ अवेयरनेस इन माल न्यूट्रिशन, ये भी हम लोग के एजेंडा में मतलब डिस्कशन में काफ़ी महत्वपूर्ण बिंदु के रूप में रहा। लोगों को माल न्यूट्रिशन के बारे में जानकारी भी कम है और हमें फूड हैबिटेट में भी चेंजेस करने की आवश्यकता पड़ेगी।
आगे नमस्कार, मैं कुपोषण को दूर करने के बारे में आप सबको जानकारी दूंगा। सबसे पहले हम पंचायतों में कमेटियां बनाते हैं और गर्भधारण व स्तनधारण महिलाओं के लिए आशा वर्कर के जरिए समय पर टीकाकरण कराना, उनकी देखरेख करना, और आंगनबाड़ी सेंटर, अवेयरनेस सेंटर का जरूरी होना व डॉक्टर और दवाइयाँ वहाँ जरूरी होना चाहिए। पानी की टेस्टिंग हर वीक में होनी चाहिए और नशा मुक्ति को में कमी लाना चाहिए। GPDP बनाने के समय ग्राम सभा में स्वास्थ्य विभाग व महिलाएं बाल विकास को शामिल किया जाए। कुपोषण दूर करना, ग्राम सभा के माध्यम से कुपोषण में कमी लाना। हम ग्राम सभा के में आंगनबाड़ी व आशा वर्कर को बुला के उनके विभाग के हर एक अलग अलग जानकारी लोगों को, महिलाओं को दी जाए और 30 लोगों की GPDP बनाने के समय उनकी मदद से कुपोषण में दूरी कर सकते हैं, जिसमें कमेटी में हेल्थ सेंटर, आंगनबाड़ी सेंटर, आशा वर्कर, स्कूल के अध्यापक और वन विभाग, स्वास्थ्य विभाग, PWD, वन विभाग और इसमें जितने भी हमारे पंचायत के अंदर सरकारी कर्मचारी होते हैं, सरकारी डिपार्टमेंट आते हैं, इन सबको इकट्ठा करके एक 30 लोगों की कमेटी बनाते हैं ताकि हमें पता चले कुपोषण के बारे में कि कहाँ कहाँ ये चीज़ जा रही है। बाकी ग्राम पंचायत क्या कर सकती है इसके लिए, ये आगे हमारे भाई झारखंड से बताएंगे। जय हिंद।
आप सभी को नमस्कार और झारखंड की ओर से झारखंडी जोहार। जैसे कि कुपोषण को कम करने के लिए जो बेस्ट प्रैक्टिस है, सर्वोच्चम प्रथाएं में से एक प्रथा हमारे झारखंड की ओर से जो है वो है पोषण पखवाड़ा के तहत जागरूकता अभियान फैला के महिलाओं को जिसमें सहभागिता उपस्थित रहती है। ये बहुत ही महत्वाकांक्षी योजना है। उसमें हम लोग सबसे पहले जीपीडीपी प्रक्रिया में चिंताओं को दूर करने के लिए जो प्रस्ताव है, सबसे पहले हम लोग अस्थायी समिति के तहत महिला शिशु एवं सामाजिक कल्याण समिति में जो प्रस्ताव आता है उसको ग्राम सभा में लेते हैं और ग्राम सभा के थ्रू से इसको दूर किया जाता है। बाजरा का उपयोग एवं प्रसार पोषण पड़ाव के तहत इसका कार्य किया जा रहा है। सभी स्कूली बच्चों को बीएमआई गणना के तहत कार्य किया जा रहा है और इसका प्रस्तावित जो नियुक्ति है कुपोषण रोकथाम के लिए, उसमें जितने भी पीआरआई मेंबर्स हैं उसके बीच बेहतर समन्वय कैसे स्थापित हो। जैसे हमारे झारखंड में ग्राम पंचायत में अभी प्रत्येक माह समीक्षा बैठक होता है। जितने भी विभाग हैं संबंधित विभाग के साथ प्रत्येक माह समीक्षा बैठक होता है और जो समीक्षा बैठक में प्रस्ताव आता है उसका एक कॉपी प्रखंड से लेकर जिला को उपलब्ध करा जाता है। ये बहुत ही कारगर साबित हो रही है। उसमें कुपोषण को जितना भी डाटा रहता है वो डेटा को आईसीडीएस द्वारा पंचायतों के साथ साझा किया जाता है और इसको पंचायत ट्रैक कर सकती है। इसमें बेहतर पीआरआई सीबीओ का अभिसरण होता है और अधिकारियों को प्रत्येक ग्राम पंचायत में कुपोषित बच्चा जो है उसको गोद लेने का प्रथाएं चल रहा है। मतलब हमारे यहाँ अधिकारी कुपोषित जो बच्चे हैं उसको एक बच्चे को गोद लेते हैं। ये बहुत ही कारगर साबित हो रहा है। इसके आगे धन्यवाद।
ठीक। जो स्टेट डिस्ट्रिक्ट और ब्लॉक से एडमिनिस्ट्रेशन के माध्यम से क्या सपोर्ट किया जा सकता है गांव में, उसके संबंध में जो हम लोग की स्लाइड है उसके संबंध में जो कुछ हम लोग के डिस्कशन के बिंदु निकल के आए हैं उसमें पहला रहा मोर माल न्यूट्रिशन ट्रीटमेंट सेंटर्स हम लोग को बनाना चाहिए। जैसे उत्तर प्रदेश में एनआरसीज हैं, न्यूट्रिशन रिहेबिलिटेशन सेंटर, अन्य भी स्टेट में इस तरह के कार्य किए जा रहे हैं, उनको और बढ़ावा देना चाहिए और लोगों में उसके संबंध में जागरूक भी करना पड़ेगा कि लोग अपने बच्चों को जो सैम बच्चे हैं जो कुपोषण के शिकार हैं जिनकी बीएमआई कम है उनको हम ज़्यादा से ज़्यादा उस सेंटर्स तक ले जा सकें और उसमें जो उनके पोषण में सुधार है उसको हम लोग ऐड कर सकें। मोर रिसर्च एंड डेवलपमेंट टुवर्ड्स हेल्थ एंड न्यूट्रिशन इश्यूज, माल न्यूट्रिशन इशू पे हमें रिसर्च की और आवश्यकता है और इंक्रीजिंग बजट फॉर रिसर्च इन माल न्यूट्रिशन एंड जीपी लेवल। हम लोगों ने कल इस पर काफ़ी डिस्कशन किया। जो विकसित देश हैं उनके संबंध में जो वहाँ का बजट है उसका एक बड़ा हिस्सा रिसर्च पे जाता है माल न्यूट्रिशन और हेल्थ इश्यूज़ के लिए, जबकि हम लोग का जो डेवलपिंग नेशंस हैं उसमें जो बजट का हिस्सा है वो उनके 10 गुना से भी काफ़ी कम होता है। तो हम लोगों को थोड़ा सा रिसर्च इत्यादि के फील्ड में बजट का इशू बढ़ाना पड़ेगा और रिसर्च फील्ड को आगे बढ़ाना पड़ेगा जिससे हम लोग माल न्यूट्रिशन और हेल्थ में थोड़ा और अच्छा कर सके। ऐसा नहीं जैसे कोविड इत्यादि के समय में भी हम लोगों ने चीज़ें तेज़ी से की थी तो उसमें अच्छे हम लोग को रिजल्ट आए और हम लोगों ने विकसित देशों से कंपटीशन किया था। एक्टिवेशन हम लोग को ब्लॉक लेवल की जो कमिटीज़ हैं उनको अच्छे से एक्टिवेट करना पड़ेगा। Nutrition food for all children, special packages for food for malnutrition can be made and distributed to the school and children. Last slide है जो SRID, PRTs और कैपेसिटी बिल्डिंग के लिए जो इंस्टीट्यूट बने हैं उनमें क्या किया जा सकता है। तो रिपीटेटिव रिफ्रेशर ट्रेनिंग हम लोग को करानी चाहिए जिसमें हेल्थ और माल न्यूट्रिशन के संबंध में जो भी तैयारियां हम लोग को करनी है उसके संबंध में सभी को एड्रेस किया जा सके। ट्रेनिंग SRD और प्रिट में जो हम लोग कर रहे हैं वो एम जो होना चाहिए डिपार्टमेंटल इंफॉर्मेशन बट आल्सो एड्रेस स्पेसिफिक हेल्थ रिलेटेड टॉपिक्स एंड साइंटिफिक मैनर्स. नेक्स्ट पॉइंट है डू मोर ट्रेनिंग्स ऑफ आशा एंड आंगनवाड़ी वर्कर्स एंड आल्सो इंक्लूड इफेक्टिव रिप्रेजेंटेटिव इन द ट्रेनिंग्स. लास्ट पॉइंट है IIT और IIM जो है हम लोग के उनमें जो ट्रेनिंग हो रही है उसमें PRI का जो रिप्रेजेंटेशन है उनको भी हम लोग सम्मिलित करें और बजटरी एलोकेशन है उसमें भी हेल्थ की एक्टिविटीज़ को और बढ़ाएं. थैंक यू.
Now, before we call upon Group 4, I would like you all to kindly watch this small video from Amroha, Uttar Pradesh.
स्वस्थ शरीर से स्वस्थ जीवन और स्वस्थ जीवन से स्वस्थ समाज जुड़ा हुआ है. स्वास्थ्य के इसी महत्व को समझते हुए सतत विकास लक्ष्यों की 9 थीमों में से एक स्वस्थ गांव थीम उत्तर प्रदेश की ग्राम पंचायतों को स्वस्थ जीवन से जोड़ रही है. स्वस्थ गांव के सपने को साकार करती जनपद अमरोहा की जमुना खास ऐसी ही एक ग्राम पंचायत है. पंचायती राज विभाग उत्तर प्रदेश के साथ कई सरकारी और गैर सरकारी संस्थाओं के प्रयासों से अब इस ग्राम पंचायत में बेहतर स्वास्थ्य सुविधाएं विकसित हो रही हैं.
स्वास्थ्य के आधार पर यह ग्राम पंचायत एक आदर्श ग्राम पंचायत बन रहा है.
ग्राम पंचायत में मौजूद ग्राम स्वास्थ्य, स्वच्छता और पोषण समिति द्वारा आवश्यक बैठकें करके स्वास्थ्य, स्वच्छता और पोषण के विषयों पर चर्चा होती है. स्वास्थ्य विभाग द्वारा ग्राम पंचायत में बेहतर स्वास्थ्य सुविधाओं के लिए उपलब्ध करवाई ₹10,000 की धनराशि को भी इस ग्राम पंचायत ने अपनी कार्य योजना में शामिल करके इस धनराशि का सदुपयोग किया है. यहाँ संचारी रोगों की रोकथाम के लिए सभी जरूरी उपाय किए जा रहे हैं. तो वहीं PHC, CHC स्वास्थ्य केंद्रों में टेलीमेडिसिन की सुविधाएं भी ग्राम पंचायत में स्वास्थ्य सुविधाओं को बेहतर बना रही हैं.
हमने अपनी पंचायत को स्वस्थ पंचायत बनाने का संकल्प लिया है. हमारे PHC सेंटर पर सन 2022-23 में लगभग 90% अच्छी तरह से हो चुके हैं और 750 आयुष्मान कार्ड जो 5 लाभार्थी थे उन्हें उपलब्ध कराए जा चुके हैं. हमारी पंचायत ODF प्लस घोषित हो चुकी है. हमारे यहाँ कोई भी व्यक्ति खुले में शौच को जाता दिखाई नहीं देता. यहाँ कोविड टीकाकरण 95% तथा 1 साल तक के बच्चों का टीकाकरण 96% तथा गर्भवती महिलाओं का टीकाकरण 100% कराया जा चुका है. आज हमें देखकर खुशी होती है कि हमारी ग्राम पंचायत कुपोषण से पूरी तरह मुक्त हो चुकी है. स्कूल में पौष्टिक मिड डे मील, स्वच्छ एवं सुरक्षित पेयजल तथा कूड़े के उचित प्रबंधन ने हमारी ग्राम पंचायत को पूरी तरह से बदल दिया.
ये स्वास्थ्य के प्रति जागरूकता का ही कमाल है कि वर्तमान में यहाँ मातृ, शिशु और बाल मृत्यु दरें 0 हैं. ये बात अब यहाँ ग्रामीणों को समझ में आ चुकी है कि जन्म के 6 महीने बाद बच्चों को स्तनपान के साथ साथ घर पर ही पौष्टिक आहार दिया जाए, जिससे बच्चों का शारीरिक और मानसिक विकास पूरी तरह से हो सके. स्वस्थ गांव थीम के आधार पर यहाँ घरों में पौष्टिक, कम लागत वाले स्थानीय रूप से उपलब्ध अनाज और सब्जियों के प्रयोग को बढ़ावा दिया जा रहा है. यहाँ SHG, VHND और दूसरे प्लेटफॉर्मों के माध्यम से माहवारी और साफ सफाई के लिए ग्रामीणों को महत्वपूर्ण जानकारियां और सेवाएं मुहैया करवाई जा रही हैं.
छोटा परिवार ही एक सुखी परिवार होता है. ये बात हम अपनी ग्रामीण बहनों को ग्राम पंचायत के माध्यम से समझा रहे हैं. हमारी ग्राम पंचायत में कुछ महिलाओं ने मिलकर एक समूह बनाया जिसके माध्यम से गांव की बेटियों को सैनिटरी नैपकिन दी जाती है और उन्हें स्वच्छता के प्रति जागरूक किया जाता है.
उत्तर प्रदेश के यशस्वी मुख्यमंत्री श्री योगी आदित्यनाथ जी के कुशल नेतृत्व में पंचायती राज विभाग उत्तर प्रदेश की प्रशिक्षण कैंपों के आयोजन और प्रेरणा का ही नतीजा है कि प्रदेश की ग्राम पंचायतें सतत विकास लक्ष्य की स्थानीयकरण की दिशा में कार्य करते हुए स्वस्थ भविष्य का निर्माण कर रही हैं. स्वस्थ गांव से बन रहा स्वस्थ प्रदेश है. आर्थिक विकास का ये बड़ा संदेश है.
Thanks for the lovely video. Now moving ahead, I would like to call upon the speaker of Group 4. The theme was palliative care for elderly and people with special needs, and the teams comprised of Chhattisgarh, Jammu and Kashmir, Punjab, Haryana, and Rajasthan. So I would request the speakers to kindly come on stage for their presentation, please. And I would request, meanwhile, all of you to kindly maintain the decorum of the program and kindly be seated. Thank you.
A very good afternoon to everybody. As already mentioned, we were the teams from Haryana, Rajasthan, Chhattisgarh, J&K and Punjab. So the topic was on the palliative care. What are the major concerns? Since in India we have a life expectancy has increased and we have a lot of aging population. So the major concerns that we observed is a mental health issue, which is a major in the elderly, especially in those who are living lonely. And non-communicable diseases like rise of hypertension, diabetes, eye-related problems, cataract, vision development, and auditory problems are also cause of concern in the elderly population. Cancers are also on rise in the elderly population, and many mobility issues because of the joint pains, because of arthritis. These are the issues that were identified by the group as a major cause of concern in the elderly. So what can the Gram Panchayats do in addressing these problems or health issues? So regular health checkups, as has already been told since morning's discussions, that there is a great role of health and wellness center. So regular health checkup and monitoring by involvement of Gram Panchayat with the CHO has to be ensured, and regular health mandatory screening for all the NCDs and mandatory screening for the cancer is to be done, and Gram Panchayat can coordinate with the health department at CHO Health and Wellness Center. Similarly, creation of a special place or creation of some hub or activity or some identified center where these elderly people, they can get together and talk out their issues regarding the mental health can be created by the Gram Panchayats. Nutrition awareness already is there, but regular activities of yoga in the health and wellness center and counseling centers for the mental health problem. The counseling can be done both by the way of teleconsultation or we can call in like some psychiatrist or some mental health expert or somebody once a month into the village to look into the mental health issues. Then there is a health plan that has to be developed in partnering with the health department and involvement of NGOs. Many small NGOs are working at village levels. We can rope in the facilities of those NGOs and work for the health of elderly. And for the palliative care also, I would like to mention that for the palliative care, sometimes the patients are immobile. They are in the last stages of cancer. So we can take help of these NGOs. They can go to their places. Then starting off the elderly sports melas. Already in Punjab, we are having the sport mela for elderly people, a Kila Raipur games. So if we can involve those elderly people in some sort of sports, they need to be not very strenuous, but some kind of activity that can make creations. And then provision of wheelchairs, physiotherapy, and a dedicated health day celebrations for the elderly is one of the another thing that Gram Panchayat can coordinate. Then while we were discussing, we were knowing the best practices, and one state from Rajasthan, from one village, we were told that there is a best practice that they had an ambulance from MP-led fund, but they could not run the ambulance. So they, Gram Panchayat pitched in with the funds, and they are providing fuel and driver's salary, and they are using that ambulance. Then another Gram Panchayat at Rajasthan, they have created a special ward for elderly at their PHC, and the Gram Panchayat is they are paying rupees 1,000 extra honorarium to their ANMs, and they are working in the evening 2 to 4 hours, and they are taking care of their elderly population and the palliative care. Similarly, in Punjab, now we are reinventing the old idea of Sath. We used to have a community program called Sath, where every old person from the village, they would come together, chat for 2 to 3 hours, and they would discuss their problems, their family issues. So that kind of Sath development is now being done again at Punjab. And then in Punjab, we have one village in Bathinda. They have a library, and they have dedicated one day for the elderly. On Wednesday, they are calling all the elderly to the library and making them help recreate the activities. Next, please. Proposed engagement for Gram Panchayat in prevention and management of health issues. First thing is to line with the health department, and second is to line with the water and sanitation department also, and then to develop a plan for healthy villages by doing a regular meetings and focus on locally prevalent diseases. So every village might have a different set of diseases, so they have to actually focus on that. And then major health issues of the village should be charted out, and a timeline should be done how to address those issues. Then Gram Panchayat, if it is sufficient with funds, they can make a budgetary provisions for these issues. And then another is that we have to undergo the 100% Abha ID creation and Ayushman Bharat cards for eligible elderly and elderly population. And then expected support from the state, district block administration, that one dedicated day should be designated at the national, at the state level, so that the day for elderly care is, because we have various health days, but there is no day for the elderly care. So state can work on that. Then Senior Citizen Act has to be implemented at all levels. Old age pension remuneration is being given by various states, and various amounts are there. Some states are paying 1,500, some states are paying 2,000. So some sort of uniformity as per the old age pension can be reached upon. Then we can also conduct a survey for accurate estimation of the old age population. By having that survey data, we can link those schemes with the benefit schemes for the elderly. Then improvement of elderly in the Gram Panchayat meetings, VHSND, and other important things. There should be one representative from the elderly population, so they do not feel left out. And then provision of mobile health vans for the palliative care of the elderly, and provision of free medicines to the old age population at the doorstep. Delivery of the medicine can be ensured by the way of ASHA workers. Then expected support and convergence with the line departments. With the convergence with the health department, then implementation of the elderly palliative care, convergence with the NGOs working for the elderly care, and health department has to ensure the regular checkup and provision of free medicine and services to the elderly. So what is the role of SIRD or PRTIs in building? Government of India launched palliative care guidelines somewhere near COVID, but somehow the program has not been taken up. So regarding the national guidelines for palliative care, I think we can do the trainings at SIRDs in convergence with the block panchayats, and then we can create awareness on the legal rights of the elderly. Effective IEC, BCC campaigns and communication can be used to create awareness about the rights of the elderly, awareness of the health issues among the elderly, availability of services to the elderly. They should actually know what are their rights and what kind of services they are eligible to. My last slide is that these were the recommendations given by the group, that although provision of monetary benefits are there, but it is not at a same level. Different states are giving different. They wanted that there should be a raise in the monetary benefits under social security to the elderly. Compulsory health checkup and provision for the elderly. Then at sometimes they have property issues and other issues, they have to go to the government officers. So at the government officers, there should be a single window to address the elderly. And similarly in the hospitals also, there should be a separate line for the elderly above 65 so that they can be reached early, they can get treatment at the earliest. Then there's the enactment of Social Security Act in the country. It's a very over-ambitious, but the enactment of Social Security Act. Thank you so much.
Thank you so much. And before we move on to the next group, let us all watch this video on Healthy Village brought to you by District Sihor, Gram Panchayat Bilkisganj, Madhya Pradesh. Can we please have the video?
जिला सीहोर का ग्राम बिल्किसगंज सतत विकास लक्ष्यों की थीम टू स्वस्थ पंचायत के रूप में आज प्रदेश में अपनी विशेष पहचान रखता है। ग्राम पंचायत द्वारा स्वस्थ पंचायत के संकल्प को दृष्टिगत रखते हुए गुणवत्तापूर्ण सुविधाएं एवं सेवाएं जन जन तक पहुंचाने के लिए स्वयं की आय एवं सामुदायिक भागीदारी से कई मजबूत कदम उठाए गए। 100% टीकाकरण, संस्थागत प्रसव, पंचायत की किशोरी बालिकाओं में एनीमिया जांच एवं समस्त सरकारी योजनाओं का लाभ पहुंचाने के लिए पंचायत द्वारा विशेष कार्य योजना का निर्माण किया गया। सर्व सुविधा युक्त 30 बिस्तरों वाला सामुदायिक स्वास्थ्य केंद्र यहाँ उपलब्ध है, जहाँ आने वाले मरीजों का गहन अध्ययन कर इलाज किया जाता है।
आसपास के एरिया जो है 40,000 पॉपुलेशन को हम कवर करते हैं, जिसमें हम सारी सुविधाएं वाहन के माध्यम से और इमरजेंसी 108 के माध्यम से देते हैं। अगर हम किसी पेशेंट को रिफ़र करना होता है तो हम उनको रिफ़र करने के लिए फ्री में सर्विसेज प्रोवाइड करवाते हैं।
बीपी, शुगर व खून से संबंधित जांचों के साथ ही एक्सरे मशीन सुविधा भी उपलब्ध है। गर्भवती महिलाओं व नवजात शिशु का टीकाकरण भी कुशल कर्मचारियों द्वारा प्रतिदिन किया जा रहा है।
और यहाँ पे मतलब इलाज अच्छा होता है, जांचे माचे भी, दवाई गोली सब अच्छे से मिलती है, पूरी सुविधा, साफ सफाई सब अच्छे से होती है।
स्वास्थ्य केंद्र में साफ सफाई के लिए 24 घंटे कर्मचारी नियुक्त हैं। ग्राम पंचायत में आशा कार्यकर्ताओं को भी प्रशिक्षण समय समय पर दिया जाता है। आशा कार्यकर्ता घर घर जाकर गर्भवती महिलाओं को देखरेख के साथ खान पान के सुझाव और दवाई वितरण का कार्य कर रही हैं। एक स्त्री का स्वस्थ होना 2 परिवारों के स्वास्थ्य को सुरक्षित करता है। ग्राम पंचायत बिल्किसगंज में आंगनबाड़ी के माध्यम से बच्चों व गर्भवती महिलाओं को साप्ताहिक बैठक में स्वास्थ्य संबंधी जानकारी के साथ बच्चों के पौष्टिक आहार और नियमित उपयोग में लाने वाली दवाइयां भी दी जाती हैं।
यहाँ आंगनबाड़ी है, हमें कैल्शियम की गोली मिलती है, जो मतलब बच्चे के लिए भी अच्छी रहती है, हमारे शरीर के लिए भी अच्छी रहती है, कमजोरी महसूस नहीं होने देती।
सरपंच महोदया द्वारा विद्यालय स्तर पर साफ सफाई का विशेष ध्यान दिया जाता है। बच्चों के बीच शिक्षकों के माध्यम से स्वस्थ रहने के लिए क्रियाकलाप करवाए जाते हैं।
मेरी ग्राम पंचायत बहुत स्वस्थ ग्राम पंचायत है, इसको ध्यान देने के लिए हम सामुदायिक स्वास्थ्य केंद्र पे ध्यान दे रहे हैं, आंगनबाड़ी पे ध्यान दे रहे हैं और ग्राम वासियों पे भी ध्यान दे रहे हैं, ताकि वो इधर उधर कचरा ना फैलाए, गंदगी ना फैलाएं। स्वच्छ रहेंगे तभी स्वस्थ रहेंगे।
ग्राम पंचायत भवन में अधिकारियों के समक्ष सरपंच की उपस्थिति में स्वास्थ्य व स्वच्छ ग्राम जागरूकता बैठक का आयोजन किया जाता है तथा डोर टू डोर कचरा संग्रहण का कार्य भी दैनिक रूप से किया जा रहा है। स्वस्थ पंचायत से ही स्वस्थ राष्ट्र का निर्माण होता है। यशस्वी प्रधानमंत्री श्री नरेंद्र मोदी के संकल्प को साकार करते हुए प्रदेश के मुख्यमंत्री डॉक्टर मोहन यादव के मार्गदर्शन में ये प्रयास जारी रहेंगे।
Thank you for this wonderful video, and now I would like to call upon the speakers of Group 5. The theme was role of Gram Panchayats in combating lifestyle diseases, and the team comprised of Assam, Arunachal Pradesh, Manipur, Meghalaya and Tripura. Can we give a huge round of applause for the team, please? Group 5.
তো এইটার মধ্যে দাঁড়ানোর কথা নাই শুধু দেওয়া আছে Yeah, can I have the video? The slide. A very good afternoon to all of you. Actually, we are representing some states. Yesterday, we had a group discussion about a topic. So, we are going to discuss and share all our views, whatever we have discussed in yesterday's session. So, our topic was role of Gram Panchayats in combating lifestyle disease, that is hypertension, diabetes, asthma, etc. So participating states were Meghalaya, Tripura, Arunachal Pradesh, Assam and Manipur. So lifestyle diseases are various ailments, and primarily these are the ailments which are caused due to various habits and various other factors. So diseases like diabetes, asthma, and other things, these are the causes, root causes, and the various factors which are basically resulting into these lifestyle diseases are, some are controllable factors and some are uncontrollable factors. So about the uncontrollable factors, these are our diet, our body weight, the level of physical fitness or physical activities, and smoking, drinking, abuses, etc. Then uncontrollable factors are age, then race, gender, and most importantly, the heredity. So coming into the next part, what are the major concerns about these lifestyle diseases? So first of all, first one is changes in lifestyle patterns. We all know that earlier all of us were farming basically. Due to farming, we are toiling hard in our fields and everyone. But right now we are just shifting to some other various livelihood options. So that's why the whole pattern of lifestyle has been changed. Secondly, the changes in food habits. Basically, earlier we used to have various different items or various types of foods basically, but right now our staple food has been either being rice or wheat-based products. And literally, we can say one thing. Earlier, in various places, in various states also, we used to consume millets basically. But right now, we are seeing that a very decline of this consumption of millets and other things. And then occupational hazards. Regarding occupational hazards, I can tell you one thing, that in various areas, basically, say where these coal mines and other industries were there, so the workers who are working there and the neighboring people, they are also facing various problems, which causes into all these diseases like COPD and other pulmonary diseases. Then environmental hazards. So in environmental hazards, we all see that during harvesting season, we used to have the smog and other things, which basically causes these various lifestyle diseases. Then low level of awareness. This is one of the major concerns about the lifestyle diseases, because we have very low level of awareness. People don't know that why actually they are being suffering of these lifestyle diseases, and obviously they don't know the root causes also. Then lack of available database of vital health parameters. Actually in our GPs, even in our hospitals, the database about the family history and other parameters are not readily available. So which causes into low detection of these diseases. So basically, current role of Gram Panchayats in addressing these lifestyle diseases basically. So as per our discussion, whatever held yesterday, so we saw that awareness programs are being arranged in social campaigns or in Gram Sabha or in other Sabha basis. Then organizing Mahila Sabha and Bal Sabha to address specific issues. Basically, this may happen that women specifically are suffering from various mental issues. It may be due to their early marriages or some other issues. So in this Mahila Sabha and Gram Sabhas basically, we used to, the GPs used to address these particular issues. So thirdly, organizing health camp in collaboration with some health department and other departments itself. Then GP level health and sanitation committee meeting. These committee meetings, we have, after discussion, we came into one consensus that these health and sanitation committees are readily available in all the Gram Panchayat level. But now the focus should be more into these lifestyle related diseases. Then strengthening the healthcare facilities that we are doing from various funds that is available with us. Then facilitating the distribution of supplementaries and other things, so various schemes, etc. So best practices in Gram Panchayat, mitigating the lifestyle diseases. So number one is screening of people for identification of the diseases. Then maintaining the database. As I was speaking, the database is very much necessary, because it may happen that someone is suffering from some disease which is a cause of hereditary problems. So that should be detected, and if we are maintaining that particular database within ourselves and even in the GPs basically or Gram Panchayats, then we can monitor the things in a very faster and easier way. Then rehabilitation and livelihood support to the acute drug addicts through skill development. So after discussion, it came to our notice that many drug users are there who are cured now, but they need the livelihood options so that they can earn their livelihood, so that they will never go to their depression and other things, and they will not get back to the other problems as well. Then promoting behavioral changes through yoga, meditation, health and wellness centers. So one thing is that after in our discussion, one thing came out that promoting kitchen garden. So this idea was shared from the team members who are from Assam. Basically what actually happening, they are promoting the kitchen garden in every household in their Gram Panchayat level, so that people will toil hard, there will be physical activities, they will grow their food there, and by this way, we can tackle and mitigate these physical or these lifestyle diseases basically. Then promoting hand washing and sanitizer. This is a very common practice. This is being practiced by all the GPs or village council throughout the country. But this is one of the factors through which actually we can mitigate or calculate the whole diseases. Basically, through that we can inculcate the behavioral patterns or behavioral changes in people as well. Then coming into the next point, anti-drug civil squad at GP level. Actually, this has been suggested from our state only, because in one of the blocks, basically, we are just having this anti-drug squad, civil squad, where actually we are working with the NGOs, religious leaders, and whoever influential persons are there. So that through them, actually, we are generating the awareness among the youth as well as other people also. So the abuse of drugs can be reduced, and so that these lifestyle-related diseases can also be mitigated. Then promoting sports activities such as marathon, local village sports, and etc. These are one of the measures basically through which actually we can have all the community, all the people can come together in a sports event, and that can lead us to mitigate or to tackle the various lifestyle related diseases. And lastly, actually, one initiative has been taken up by the government of Tripura. Actually, this initiative has been taken by Government of Tripura by our Honorable Chief Minister Sir, which is Amar Sarkar portal. I am very happy to announce or discuss these things with you. Basically, right now we are having one portal. This is basically a grievance redressal portal through which actually we are having two events. One Amar Sarkar Day and Amar Sarkar Walk basically. So through that particular walk, the village secretaries are walking. Actually, they are going to various wards, various habitations with the line department officials who are working on the field itself. So through that actually they are going to house basis. And from each and every household, basically, what are the problems actually they are facing? We are just gathering those particular issues and we are uploading in the portal, basically. So these things can be monitored from the state level itself. Our chief ministers or the higher level officials, they can easily monitor those things. And we are also in a very good position so that we are having the database. What are the problems actually we are facing? So this particular thing actually we are using for mitigating the various issues or tackling various issues related to health also. So we used to go to people and we used to ask them what are the problems actually they are having. If there is any person who is just suffering from any disease or something, we just try to facilitate them through our health department officials. Then propose engagement of GP in prevention of management of lifestyle diseases. There is regular meeting and follow-ups with the line department, especially with the health department officials. Then while preparing our annual GPDP, a special focus should be given to these particularly lifestyle related diseases. Basically, we can have various measures or various things can be included in our GPDP so that by using our money, we can have some various facilities so that people can have a concession idea and they can have a place to discuss their problems and other things. Then coming to the next point, promoting good food habits with the help of dietitian through monthly meetings in coordination with health department. Then setting up of sports facilities. These are common sports facilities so that people will come together. They will have one place where they can go for various sports activities and other things as well. So coming to the next point, expected support from state, district or block administration. So conducting medical and health camps at village level in regular intervals, then improving the facilities of telemedicine at the grassroots level. Basically, many villages or village councils are there where actually these things are very much necessary. People can have these things, if they can access this facility, they can have the healthcare facilities while using their mobile itself. If it can be dealt with the mobile through WhatsApp call or video call itself, the doctor can provide the particular solution to them. Then one more thing is the providing essential health equipment in health sub-centers. Basically, these health sub-centers should be upgraded. People should not move to district or some mainstream areas to get their health benefits, basically. So this is one thing. And then provision of dietitian and psychologists at PSC and CSC level. Actually, these are the two things, basically. We should include this thing because if the dietitian is there, then we'll have a very good idea of the diet, basically. People can discuss their various things along with the dietitian as well as the psychologist. Then expected support and convergence with the line departments, roping all the line department or the stakeholders, NGOs and others in one plan basically. Then secondly, giving extra effort in promoting aspects of mental health, initiating various things. Next, we are having role of SIRTs and PRTs. These are basically capacity building ideas so that training for the various personals can be done as well. Then incorporating a compulsory session in lifestyle disease mitigation in each training program as well. Then suggestions and recommendations, there are three basically. Promoting more awareness on mental health and it should be accessible to such as compulsory awareness through parent and teacher meetings, whatever we are doing at the school and various other areas as well. Then engaging dietitians and psychologists in every PSC and CSC. And lastly, bring all the rural citizens under the umbrella of health insurance. This was from our side. Thank you very much.
Thank you so much, Team 5, Group 5. And before we break for lunch, there is certain important announcement, please. I would like to call upon Shri Vipul Ujjwal, Director, Ministry of Panchayati Raj Government of India.
सारे प्रेजेंटेशन ग्रुप ने जिन्होंने किए हैं उनको बहुत बहुत बधाई, काफ़ी अच्छे प्रेजेंटेशन थे आपके। लंच में जाने से पहले एक छोटा सा अनाउंसमेंट आप सब के लिए ये है कि आप सब लोगों का उत्साह, एनर्जी लेवल देख के, नॉलेज देख के हम आप सबको रिक्वेस्ट करते हैं, वी आर रिक्वेस्टिंग यू ऑल कि अगर आप में से कोई लोग हमारे पंचायती राज के साथ जुड़कर स्टेट लेवल के या डिस्ट्रिक्ट लेवल के ट्रेनर बनना चाहें तो आप हमसे संपर्क करें। हम आपको जो भी रिक्वायर्ड ट्रेनिंग है वो दे के आपका जो प्रतिभा है, वी वुड लाइक टू यूज योर टैलेंट at state level and a district level because you have the requisite knowledge and obviously you have the communication skill and enthusiasm for that. तो आप सारों से रिक्वेस्ट है कि अगर आप चाहें मदद करना पंचायती राज को कि ताकि आपका जो ये मैसेज है और लोगों तक पहुंचे, तो आप ज़रूर अपने जो पंचायती राज डिपार्टमेंट है अपने स्टेट का, उनके थ्रू या SIRDs के थ्रू अप्लाई करें कि आप SLMT यानी स्टेट लेवल या डिस्ट्रिक्ट लेवल DLMTs बनना चाहते हैं। धन्यवाद। Now we break for lunch and we will be regrouping at 2:15. 2:15 पर हम वापस यहीं ऑडिटोरियम में असेंबल होंगे। थैंक यू वेरी मच।
Thank you so much, sir. I would request all of you to kindly be back on time at 2:15 p.m. ताकि हम लोग जो हमारा रिमेनिंग सेशन है उसको हम लोग अकम्प्लिश करें और उसके बाद जल्दी ही आप लोग फ्री हो जाएं। I request all of you to be back at 2:15 p.m. sharp so that timely we can proceed with the remaining part of the session and then you can be free early. Thank you so much. And your lunch has been arranged in the same place as it was arranged yesterday. Thank you. लोग संचालित कर पाएं और समय से आप फ्री हो पाएं. I request all of you to kindly settle down, please. Now, people, as we all know that we already have accomplished the Group 1 presentation, wherein the theme was role of Gram Panchayat in preventive measures of communicable and non-communicable disease, and the presentation was given by the Andhra Pradesh participants. Then we had the presentation of Group 2. The theme was availability and accessibility of quality health care services. This was again attended by the AP participants only. Group 3, the theme was addressing issues of the malnutrition for women, children and adolescents. The participants were from Uttar Pradesh, Himachal Pradesh, Madhya Pradesh and Jharkhand. Group 4, the theme was palliative care for elderly and people with special needs. And the teams were from Chhattisgarh, Jammu and Kashmir, Punjab, Haryana and Rajasthan. Group 5, the theme was role of Gram Panchayats in combating lifestyle disease like hypertension, diabetes, asthma, etc. And the participants were from Assam, Arunachal Pradesh, Manipur, Meghalaya and Tripura.
एक वीडियो चलेगा महाराष्ट्र खुसरपुर ग्राम पंचायत का.
I would request all of you to kindly settle down, please, so that we can timely begin with the next presentation by Group 6. Are the Group 6 people here? Teams from Maharashtra, Gujarat, DD and DNH, West Bengal, Sikkim. Are the participants here, please? Sir, the team 6. So team Maharashtra, Gujarat, DD and DNH, West Bengal, Sikkim, are you all here? Great. Group 7. The participants, please raise your hands from Group 7. The theme was sexual and reproductive health care services and family planning. And this group comprised of Kerala, Tamil Nadu, Telangana, Karnataka. Please wait, sir. We have a video initially to be played. So Group 7, team comprised of Kerala, Tamil Nadu, Telangana, Karnataka and Puducherry. You please raise your hands if this team is also present. Great. I request all of you to quickly settle down, please. The video is ready? Is the video ready, Abhishek ji? Abhishek ji, is the video ready? So all of you kindly pay attention. I would request all of you to kindly watch the video of Khusarpur Gram Panchayat, District Vidarbh, Maharashtra, and this is COVID-19 Fighter GP. May I have your attention, please? Kindly watch the video brought to you by Khusarpur Gram Panchayat, District Vidarbh, Maharashtra, and this is COVID-19 Fighter Gram Panchayat.
खुरसापार गांव महाराष्ट्र के नागपुर जिले से 65 किलोमीटर दूर है। गांव की कुल आबादी 1487 है, जिसमें से 741 पुरुष और 746 महिलाएं हैं। पुरुषों से ज्यादा महिलाएं हैं। कुल परिवार 310 है। स्वास्थ्य को लेकर ग्राम पंचायत व लोगों के सहयोग ने ली बड़ी जिम्मेदारी। गांव के सभी नलों को भूमिगत कर दिया गया है। शुद्ध और स्वच्छ पेयजल की आपूर्ति के लिए लगातार 5 वर्षों तक ग्रीन कार्ड प्राप्त किया और कोई महामारी नहीं होने के लिए सिल्वर कार्ड भी प्राप्त किया। स्वस्थ गांवों के रूप में सरकार की प्रतियोगिता में भाग लिया। परोपकार के फलस्वरूप गांव में नियमित स्वास्थ्य जांच, स्वास्थ्य शिविर, स्वच्छता अभियान चलाए गए और गांव को स्मार्ट ग्राम, स्वच्छ ग्राम, निर्मल ग्राम, तांत मुक्त गांव के रूप में पुरस्कार मिले। गांव का स्वास्थ्य केंद्र सभी सुविधाओं से ISO प्रमाणित है। ग्राम पंचायत, आंगनवाड़ी और स्कूल ISO प्रमाणित है। केंद्र सरकार द्वारा कोविड काल के दौरान किए गए व्यापक कार्य के कारण गांव को कोविड फाइटर के रूप में सूचीबद्ध किया गया है। आंगनवाड़ी क्षेत्रों में सैनिटरी नैपकिन वेंडिंग मशीन लगाई गई है। गांव के लोगों और स्वास्थ्य कर्मियों के प्रयास से गांव में कोविड टीकाकरण 100% हो गया है। गांव के सभी प्रसव अस्पताल में हुए। आंगनबाड़ियों में शून्य कुपोषित बच्चे हैं। नाना नानी पार्क, बच्चों के खेलने के लिए चिल्ड्रन पार्क, युवाओं के लिए व्यायामशाला, गांव के लोगों के लिए योग केंद्र की व्यवस्था की गई है। नियमित आहार, मार्गदर्शन और अन्य सुविधाओं के कारण गांव में महामारी और जल जनित रोग शून्य है। गांव व ग्राम पंचायत के लोगों द्वारा चलाए गए अभियान से खुरसापार स्वस्थ गांव बन गया है। इससे गांव को विभिन्न पुरस्कार प्राप्त हुए हैं और सरकार व जनता के सहयोग से विभिन्न सरकारी योजनाओं के माध्यम से लोगों को स्वस्थ व निरोगी बनाने के लिए गांव का प्रयास जारी रहेगा।
And this was a lovely video, and can we have a huge round of applause, everybody? Thank you so much. और इस ग्राम पंचायत के बारे में बताने के लिए we have with us Professor Sudhir Gautam. May we have a huge round of applause for the Sarpanch, please?
हाँ, शॉर्टकट नहीं। नमस्ते सभी को। डेलीगेट्स कोई यहाँ है नहीं, सब जो सरपंच उपस्थित है उसको मैं सरपंच नाते नमस्कार करता हूँ। आपका सबका तहे दिल से स्वागत करता हूँ और पंचायत का थोड़ा 2 मिनट में विश्लेषण करता हूँ। मैं जब सरपंच था तो मेरे गांव की स्थिति बहुत खराब थी और 2 काम में मैंने काम चालू किया, एक वाटर सफिशिएंट विलेज और हेल्दी पंचायत के। अभी 2 ही चीज ऊपर से अपने को मिलती है, एक तो पानी मिलता है ऊपर से या रोशनी मिलती है, बाकी सब नीचे से ही ऊपर जाता है। गांव डेवलप अगर करना है तो, देश अगर डेवलप करना है तो नीचे से ही करना है। ये सब गांव के लोगों के मिलके मैंने ये काम किया है। पहले वाटर सफिशिएंट विलेज किया, बाद में हेल्दी पंचायत का काम किया। जो काम अमेरिका को नहीं जमा, जो काम इंग्लैंड को नहीं जमा, जो काम साउथ रसिया को नहीं जमा, वो कोविड का काम हमने किया है। मेरे गांव में 0 कोविड पॉजिटिव है। केंद्र सरकार ने मुझे 0 कोविड ग्राम पंचायत से भी नवाजा था। अभी ये सब जब करते हैं, जब तक अपन गांव में ध्यान नहीं देते, सरपंच को मेरा कहना है कि छोटी छोटी बात है, अपने को कोई खूब बड़ा काम करना नहीं, अपने को कोई मेट्रो नहीं बनाना है, अपने को कोई फ्लाईओवर नहीं बनाना है। गांव में छोटे छोटे जो काम है जो पुराने जमाने में लोग करते थे। अब मैं एक उदाहरण देता हूं कि जब प्रभु श्री रामचंद्र और महाराष्ट्र के जो छत्रपति शिवाजी महाराज थे, उस टाइम गांव में सीमेंट रोड थोड़ी थे, गांव में नालियां थोड़ी थी, ड्रेनेज नहीं थी, तो भी गांव खुशहाल थे, गांव हेल्दी थे। पर आज सब कुछ रहने के बाद भी गांव हेल्दी नहीं है, वाटर सफिशिएंट नहीं है। 75 साल हो गए देश को स्वातंत्र मिलने को, तो भी अब अच्छी पानी नहीं दे रहे, शुद्ध पानी गांव को नहीं मिल रहा। अभी अनटाइट फंड आ गया, इसलिए सभी गांव को, सभी लोगों को टैप वाटर से पानी मिल रहा है। पैसे की कमी नहीं है सरकार के पास। अगर अच्छी ग्राम पंचायत काम करे तो सरकार, कोई भी सरकार, स्टेट सरकार, गवर्नमेंट की, सेंटर की सरकार हो या स्टेट की सरकार हो, पैसे उपलब्ध करवा देते हैं। लेकिन पैसे से सब काम नहीं होता। सिर्फ योजनाएं अपन गांव में लेके आए और लोग कुछ नहीं करे तो होगा नहीं। ये पहल अपने को करना चाहिए। गांव के सरपंच को उनके गांव के लोगों की मानसिकता भी चेंज करना चाहिए। जब तक मानसिकता चेंज नहीं होंगी तब तक गांव खुशहाल नहीं होंगे। इंफ्रास्ट्रक्चर जो है, इंफ्रास्ट्रक्चर के लिए सरकार पैसे देती है, इंफ्रास्ट्रक्चर से पूरा डेवलपमेंट नहीं होगा, ये जरूरी है तो भी डेवलपमेंट है। पुराने जमाने में कहाँ इंफ्रास्ट्रक्चर था? तब जब रविंद्रनाथ टैगोर जी जब उनकी पाठशाला पढ़ाते थे तो वहां कहाँ इमारत थी? वो तो पेड़ के नीचे लोगों को पढ़ाते थे। तभी लोग IAS हुए, अच्छे अच्छे अधिकारी हुए। तब कहाँ थे इंफ्रास्ट्रक्चर? डिजिटल स्कूल कहाँ थे? हेल्थ सेंटर भी नहीं थे। लेकिन हर लोगों की आदत अच्छी थी। जो अपने को अभी आदत जो है लोगों की जो चेंज कर रहा है, मैंने वही काम किया है ग्राम पंचायत में। लोगों की आदत बदले, उसके लिए कुछ पैसे नहीं लगते। लोगों का विचार बदला है, उसके लिए कुछ पैसे नहीं लगते। ये जब आप चेंज करेंगे, और सरपंच एक देश का डेवलपमेंट की एक बहुत अच्छी कड़ी है, बहुत अच्छा, यानी एक प्राइमरी आदमी है जो अगर मन में लाए, अगर मन में ध्यान में लाए तो ये सब कुछ डेवलप कर सकता है। जब गांव डेवलप होगा तो देश डेवलप होगा। बाकी छोटी छोटी जो चीजें हैं वो तो हर गांव करते हैं। हेल्थ सेंटर जो है, जो बाकी प्रोग्राम्स है गवर्नमेंट के, सब 99% गांव यूज करते हैं। लेकिन उसमें से 2%, 3% गांव भी अच्छे डेवलप होते हैं हर चीज के बारे में। 9 थीम जब डेवलप हुई तो हेल्दी पंचायत के लिए जब हमने काम चालू किया तो लोगों को साथ में लिया। पंचायत के सरपंच लोगों को साथ में लेते नहीं, ये वीकनेस है उसका। जब तक लोगों को साथ में नहीं लेंगे तब तक काम नहीं होगा, अवेयरनेस नहीं आएगा। इंफ्रास्ट्रक्चर पैसा कितना भी खर्चा हो वो होगा नहीं, पैसा बहुत है। और ग्राम पंचायत की हालत इतनी अच्छी है, अभी वित्त आयोग 14 फाइनेंस 15 फाइनेंस की वजह से ग्राम पंचायत को अभी एक बुनियादी पैसे मिल रहे हैं। वो पैसे का अच्छा अगर यूज किया जाए तो 9 थीम के कम से कम 4 थीम तो कम पैसे में अचीव में हो सकते हैं। उसके लिए पैसे की जरूरत नहीं है। एक इंफ्रास्ट्रक्चर अगर छोड़ा जाए तो बाकी थीम के लिए पैसे की जरूरत कम है। ये लोगों को साथ में लेके, लोगों का दिल अलग से, लोगों की आदत अगर अपन ने चेंज की तो ये सब हासिल हो सकता है। बहुत से काम ऐसे मैंने किए हैं, जैसे कि सब ISO दर्जा का सब किया है मैंने। मेरी स्कूल, मेरी आंगनवाड़ी, सब मैंने ISO किया है। सिर्फ इमारत ISO करने से और ऑफिस ISO करने से कुछ नहीं होगा। लोगों का मन भी ISO होना चाहिए, उनकी आदतें भी ISO होना चाहिए। ये करने का काम सरपंच को है, हमने वो काम किया है। इसलिए हम ये पटल पे मेरे 4 थीम, कम से कम अच्छे काम 5 साल में 4 थीम का अच्छा काम किया है। और बहुत से डेलीगेट से यहाँ है, प्रेजेंटेशन है। मैं धन्यवाद करता हूँ सभी का कि मुझे यहाँ आने का और बोलने का चांस दिया। नमस्कार।
Thank you so much. I would like to call upon stage Shri Sunil Kumar sir, former Secretary Ministry of Panchayati Raj, to kindly come on stage, please. Can we have a huge round of applause for Sunil sir, Secretary Ministry of Panchayati Raj, Shri Vivek Bhardwaj sir. If you are here, kindly come on stage, please. Additional Secretary Dr. C.S. Kumarji, sir, please come on stage, please. Special Chief Secretary Andhra Pradesh, Shri B. Rajshekhar sir, kindly come on stage, please. Commissioner P.R. NRD, Madam Srimati A. Surya Kumari, Madam, I would request you to kindly come on stage, please. Meanwhile, I would request all of you to kindly be seated. All your mates who are standing outside, please call out to them as well. सभी जो बाहर हैं इस ऑडिटोरियम के, सभी से अनुरोध है कृपया आप ऑडिटोरियम में, सभागार के अंदर आप उपस्थित हो जाएं. I think there are 2 groups left for the presentation. जितना जल्दी आप लोग सहयोग देंगे उतनी ही जल्दी आप भी फ्री हो पाएंगे. सभी से अनुरोध रहेगा अपना स्थान ग्रहण कर लें. And now we'll move ahead with the Group 6 people. The theme was prevention and treatment of substance abuse, including narcotic drugs abuse, harmful use of alcohol and tobacco. And the team comprised of Maharashtra, Gujarat, DD and DNH, West Bengal and Sikkim. Can we have a huge round of applause for Group 6 speakers?
3-4 राहोगे करू का सुरुवात Welcome to all of you after lunch session. Our topic, prevention and treatment of substance abuse and harmful effects of narcotics, alcohol and tobacco. 5 states are there: Maharashtra, Gujarat, Sikkim, Dadra Nagar Haveli and West Bengal. Our mentor is Honorable Kalshetty sir, who is DDG and Director Yashda, Maharashtra. And our coordinator is Samta Madam, ETC from Kalhasti. I will call Mrs. Chatterjee Madam to start the topic.
Shall I start?
Yes, sir.
I mean, it's okay. First, I should say thank you to all from the Panchayati Raj Department of Andhra Pradesh and of Government of India for inviting us in this discussion. Today's topic is on the substance abuse, prevention and treatment of substance abuse, including narcotic drugs abuses, harmful use of alcohol and tobacco. So the things are, the substance on which we are going to speak is the tobacco, the alcohol, cannabis, opioids, sedatives, inhalants, cocaine, injection drugs. So all these are the external variables which have a different impact on the human life. So this is the first occasion when the substance abuse was discussed and presented in the common forum of Healthy Village workshop of all the state and UTIs of our country. The factors which has a direct impact are the deterioration of health, psychological impact, social impact, family conflicts, economic impact, lifestyles impact, professional deteriorations, and human resource. So the current role of Gram Panchayat in addressing the health issues are discussing the same thing in how we can prevent the thing, discussing in the planning health issues through the village sanitation and nutrition committee that we all Gram Panchayat have organized a committee in the lower strata of the Gram Panchayat organization, that is the Sangsad level, the Ward Sabha, Mahila Sabha, monthly meeting, Gram Sabha, integrating these plans into GPRD. The main focus should be we are to implement the thing in GPRD so that we can check the usage of these things. Passing a resolution in Gram Sabha, Mahila Sabha for preventing sale of alcohol and other substances. Based on this resolution, we can check 50% in favor of the liquor shop. We can close down. Passing a resolution in Gram Sabha for not giving NOCs to established shop in Panchayat jurisdiction. Passing a resolution in Gram Sabha for closing and ban alcohol substances sale shops in Panchayat jurisdiction near schools and colleges for the adolescent childs. and a household survey can be taken up, a respondent-driven sample on health and awareness camp, arranging yoga day help for well-being, and engaging NGOs for as a social agency for current role of Gram Panchayat in addressing health issue. My next speaker is going to explain the rest of the program. Thank you.
Lot of thanks to Minister of Panchayat Raj and State Government of Andhra Pradesh, SIRD. Best practices in Gram Panchayats in mitigating the health issues. इसमें पहला बिंदु है टोबैको फ्री स्कूल्स कैंपेनिंग कंडक्टेड इन महाराष्ट्र. इसमें से महाराष्ट्र में बहुत सारा काम हो चुका है. ये टोबैको फ्री स्कूल कैंपेनिंग में बहुत सारे स्कूल में टोबैको फ्री कैंपेनिंग हो चुका है. दूसरा बिंदु है स्टेट संत गाडगे बाबा क्लीन विलेज कैंपेनिंग एंड SHG मूवमेंट लीड टू एडिक्शन फ्री विलेज एंड टोबैको फ्री विलेज. महाराष्ट्र में पहला ये कैंपेनिंग हो चुका है संत गाडगे बाबा ग्राम स्वच्छता अभियान. इसमें से बहुत सारे गांव में ये टोबैको फ्री विलेज हो चुका है. गुटखा बंदी प्रोग्राम इम्प्लीमेंटेड इन महाराष्ट्र. ये भी पहला प्रोग्राम महाराष्ट्र में हो चुका है गुटखा बंदी का, और इसका बहुत सारे गांव में इम्प्लीमेंट हो चुका है. स्कूल कमिटीज इस्टेब्लिश्ड इन वेस्ट बंगाल. Adolescent girl child groups established in West Bengal. Slogan on wall paintings: tobacco chewing is injurious to health, cigarette smoking is injurious to health. इसके ऊपर ही बहुत सारा काम महाराष्ट्र में भी हो चुका है और वेस्ट बंगाल में भी हो चुका है. Apply fine on sale of tobacco and cigarettes. Gram Sabha resolution been taken by many states. Gram Panchayats ban those substances near school premises. Message oriented culture programs during Ganesh Dashera festivals and during mass gatherings. इस सब प्रोग्राम में भी ये इसके ऊपर काम बहुत सारा हो चुका है. मीडिया कवरेज भी हो चुका है. फेलिसिटेशन ऑफ डी एडिक्टेड कैंडिडेट्स. आयुष अवेयरनेस प्रोग्राम, योगा एक्टिविटी, प्रेज and meditation program in schools. In these best practices in Gram Panchayats in mitigating the health issues. Proposed engagement of GP in prevention management of health issues. इसमें से identification, listening, segregation of addicted persons, root cause of addiction, cause and concerns, supervision of awareness program, evaluation of measures to be taken and preventions, sending serious persons for counseling, sending serious persons for rehabilitation center, social awareness program. ये तो बहुत बड़ा इस पे ऊपर काम होना चाहिए, सोशल अवेयरनेस होना चाहिए. फिल्म शो, रोड शो, स्मॉल प्ले इन स्कूल्स, और इसके बराबर मेकिंग बाय लॉज ग्राम पंचायत एक्ट एंड इन्वॉल्विंग SHGs. इन सारे प्रोग्राम में प्रपोज्ड एंगेजमेंट फॉर ग्राम पंचायत इन प्रिवेंशन मैनेजमेंट ऑफ हेल्थ इशू में हो सकते हैं. धन्यवाद.
The expected supports from the state and district blocks and administrations. So strict implementation and updation of Narcotics, Drugs and Psychopathic Substances Act 1985. And making laws and policies from the gram level and supported by the various line agencies or departments. Encouraging NGOs, social agencies to come forward. Counseling centers at block district level from BPDP and DPDP. So utilizing CSR funds from survey, sampling and treatment. And the expected support convergence with line departments are, we are looking forward to have a help desk and provide proper treatment to the needed people, and establishment of rehabilitation centers, counseling centers, and develop an education program, and police department to play a pivotal role in expected support convergence from exercise, health, education, and social justice and Panchayati Raj institution. Thank you.
The next slide is the role of SIRDs, PRTIs in capacity buildings of PRIs, ERs to address the health issues. Training and capacity building, train the trainers, training to ANMs, ASHA workers, teachers for preventive measures, training to public representatives and all stakeholders, training to village level committee members, IAC activities and media coverage. The last page of our PPT is suggestions and recommendations. The first suggestion is availability of treatment. Scientific evidence-based treatment need to be made available for people with substance use disorders at the required scale. The second measurement is scaling up treatment. Scaling up treatment of services for substances use disorder would also require large-scale capacity building mechanism. The third recommendation is information technology use. Information technology based solutions may be leveraged to enhance the efficiency of capacity building systems. And the last suggestion is engaging like-minded organization to use better expertise.
Thank you. Thank you.
Thank you so much for the wonderful presentation. I would like to call upon the next group, please, to kindly come on stage and to go ahead with your presentation. The next group is Group 7. The participants were from Kerala, Tamil Nadu, Telangana, Karnataka and Puducherry. And the theme was sexual and reproductive healthcare services and family planning. Can we all give a huge round of applause? But before this, we have one video. I would request all of you to kindly watch out this.
ভাৰতবৰ্ষৰ উত্তৰ পূৰ্বাঞ্চলৰ অপৰূপ প্ৰাকৃতিক সৌন্দৰ্যৰে ভৰপূৰ ৰাজ্য অসম। এই অসমৰ কামৰূপ জিলাৰ অন্তৰ্গত ৩৩ নং আজাৰা গাঁও পঞ্চায়ত। গাঁও পঞ্চায়তৰ সভানেত্ৰী সম্পাদককে ধৰি সকলো প্ৰতিনিধিয়ে বহনক্ষম উন্নয়নৰ লক্ষ্যত উপনীত হ'বৰ বাবে অতি নিষ্ঠাৰে কৰ্তব্য পালন কৰিছে।
আমি পঞ্চায়তৰ ফালৰ পৰা আমি সাস্টেইনেবল ডেভেলপমেন্ট গোলৰ ওপৰত আমি কাম কৰি গৈ আছো। তাৰ ওপৰত বিশেষকৈ আমি আমাৰ সুস্থ স্বাস্থ্যৰ ওপৰত আমি বিশেষকৈ গুৰুত্ব দিছো। আমি গাঁওখনৰ আমাৰ যিবোৰ সমস্যা আছে বা যিবোৰ আমাৰ ধৰক স্বাস্থ্য বুলি ক'লে আমি ধৰক অকল আমাৰ দেহৰ স্বাস্থ্যখিনি নহয়, আমি গোটেইখিনি সাঙুৰিয়াই লওঁ। যেনেকৈ ধৰক আপোনাৰ সৰু সৰু ল'ৰা ছোৱালীৰ পৰা একদম বৃদ্ধলৈকে আমি যিমানখিনি পাৰোঁ তেওঁলোকৰ গোটেই সুবিধাখিনি দিয়াৰ কাৰণে আমি পঞ্চায়তৰ ফালৰ পৰা আমি চেষ্টা কৰি আছোঁ।
গাঁও পঞ্চায়তৰ সকলো লোকেই স্বাস্থ্যৰ ক্ষেত্ৰত সদা সচেতন। সৰু সৰু শিশুৰ পৰা ডাঙৰলৈকে সকলোৱে পৰিষ্কাৰ পৰিচ্ছন্ন হৈ থাকি ভাল পায়। শিশুসকলক সৰুৰে পৰা সঠিকভাৱে হাত ধোৱা পদ্ধতিৰ লগতে পৰিপাটি হৈ থাকিবলৈ শিকোৱা হয়। তেওঁলোকক অংগনৱাড়ী কেন্দ্ৰৰ দ্বাৰা পুষ্টিকৰ খাদ্য যোগান ধৰা হয়। তাৰ জৰিয়তে শিশুসকলৰ সুস্বাস্থ্য বৰ্তাই ৰাখিব পৰা যায় আৰু লগতে সঠিকভাৱে বিকাশত সহায় কৰে। আশাকৰ্মীয়ে প্ৰতিনিয়ত পঞ্চায়তৰ গৰ্ভৱতী মহিলাৰ ঘৰলৈ গৈ স্বাস্থ্যৰ খবৰ ৰাখে। কেঁচুৱা আৰু মাতৃক স্বাস্থ্য সম্পৰ্কীয় দিহা পৰামৰ্শ দিবলৈ ঘৰে ঘৰে ভ্ৰমণ কৰে। সেইবাবেই এই পঞ্চায়তৰ গৰ্ভৱতী মহিলা, মাতৃ, কেঁচুৱা সকলোৱে সহজে চিকিৎসা সেৱা লাভ কৰিবলৈ সক্ষম হয়। পঞ্চায়তৰ নিচেই সমীপতে আছে আজাৰাৰ ৩০খন বিচনাযুক্ত গ্ৰাম্য চিকিৎসালয়খন। এই চিকিৎসালয়খনত সকলো ধৰণৰ চিকিৎসা সেৱা উপলব্ধ। বেমাৰৰ সাধাৰণ পৰীক্ষা নিৰীক্ষাৰ পৰা এক্স-ৰে, ECG পৰীক্ষাগাৰ, চিজাৰিন, অস্ত্ৰোপচাৰ আদি সকলো ধৰণৰ সুবিধা ৰোগীয়ে সহজতে লাভ কৰে। প্ৰসূতি নৱজাতক সকলোৱে উচ্চমানৰ চিকিৎসা সেৱা লাভ কৰিবলৈ সক্ষম হয়। যক্ষ্মা, কুষ্ঠ আদি ৰোগকে ধৰি বহু বেমাৰৰ চিকিৎসা সেৱা এই চিকিৎসালয়ত উপলব্ধ। সেইবাবে শিশুৰ পৰা বৃদ্ধলৈকে সকলোৱে সহজে চিকিৎসা সেৱা লাভ কৰি নিজকে স্বাস্থ্যৱান কৰি ৰাখিবলৈ সক্ষম হয়। গাঁও পঞ্চায়তৰ প্ৰতিনিধিৰ সহযোগত যোগ্যসকলে আয়ুষ্মান কাৰ্ড লাভ কৰিছে আৰু চিকিৎসা সেৱাৰ ক্ষেত্ৰত এই আয়ুষ্মান কাৰ্ডৰ জৰিয়তে হিতাধিকাৰীয়ে সঠিক সেৱা লাভ কৰিবলৈ সক্ষম হৈছে।
ইউটেৰাছত টিউমাৰ হৈছিলে, তাৰ কাৰণে মই ডক্টৰে অপাৰেশ্যন কৰিব দিলে
অপাৰেশ্যন কৰিলোঁ আৰু মোৰ যিহেতু টকা পইচাৰ অভাৱ হৈছিলে এই কাৰ্ডখনৰ পৰা মোৰ বহুত ৰেহাই হ'ল হস্পিটেলৰ খৰচ
স্বাস্থ্যকৰ গাঁও হ'বৰ বাবে পৰিৱেশো স্বাস্থ্যকৰ হ'ব লাগিব এই গাঁও পঞ্চায়তৰ লোকসকল এই ক্ষেত্ৰত সদা সচেতন নিজৰ চাৰিওফালৰ পৰিৱেশ তেওঁলোকে পৰিষ্কাৰ পৰিচ্ছন্ন কৰি ৰাখে এনেদৰে মাতৃগোটৰ সদস্যই বিদ্যালয়ৰ প্ৰাংগণো পৰিষ্কাৰ কৰা দেখা পোৱা যায় শাৰীৰিক কচৰত আৰু খেল ধেমালিৰ বাবেও গাঁও পঞ্চায়তটোত কেইবাখনো খেলপথাৰ আছে কিশোৰ কিশোৰীসকলে ইয়াতে খেলা ধূলা কৰি নিজৰ শাৰীৰিক সক্ষমতা বজাই ৰাখি নিৰোগী আৰু স্বাস্থ্যৱান হৈ থাকিব পাৰে খাদ্য সুৰক্ষা আঁচনিৰ দ্বাৰা ইয়াৰ বাসিন্দাসকলে ক্ষুধা নিবাৰণ কৰিবলৈ সক্ষম হৈছে অন্যহাতে প্ৰধানমন্ত্ৰীৰ উজ্জ্বলা যোজনাৰ জৰিয়তে ধোঁৱাবিহীন চৌকাত ৰন্ধনৰ সুবিধা লাভ কৰিছে এই পঞ্চায়তৰ লোকসকল শাৰীৰিকভাৱে সুস্থ থকাৰ বাবে কিছু কিছু লোকে ক্ষুদ্ৰ ব্যৱসায়ৰ জৰিয়তে উপাৰ্জনমুখী কৰ্মত ব্ৰতী হ'ব পাৰিছে অনাময় ব্যৱস্থাৰ ক্ষেত্ৰতো শিক্ষাৰ্থীকে ধৰি গাঁৱৰ ৰাইজো সচেতন গাঁও পঞ্চায়তৰ আৱৰ্জনা নিষ্কাশনৰ বাবে সঠিক ব্যৱস্থা আছে এই পঞ্চায়তৰ বাসিন্দাসকলে জল জীৱন মিছনৰ নিৰাপদ খোৱা পানী নিয়মিত লাভ কৰে এই বিশুদ্ধ পানী আৰু পৰিষ্কাৰ পৰিৱেশে ৰাইজক সুস্থ হৈ থকাত অৰিহণা যোগায় গাঁও পঞ্চায়তৰ লোকসকলে পুষ্টিকৰ আহাৰ পাবলৈও সক্ষম গাঁও পঞ্চায়তৰ সমীপত থকা বিল পুখুৰীৰ পৰা আহৰণ কৰা থলুৱা মাছ পুঠি তেওঁলোকৰ আহাৰৰ অন্তৰ্ভুক্ত হয় ইও সুস্বাস্থ্য বৰ্তাই ৰখাত অলপ হ'লেও অৰিহণা যোগায় পঞ্চায়তৰ সভানেত্ৰী আৰু প্ৰতিনিধিসকলৰ ঐকান্তিক প্ৰচেষ্টাত ৩৩ নং আজাৰা গাঁও পঞ্চায়তটোৱে শাৰীৰিক মানসিক আৰু সামাজিকভাৱে স্বাস্থ্যকৰ গাঁও পঞ্চায়ত হিচাপে স্বীকৃতি পাবলৈ সক্ষম হৈছে এনেদৰে এই গাঁও পঞ্চায়তটোৱে বহনক্ষম উন্নয়নৰ লক্ষ্যত উপনীত হ'বলৈ এখোজ দুখোজকৈ অগ্ৰসৰ হৈছে
Good afternoon, everyone. Respected dignitaries on the dais and my dear all spectators. I am very much honored to present this presentation. I am representing the group 7. Our subject, it's a broad subject and a very sensitive subject. Our subject is sexual and reproductive health care services and the family planning. In the villages, if I take the name, the word sex itself, they thought it has a very private word. It has to be discussed within the couples. It has not to be discussed in a open dais. But it is a very sensitive issue. We should focus on these sexual health and reproductive health very much. In 2 days, we have heard so many best practices, all those things, all slides we have seen, but in this matter, no, I didn't heard a single word regarding the sexual and reproductive health care services taken by the Gram Panchayats. So I will press this matter and it has to be considered. Only the good flower will only give the good fruit. In the beginning only, the Gram Panchayat is the smallest local government. We should focus on the sexual health also. And as I told, it is a very sensitive issue and rather major concerns, rather I would have told this challenges. It is the challenges we should focus on, we'll get in a Gram Panchayat level, that is child marriage, sexual violence against the women and unsafe abortion, early and unforced marriage, early and unintended childbearing, trafficking and sexual exploitation. We have to focus on these subjects and gender bias on SRH, sexual reproduction health. I made it short. Male dominance and no freedom to choose the safe sex and contraceptive methods. There will be a hurdle to choose for a woman to have a safe sex and contraceptive methods, for example, condoms, all those things. The male will dominate over those things and unhealthy sex acts, unsafe sex and multiple companions and intimate partner violence will be there. And there is a social taboo on certain key areas like cervical cancer screening. They will not go to the hospitals itself and even STDs and myths on family planning. If the male goes for a vasectomy, they will thought that I will become important. That's why they will hinder all those things, and non-availability of female doctors in PHC, so that the females, they won't open up there, and they can't share their problems regarding these reproductive health hygiene. Non-priority of sexual health in family planning and in GP meetings also. We will not discuss about these points in a GP meeting. And I already told, hesitation, no clinical checkups. They will always go for the home remedies to get and native treatments, and they will hear the neighborhood little educated women, all those things they will do treatment themselves. That will cause to the criticalness of the illness. And neglect of men in sexual health education. We should focus on the men and women both equally, and even we can't transgenders also. In transgenders also there will be so many issues will be there. We have to discuss in our Gram Panchayat. And poor health seeking behavior due to the work tension or busyness, women or everyone, they won't go to the hospitals, and they won't seek the this they don't seek the what we will say hospitals. They will not go to the hospitals. Okay. And quack practices and nutritional problems affecting the reproductive vulnerable group of women. Example, nutritional anemia and IDD. Lifestyle induced health issues affecting the reproductive age group of adolescent girls. Example, obesity, diabetics and hypertension and PCOS. And in the current role of our Gram Panchayat in addressing these issues, giving awareness on SRH and family planning and STDs, and regular screening should be done in the Gram Panchayat level, providing basic amenities in the schools and institutions. When we arrived to this conference, we got a good welcome and all the amenities, everything was good. And one thing I would have to say, please pardon me, and my humble request is, here is a washroom. In that washroom, we have got VIP treatment, but in the hostel I didn't get the dustbin. I searched everywhere to keep to throw the sanitary items. So please, I request on this stage to provide. In Gram Panchayats also, we provide so much of infrastructures, hi-fi toilets and all those things. But we will forget to keep the small items like this dustbins. We'll keep incinerators and everything we'll keep, but small things we will forget. We have to concentrate on the small things. This is my humble request. And health surveys and institutional delivery can be monitored in a periodic basis. If we monitor this institutional delivery, and if we know about the data about how many pregnant ladies will be there and what is her age, all those things, we can easily find out that for unsafe abortions and female feticides also we can find out easily. And health camps on SRH and family doctor concepts. Every woman or females, they can't go, they can't discuss about these things with the unknown persons. So we have to train the SHGs members. Mother is a first teacher. That's why through the SHG groups and other adolescent clubs, we have to teach them so that they can teach and they can have the sexual life, and they can keep their reproductive parts, private parts, healthy. Healthy camps on SRH and family doctors, I told, making adolescent clubs and giving awareness and sexual educations about POSCO, everything we have to do. That's all, I think. Next, over to my colleague. Thank you for giving me this opportunity.
Good afternoon to the respected dignitaries and to one and all those who are present here. It's my high privilege to be here. First of all, I would like to thank the rural Panchayat Raj and the rural development of Andhra Pradesh and Tamil Nadu For providing the opportunity, I have told the rest of them, the Kerala and Karnataka. That is, I'm thanking Tamil Nadu for sharing my views, providing the opportunity to be here, and the hospitality and the place given here. That is, I'm thanking Andhra Pradesh on behalf of that. So I was sharing some of my views. And best practices in Gram Panchayats. In Tamil Nadu, it is Makkalai Thedi Maruthuvam. That is, it means the doorstep delivery, that is the health care. And next, Makkalai Thedi Maruthuvam means that the medical checkup and everything is given in the doorsteps. Rest, the next Kerala at Kumarakom Panchayat, students are given training in basic medical diagnosis and first aid and act of volunteers. Go door by door. Then at Karnataka, giving awareness in sexual and reproductive health and STD once in a month, every first Friday. So far, 3 cases of syphilis are diagnosed and treated. And I hope already the video has been gone, so many video has been gone for, and we have learned from that about Andhra Pradesh, the family doctor concept counseling. Okay, I hope I don't need to say much about that. And the last, but not the least, but Karnataka. About Karnataka, I told already. The Kosakata, this one, yes. Yes. Kosakata, Gram Panchayat at, Kosakote. What? Kosakote, Gram Panchayat at Karnataka, giving awareness in sexual and reproductive health, STD once in a month on every first Friday. So far, that only I told already, the 3 cases in syphilis is diagnosed and treated. Thank you for providing such an opportunity, and thank you one and all.
Good noon to all dignitaries. Expected support from state, district and block administration. Age-appropriate sex education should be imparted in the school curriculum, and gender sensitization training for all stakeholders must be made mandatory. Training and capacity of all functionaries like ASHA and Anganwadi workers and teachers in Gram Panchayat level. More concentrated and coordinated community engagement should be effective in the administrative level. Strengthening the Bala Vikas and village health, nutrition and sanitary committees, which lays on the 4 components, that is health, nutrition, sanitation and early childhood care. Policy measures. In policy measures, we are expecting the strict vigilant actions against the scan centers, especially in sex determination of fetus. Village health, sanitation, nutrition committees need to be strengthened, especially sexual reproductive health topic should be one of the agenda. Reorientation of EHS is needed, more concentration of these subjects. All stakeholders should support each other and should work in one entity. And precise data and data collection should be shared among the line department. Thank you.
Only few words in the One is the training to be given to the community leaders and SSG group and ANM and Anganwadi workers and Kudumbasri CDS members and the grassroots of the Panchayat. The PRI is to be given awareness of the government scheme in all the machines and training on the personal hygiene. Only all thanks of the participant of this program in our teams. One is
Can you please move to the next slide? Yes. Thank you. Anaivarkum vanakkam. So proposed engagement for Gram Panchayat, I would suggest to identify the top priorities in the particular village actually, because like each village is subject to have different concepts and practices there, and identify the priorities top one. And conduct of maternal death audit at the level of Grama Panchayat to identify any social costs could be a better option to study the reasons for a maternal death in the field level. So these 2 points I want to highlight actually. And appointing, widely publicizing the best practices available in the social media platform to other Gram Panchayats to have an insight on what they are being done. And finally, next slide please. Some 2-3 suggestions. So identifying the best Gram Panchayat and incentivizing them. So providing cash incentive and conducting a state level induction training for the PRI members could be a better option on getting an insight of what exactly is about the sexual health and reproductive health. That's it. So I want to thank State of Andhra Pradesh to host this event. Thanks a lot. And we are eagerly waiting for the darshan also being arranged by our Madam Commissioner especially. And thank for the last evening. That was a very wonderful evening. We had a very good time. Thank you all.
Thank you so much. So, ladies and gentlemen, as we come closer to the concluding part of the day 2 of this insightful national level workshop here in Tirupati, Andhra Pradesh, organized by the Department of Panchayati Raj and Rural Development, Government of Andhra Pradesh, we find ourselves enriched with knowledge and inspiration. And in order to sum up the entire day 2, I would request the former Secretary, Ministry of Panchayati Raj, Government of India, Shri Sunil Kumar ji, to kindly come up, sir. Can we have a huge round of applause for our former Secretary, Ministry of Panchayati Raj, Shri Sunil Kumar ji. Pranam, sir.
2 मिनट उनसे लेके फिर समिंग अप करवा देंगे सर के 2 वर्ड्स लेने के बाद फाइनली सर का कंक्लूजन है सर सम कंफ्यूज हाँ सर मेरा कंफ्यूजन रहा सर प्लीज सर का नाम सर only told me that will come first. उनके बाद समिंग अप सर करेंगे सर आपके बाद सर फाइनली
I would like to call upon Shri B. Rajshekhar sir, Special Chief Secretary, Government of Andhra Pradesh. Can we all have a huge round of applause for sir?
So good afternoon. I would like to first call for a huge round of applause for our Dr. Kanchan. Since yesterday morning, I've been hearing this, her encouraging words, beautiful comparing. One of the best I've seen so far in, even in international conferences, we never have such kind of comparing. And I got used to this word, huge round of applause. Since yesterday, having heard, so many different voices from different parts of the country, what really struck me was how great is our nation. We are so diverse. We are seeing different colors, from very fair to dark, all and in between, all colors. Different languages, but we all think alike. We are all Indians at heart. And therefore, I think we also, all of us commit the same mistakes. From Kashmir to Kanyakumari and from Gujarat to Northeast, Mizoram, same kind of mistakes. But therein lies the strength of our nation. We learn from each other because our hearts beat the same. And that's the whole message of this national seminar on a very important topic. And I think, thanks to all of you, you have actually justified having this national seminar. Of course, we missed having some of our colleagues from a few states, But then you really made up. I mean, I'm not saying because I have to say this, but the presentations are really good. All of you have put in a lot of thoughts on how to improve health in our villages. And we can actually see in the final output. Even difficult topics like, the last one, sexual reproduction issues, and about geriatrics, old age. Very, very difficult topics, and I don't think anybody has had the last word on these topics. And you people have discussed and presented well. If I have to sum up this entire 2 days, deliberations, I think our Chief Secretary, Mr. Jawahar Reddy, in the morning said something, very, very important message. And that is, I would call it a profound statement, which is, at the GP level, we should not be talking about numbers and we should be talking about names. We should be talking about people. I think that's the big difference, and that is the biggest, I would say, the reason for having 73rd, 74th Amendment. And in our context, we are talking about 73rd Amendment, the local self-governments. Because that's where each life has to be talked about, looked after, and if the Gram Panchayats and the local governments, sarpanchas, the panchayat secretaries, if you start looking at, instead of saying in our GP there are 10 malaria cases or some 10 stunted cases, we should be talking about giving names to those numbers. And then once the names comes, that particular household is highlighted, and then in a Gram Panchayat we can actually fix that household in a particular locality. We know the geography of that location, we know the complete details about that household, and lo and behold, you will be able to catch the problem. I would just like to, because since yesterday many states have also mentioned about SHGs, the self-help groups, and how self-help groups have actually strengthened the Gram Panchayats. SHGs are not competitors to the panchayats. The social capital that we build actually strengthens the Gram Panchayats. And I've been involved in the SHG movement for a very, very long period, and I know how some of the SHG leaders have become sarpanchas and block presidents, and they made a huge difference to those villages. Yesterday I made a mention, in fact I said I'll try to instigate all of you and give you some food for thought. And in that I said, we are not good at doing fundamentals, basics. We do everything else. We handle crisis very well. India is known to handle crisis much better than developed countries. But as I've said, some of the basics, fundamentals, we falter. And in that context, I would like to give you the example of self-help groups. Why self-help groups are so effective? In fact, the SHG movement has been very, very effective. That led to, Kutumba Shri in Kerala, then SERP in Andhra, and it all led to National Rural Livelihoods Mission at the central government level. SHGs are good, effective because they keep everything simple and they do the basics well. Fundamentals are done well. What are the fundamentals in SHG? Simple savings, rotation, repayment, bookkeeping, something like a very, a very complex concept like equality. How do they do? How do SHGs demonstrate the concept of equality? By sitting in a circle. Very simple. That is why they are very effective. So their internal savings, they first ensure 1 rupee a day. I remember in 2000 when we started this movement, the campaign was save 1 rupee a day, 30 rupees a month. Today some of the SHGs save 500 rupees a month. We started with small bank loans. Today, some of the SHGs, nearly 30,000 SHGs in Andhra, have access to 20 lakhs bank loans. In fact, long time ago, we were going after banks to provide microfinance, and today it's the other way around. The banks are now running after SHGs, and forget about microfinance, they are giving macrofinance, 20 lakhs loans. That is because the fundamentals in SHGs are strong. Similarly, I think yesterday also we discussed, panchayats are manageable entities, and therefore, if panchayats are managed well, obviously the blocks will be managed well, and it goes up to the state level and the country level. So GPs are very critical, and all of you sarpanches and other local government representatives, your leadership matters a lot, and therefore, particularly in the context of healthy villages, I think your thought processes, your leadership will make a huge difference, and it is making a huge difference. We have seen some of the success stories, but we need to replicate these success stories such that, all GPs, all citizens in this country are healthy and pursuing livelihoods which bring happiness to those families. I'll just conclude by saying, particularly to my friends from Andhra Pradesh. ఆంధ్రప్రదేశ్ నుంచి ఎంతమంది ఉన్నారు ఇప్పుడు? చేతులు ఎత్తండి ఒకసారి. చాలామంది ఉన్నారు. సో ముఖ్యంగా సర్పంచ్లందరికీ, మన ఆంధ్రప్రదేశ్ నుంచి వచ్చిన సర్పంచ్లందరికీ కూడా ఒక గుడ్ న్యూస్ ఏంటంటే, మొన్ననే మన రాష్ట్రంలో 4th స్టేట్ ఫైనాన్స్ కమిషన్ రిపోర్ట్ సబ్మిట్ చేయడం జరిగింది. దాని మీద ఒక మినిస్టీరియల్ కమిటీ, అందులో నేను కూడా ఒక మెంబర్, ఆ మినిస్టీరియల్ కమిటీ ఈ 4th SFC యొక్క రికమెండేషన్స్ని, అందులో ఏవి యాక్సెప్ట్ చేయాలి, ఏవి రిజెక్ట్ చేయాలి, అది గవర్నమెంట్కి రిపోర్ట్ చేయాలి. ఎందుకంటే ఆ రిపోర్ట్ ఆధారంగా లెజిస్లేటివ్ అసెంబ్లీలో లెజిస్లేషన్ పాస్ చేయాలి, యాక్సెప్టింగ్ ఆర్ రిజెక్టింగ్ ది రికమెండేషన్స్ ఆఫ్ ది SFC. సో ద గుడ్ న్యూస్ ఇస్, ముఖ్యంగా మన ఆర్థిక శాఖ మంత్రివర్యులు ఆయన కూడా ఒక సర్పంచ్ నుంచి ఇవాళ ఫైనాన్స్ మినిస్టర్గా ఉన్నారు. వారు ఈ 4th SFCలో రికమెండ్ చేసినవన్నీ కూడా యాక్సెప్ట్ చేసి మన ఆంధ్ర రాష్ట్రంలో లోకల్ గవర్నెన్స్ ఇంకా పటిష్టంగా చేయాలనే ఉద్దేశంతో 4th SFC కూడా చాలా మంచి రికమెండేషన్స్ ఇచ్చింది. అవన్నీ కూడా యాక్సెప్ట్ చేసి రికమెండ్ చేయడం జరిగింది. సో దీనివలన మీకు నిధులు సక్రమంగా వస్తాయి, అలాగే చాలా వెసులుబాటు కూడా మీకు ఈ లోకల్ గవర్నమెంట్స్కి ఇవ్వడానికి, అలాగే పర్ క్యాపిటా గ్రాంట్ ఇవన్నీ కూడా ఆ రేషియోస్ కూడా పెంచడం జరిగింది. 25-50-50 ఆ విధంగా 25-50-25. సో కొన్నిట్లో 50-25-50 ఆ విధంగా రికమెండ్ చేయడం జరిగింది. కాబట్టి ఇక్కడున్న ఆంధ్ర రాష్ట్రం నుంచి ఉన్న లోకల్ సెల్ఫ్ గవర్నమెంట్ రిప్రజెంటేటివ్స్ అందరూ కూడా హ్యాపీగా మీరు ఈ కాన్ఫరెన్స్ నుంచి ఈ ఒక్క ఆలోచనతోటి, ఎందుకంటే రాబోయే రోజుల్లో ఇంకా పటిష్టం చేయడానికి ప్రభుత్వం ప్రయత్నం చేస్తుంది అనేది మీరు అర్థం చేసుకుంటారని తెలియజేస్తూ, ముఖ్యంగా మరి ఒకసారి I would like to thank the Ministry of Panchayati Raj, particularly our Secretary Saab, Sri Vivek Bharadwaj, for giving us this opportunity. And I thank Joint Secretary and the Director and other MOPR representatives who toiled very hard to make this 3-day event a very successful event. And I personally feel, I don't know what each one of you have in your minds, but I personally feel that this 2-day event I think achieved its objectives, and I'm very happy as a host to have presided over a very successful national event. Thank you all.
Thank you so much, sir, for your benevolent words and inspiring words too. Can we all have a huge round of applause for our respected Secretary, Ministry of Panchayati Raj is here with us. I would request, sir, Shri Vivek Bharadwaj ji to kindly come on stage, sir, to kindly be seated. Can we all have a huge round of applause for sir? And now to kindly give away the concluding remarks, I would like to call upon Shri Sunil Kumar ji, the former Secretary, Ministry of Panchayati Raj. Can we have a huge round of applause for Shri Sunil Kumar ji?
Honorable Secretary, Ministry of Panchayati Raj, Sri Vivek Bharadwaj ji, Special Chief Secretary, Government of Andhra Pradesh, Rajshekhar ji, Commissioner, RD and PR, Madam here, all participants in this national workshop. I am indeed honored to have been asked to come and address you. And listening to the presentations, the interactions that all of you had, I feel it's a learning experience for all of us. Every time one comes, interacts with all of you, one goes back with a new sense of optimism, with a new sense of self-belief that yes, we are on track and this can be done. और ये मेरे ख्याल से बहुत ही महत्वपूर्ण मैसेज है कि हाँ, हम कर सकते हैं, हम कर रहे हैं और हम कर सकते हैं. This topic healthy village, which is theme 2 of the LSDGs, is perhaps one of the most important goals that one can have. And yesterday, Secretary Saab had mentioned that 13,000 GPs, over 13,000 GPs, have resolved to accord priority to theme 2, that is, healthy, working towards making their panchayats a healthy village, a healthy panchayat. आप इसे इस तरीके से देखें कि अगर इन 13,000 पंचायतों में उनके सरपंच सहित जो 10 वार्ड मेंबर्स कम से कम हैं, ये सभी अगर हेल्दी विलेज के चैंपियंस बन जाएं, तो हमारे पास 1,30,000 से ज़्यादा चैंपियंस होंगे जो देश भर के दूसरे 2.5 लाख पंचायतों में जाकर के इस मैसेज को फैला सकते हैं। तो ये हमारे पास एक बहुत बड़ी अपॉर्चुनिटी भी है। एंड व्हाट वी हैव सीन हियर is that good practices abound across states. There are some good practices in almost every state. There would be no state where there is no good practice. Today we had detailed sort of session wherein the good practices of the host state, Andhra Pradesh, was presented before all of us. And there's so much that can be learned from these. चाहे वो फैमिली डॉक्टर का कॉन्सेप्ट हो, चाहे वो ग्राम पंचायत सचिवालय में जो इन्होंने स्टाफिंग डिप्यूट की है, उस तरह की व्यवस्था हो, ये सभी अपने मायने में, अपने आप में बहुत ही इंपॉर्टेंट मायने रखते हैं। और अगर कहीं कुछ खामी है भी, even if there are some deficiencies, then they can always be improved upon. They can always be set right. The important thing is that we have to make up our mind that yes, this is the goal that we have set for ourselves, and this is a goal that can be realized. And as Mr. Rajshekhar mentioned, when he quoted the Chief Secretary, which unfortunately I couldn't listen to personally, that it is at the GP level that every statistic can be given a name and a face. अगर आप डॉक्टर्स से बात करेंगे तो डॉक्टर्स बोलेंगे कि देयर आर सर्टेन इलनेसेस जो डॉक्टर और पेशेंट के बीच का जो रिलेशनशिप है दैट इज हाईली कॉन्फिडेंशियल, इट शुड नॉट बी पब्लिसाइज्ड। कुछ केसेस में हो सकता है, अब उदाहरण के लिए अगर एसटीडी के केसेस निकले तो नो वन वुड लाइक कि दैट शुड बी पब्लिसाइज्ड इन द होल कम्युनिटी। But even while maintaining confidentiality, there are a lot of ways in which the panchayat functionaries can make a positive contribution without belittling the family or the individual. क्योंकि अगर जो वहाँ पर कारण होगा, उस कारण से भी local community is best placed to have a proper understanding of what exactly those issues were. So Gram Panchayat is the perfect and perhaps the only institution in the entire government where data is not anonymous, is not impersonal, where data can be given a name and a face, and then very positive intervention in the shortest possible time can actually be effected there. हम अगर स्टेट लेवल पे कुछ करना चाहें, कंट्री के लेवल पे कुछ करना चाहें, तो then it takes time. लेकिन ग्राम पंचायत के लेवल पर इट्स पॉसिबल। आपको आज ही खुर्सापार के सरपंच ने बताया कि पूरे कोविड काल में उनके ग्राम पंचायत में एक कोविड का केस नहीं हुआ, और इस तरह के कई ग्राम पंचायतें होंगी जिनकी अभी हमारे पास जानकारी नहीं है, लेकिन 2.5 लाख ग्राम पंचायतों में कई ग्राम पंचायत होंगी जहां कोविड का एक केस नहीं हुआ, चाहे 2020 में चाहे 2021 में। तो दोज आर कॉज फॉर सेलिब्रेशन। लेकिन स्टेट के लेवल पर जब हम आते हैं या डिस्ट्रिक्ट के लेवल पर आते हैं या कंट्री के लेवल पर आते हैं, तो देन इट्स वेरी डिफिकल्ट डिस्पाइट ऑल द बेस्ट एफर्ट्स दैट वी मेक। तो देर एज द सरपंच ऑफ द ग्राम पंचायत, you are best placed to see the fruits of your labor। आप जो मेहनत करते हैं या मेहनत करेंगे, उसका फल भी आपको अपने सामने दिखेगा। You would be able to see the impact of your work, and that I think is extremely important। और इसी कॉन्टेक्स्ट में कल जब जॉइंट सेक्रेटरी MOPR पंचायत डेवलपमेंट इंडेक्स के बारे में बात कर रहे थे, एंड ही लेड आउट कि इन द कॉन्टेक्स्ट ऑफ हेल्दी विलेज कितनी सारे कौन कौन से इंडिकेटर्स हैं और वो भारत सरकार और राज्य सरकार के अलग अलग स्कीमों से किस प्रकार जुड़े हुए हैं, और अगर उस पर बेहतर काम होता है तो उन सारे स्कीम्स और प्रोग्राम्स के जो टारगेट्स हैं उसे भी आप पूरा करेंगे और अपने पंचायत को हेल्दी पंचायत बनाने की दिशा में भी आप काफ़ी हद तक आगे चले जाएंगे। तो अगर हम हेल्दी पंचायत को देखें तो एक तो है कि जो स्कीम्स चल रही हैं, जो प्रोग्राम्स चल रहे हैं, चाहे वो हेल्थ डिपार्टमेंट के हों या किसी भी ड्रिंकिंग वाटर एंड सैनिटेशन डिपार्टमेंट के हों या आपके प्रोहिबिशन डिपार्टमेंट का हो, जो आज अभी ये सब्सटेंस अब्यूज और ड्रग अब्यूज का है, यू हैव अ सेपरेट डिपार्टमेंट। बट वी नो वर्किंग इन द स्टेट्स कि अपार्ट फ्रॉम द HOD and maybe a very small number of people, they don't have anyone in the field to do it। और मद्य निषेध का काम होता है कि 2 अक्टूबर को एक ऐड निकलवा दें अखबार में कि साहब मद्य निषेध अच्छी है। Beyond that, they are in no position to make any impact anywhere। और उसमें आप लोगों ने अपने ग्रुप प्रेजेंटेशन में दिखाया कि so much can be done at the gram panchayat level, and we have instances, महाराष्ट्र में भी है, झारखंड में भी है, ट्राइबल एरियाज में भी है, जहां पर लोकल कम्युनिटी ने पूरी तरह से शराबबंदी को लागू करके रखा है, एंड विदाउट एनी रोल ऑफ पुलिस और एनीवन एल्स। तो इट शोज कि इट इज पॉसिबल। कल आपके जो बेस्ट प्रैक्टिसेस यहां पर दिखाए गए जिस सेशन में, वहां पर आप लोगों ने देखा कि कौन से 5 ग्राम पंचायत थे देश के अलग अलग भागों से, चाहे वो तेलंगाना हो, आसाम हो, उड़ीसा हो, वहां पर कौन सा काम उन्होंने हेल्दी विलेज वाले क्षेत्र में किया था, एंड हाउ दे हैव बीन ड्यूली रिकॉग्नाइज्ड। उसके बाद जो शाम का सत्र हुआ था उसमें आप लोगों ने 2-3 NGOs से सुने। झारखंड में 2 NGOs TRIF और एक और जो JHI PG ऑर्गेनाइजेशन वाज देयर, जिन्होंने झारखंड में बताया था कि झारखंड में वो कैसे काम कर रहे हैं। और ये वास्तव में बहुत ही अच्छी पहल है कि झारखंड में इवन फॉर द 15th Finance Commission grants that were received by Health Department, they actually involved the panchayats in utilization of those grants। In almost all other states, Health Department ने उसको सेंट्रलाइज तरीके से खर्च किया, और किसी भी पंचायत में, चाहे वो डिस्ट्रिक्ट पंचायत हो, ब्लॉक पंचायत हो या ग्राम पंचायत हो, no one even got to know as to how that money has been utilized। but that money was given to them in the name of panchayats. तो एक ये कल भी बात उठी थी, आज भी किसी प्रेजेंटेशन में था कि ये टाइड और अनटाइड वाला जो चक्कर है कि हम टाइड ग्रांट करके अगर हम किसी विभाग को दे देते हैं तो उसका कितना इस्तेमाल होता है, नहीं होता है, उसमें फिर लोकल कम्युनिटी, लोकल गवर्नमेंट की जो रोल और रिस्पॉन्सिबिलिटी है वो कहीं ना कहीं कॉम्प्रोमाइज होती है। झारखंड का ही उदाहरण मैं फिर दूंगा कि वहां जो जन आरोग्य समिति बनाई है अभी वो गवर्नमेंट ऑर्डर के माध्यम से बनी है। गवर्नमेंट ऑर्डर जो चीफ सेक्रेटरी ने लोगों की सहमति लेकर के जारी की है, लेकिन अगर इसे हमें एक परमानेंट सिस्टम का भाग बनाना है तो परहैप्स इट इज टाइम कि वी मेक सर्टेन changes even in the statutes that govern these activities. जो 73rd और 74th अमेंडमेंट हुआ उसके बाद लगभग सभी राज्यों ने अपने स्टेट पंचायती राज एक्ट्स और रूल्स में उन्होंने अमेंडमेंट कर लिए। एंड टुडे इट वाज मेंशन्ड इन द केस ऑफ आंध्र प्रदेश कि हाउ बाय 2004 you had carried out all the amendments including activity mapping. But at the same time, we would also be the first to accept that there is still a long way to go. Between 2004 and 24, 20 years have passed, but we have a long way to cover. कहीं ना कहीं पर कभी ना कभी अगर हम 2 स्टेप फॉरवर्ड लेते हैं तो 1 स्टेप बैकवर्ड भी हो जाता है। तो how do we bring about systemic changes so that we can avoid this to and fro? आगे पीछे होना जो है वो इंडिविजुअल ऑफिसर्स हों, इंडिविजुअल पॉलिसी मेकर्स हों, इंडिविजुअल चीफ मिनिस्टर्स हों, उस पर निर्भर नहीं हो। देयर इज अ ब्रॉड कंसेंसस ऑन दिस कि यस, स्ट्रेंथनिंग लोकल गवर्नमेंट इज द वे टू गो फॉरवर्ड। और इसी में मैं एक उदाहरण दूंगा कि केरला में when they brought the or modified their panchayati raj acts and rules, they looked at 42 different acts governing activities of other departments which are listed in those 29 sectors, and they carried out amendments because they arrived at the conclusion that those existing provisions do not or stand in the way of strengthening local government. ये एक्सरसाइज दूसरे राज्यों में कितना किया गया है, इस पर ऑल ऑफ यू मिनिस्ट्री और जितने SIRDs के हैं, पीपल हु हैव वर्कड फॉर लॉन्गर पीरियड, यू विल बी द बेस्ट वंस टू नो। लेकिन हो सकता है अभी भी बहुत सारे राज्यों में ढूंढने पर कई ऐसे स्टैट्यूट्स में लॉज और रूल्स मिल जाएंगे अलग अलग डिपार्टमेंट्स के, विच आर कॉन्ट्ररी टू दोज विच विच इज प्रोवाइडेड फॉर इन पंचायती राज एक्ट्स। आप PhD का देख लीजिए, आई एम श्योर कि अगर वो यूपी में जल निगम बना हुआ है, जल निगम का जो कॉन्स्टिट्यूशन हुआ है दैट इज ऑल्सो एक्ट के तहत है। It will be running, definitely running counter to what is there in the Panchayati Raj Act. और इस confusion का फायदा लोग उठाते हैं। तो it is important that we look at, और अभी केरल का ही एक और एग्जाम्पल देंगे कि लास्ट ईयर उन्होंने पब्लिक हेल्थ एक्ट 2023 उन्होंने इनैक्ट किया, बिकॉज एट द टाइम ऑफ दिस पैंडेमिक, कोविड के समय में दे रियलाइज कि दे वर बीइंग गवर्न्ड बाय ब्रिटिश पीरियड के एक्ट से दे वर बीइंग गवर्न्ड इन सर्टेन पार्ट्स। इट वाज मालाबार का कुछ एक्ट पुराना चल रहा था, एंड इन सर्टेन पार्ट्स तमिलनाडु का जो पुराना एक्ट मद्रास प्रेसिडेंसी का था वो वहाँ पर लागू हो रहा था। तो दे हैव रिवाइज्ड इट, और इसमें इन्होंने लोकल गवर्नमेंट के रोल को बिल्कुल फॉर्मलाइज किया है, and they have taken 2 steps forward क्लाइमेट चेंज की वजह से क्या क्या सिनेरियो हो सकता है, हेल्थ इम्पैक्ट क्या हो सकता है, उसमें क्या रोल होगा लोकल गवर्नमेंट का, आपका मैन और एनिमल कॉन्फ्लिक्ट जो होता है उसकी वजह से क्या होगा, एपिडेमिक्स में क्या रोल होगा, इन सारे चीज़ों को उन्होंने रिवाइज करके और उन्होंने एक पब्लिक हेल्थ ऑफिसर के कॉन्सेप्ट को दे हैव इंट्रोड्यूस्ड एंड दे हैव मेड हिम अंडर द लोकल गवर्नमेंट. तो मे बी इट इज़ टाइम दैट अदर स्टेट्स ऑल्सो टेक अ लुक एट दीज, लर्न फ्रॉम ईच अदर्स एक्सपीरियंस. और जैसा अभी राजशेखर जी ने बताया कि हमको विदेश जाने की कोई ज़रूरत नहीं है, अपने देश में ही हमें सारे बेस्ट प्रैक्टिसेस हमें उपलब्ध हैं. हमें केवल आसपास के अपने पड़ोस में जो हैं उनके एक्सपीरियंसेस को से सीखने की ज़रूरत है. वी जस्ट नीड टू टेक अ लुक एट देम, learn from their experiences and avoid the same mistakes which others have made. And this we can do. आज जो ग्रुप डिस्कशंस हुआ और उसमें जैसा आपने भी बताया और हम सभी लोगों ने यहाँ महसूस किया कि द क्वालिटी ऑफ deliberations which was reflected in the presentations made was of a very good quality. और उन सारे बिंदुओं में उन्होंने बहुत ही गंभीरता से विचार करके they had looked at all possible aspects of the topic that was assigned to them. और ये जो 7 आपके ग्रुप्स के जो सब्जेक्ट्स थे, those were also very carefully selected, and for that I would compliment the ministry, the officers of the ministry as well as government of Andhra Pradesh, who would have worked together to jointly finalize the program for this 3-day workshop. They covered almost all possible topics. और ऐसे टॉपिक्स भी उसमें कवर हुए जिस पर आम तौर पर चर्चा नहीं होती है. जो आपका ग्रुप 7 का टॉपिक था, सेक्सुअल रिप्रोडक्शन का, और मेंटल हेल्थ इज अगेन अनदर सब्जेक्ट जिस पर ज़्यादा चर्चा नहीं होती. और इन सारे चर्चाओं में आप लोगों ने निकाल भी लिए पॉइंट्स कि क्या चाहिए. और जब आप वो निकाल रहे थे तो आपने उसमें देखा कि सेफ ड्रिंकिंग वाटर और सैनिटेशन से लेकर के आपका वहाँ पर मेकिंग अवेलेबल पब्लिक पार्क्स, ओपन स्पेसेस वेयर पीपल कैन sit, walk, exercise, उसको भी आप लोगों ने हाईलाइट किया कि yes it is there. और आज के समय में these open spaces, चाहे वो पब्लिक पार्क के रूप में हो या वो प्लेग्राउंड के रूप में हो, उसका कोई विकल्प नहीं है. इट्स नॉट अ लग्जरी, इट्स a pressing need in every ग्राम पंचायत, इवन इन रूरल एरियाज. जो यहाँ पर डाइटिशियन की बात की गई कि हमें डाइटिशियन का ये चाहिए, बिकॉज ओबेसिटी एंड लाइफस्टाइल डिजीजेस आर नाउ इक्वली अफेक्टिंग पीपल इन रूरल एरियाज. तो इन सारी चीज़ों को अगर देखते हैं तो आप लोगों ने बहुत ही गंभीरता से विचार करके इन सारे बिंदुओं को निकाला. एंड बिफोर आई कंक्लूड, एक जो सबसे बड़ी बात कल निकल के आई थी वो था इशू ऑफ ट्रस्ट, कि हमें विश्वास जीतना होगा. और आज भी यही बात उभर के आई कि पीपल हु हैव सक्सीडेड, दे सक्सीडेड बिकॉज दे एंजॉयड द ट्रस्ट ऑफ देयर पीपल, दे हैड द सपोर्ट ऑफ द पीपल. और ट्रस्ट को जीतने के लिए मेहनत करनी होती है. वो केवल पद को हासिल कर लेने से नहीं होता. और जिन लोगों ने वो ट्रस्ट को हासिल किया, दे वर एबल टू अचीव एक्सेप्शनल रिजल्ट्स. तो दैट आई थिंक इज वेरी इंपॉर्टेंट. तीसरा, ये भी जरूरी है कि एज सरपंच you should also have the ability to negotiate amicably with different stakeholders. उदाहरण के लिए आज कई राज्यों में जो सरपंच का इंटरैक्शन होता है विथ पीएचसी या सीएचसी डॉक्टर, वो होता है कि जब वो जाते हैं वहाँ पर हंगामा करने कि ये पेशेंट का क्यों नहीं आया, इलाज क्यों नहीं हुआ, फलाना, वो उसको सरपंच को, पंचायत के मेंबर्स को, दे लुक अपॉन देम एज ट्रबल शूटर्स कि ये आए तो जरूर कुछ ना कुछ जो है हंगामा होगा। लेकिन अगर वो आपको, और यही चीज झारखंड के उदाहरण में दिखा कि वहां पर वो सीएचसी की जो इंचार्ज थी, शी वाज सेइंग कि मुखिया के सपोर्ट की वजह से हाउ दे वर एबल टू डू सो मच बेटर इन एवरी वर्क और एवरी मीटिंग, एवरी टारगेट। तो कहीं ना कहीं पर वो एडवर्सेरियल जो हम लोग रोल अपना लेते हैं कि साहब हम जनप्रतिनिधि हैं तो हमें सरकारी अधिकारी कर्मचारी के साथ थोड़ा इस तरह से बिहेव करना चाहिए जिससे लोगों में ये संदेश जाए कि मैं बहुत ही प्रभावी और इफेक्टिव लीडर हूं। दैट आई थिंक इज अ रॉन्ग प्लॉय। अगर हमें रिजल्ट ये करना है तो हमें हर एक स्टेक होल्डर के साथ, चाहे वो गवर्नमेंट डिपार्टमेंट का फंक्शनरी हो, चाहे वो प्राइवेट मेडिकल कॉलेज जो आपके पंचायत के एरिया में विच हैज कम अप, यू शुड हैव द एबिलिटी कि हमें इनसे नेगोशिएट करके पंचायत के हित में, लोगों के हित में हमें कौन सी चीज इनसे हम ले सकते हैं। उदाहरण के लिए अगर कोई मेडिकल कॉलेज किसी पंचायत के बाउंड्रीज में है एंड इफ यू आर एबल टू नेगोशिएट कि आपके स्टूडेंट्स, फाइनल ईयर के स्टूडेंट्स या रेसिडेंट डॉक्टर्स एक दिन हमारे कैंप पंचायत में आए, लोगों का हेल्थ कैंप लगाएं और उन्हें कराएं, तो मे बी इट विल वर्क आउट टू बी अ विन विन फॉर देयर स्टूडेंट्स एज वेल एज द पंचायत। अभी इट बिकम्स अ हैंड्स ऑफ कि साहब ये तो पंचायत का मेडिकल कॉलेज का बाउंड्री बन गया तो इट इज आउट ऑफ बाउंड्स। ये जो फिजिकल बाउंड्रीज क्रिएट हो जाते हैं, दैट हैज टू बी ब्रोकन। उसके लिए यह भी जरूरी है कि सरपंच and other panchayat functionaries are also taught as to how they should be able to negotiate with them. तो ये सारे चीज को अगर हम लोग ध्यान में रखें तो हमें विश्वास है कि we would be able to achieve the goals that we have set. Thank you.
थैंक यू सो मच सर। हमेशा ही आपसे हमें मार्गदर्शन मिलता आता है और बहुत ही सकारात्मकता का हमें एहसास होता है। मैं चाहूँगी सब लोग जोरदार तालियां बजाएं हमारे फॉर्मर सेक्रेटरी एमओपीआर सर के लिए। और कहते हैं ना कि मुश्किलें आती हैं सफलता की राहों में, ये कौन नहीं जानता। मुश्किलें आती हैं सफलता की राहों में, ये कौन नहीं जानता। पा लेता है वही मंजिल जो कभी हार नहीं मानता। और इसी के साथ बिफोर आई कॉल अपॉन श्रीमती ए सूर्य कुमारी मैडम फॉर हर वोट ऑफ थैंक्स, on behalf of Andhra Pradesh government, I wish to announce the names of Team MOPR for their great efforts in making this national level workshop a big hit. And to felicitate them, I would like to call upon Dr. M. Sudhakar Rao sir, Additional Commissioner RT and PR Government of Andhra Pradesh, to kindly come on stage. Please can we give a huge round of applause for Dr. M. Sudhakar Rao sir. So to begin with, I would like to call upon Shri Vipul Ujwal sir, Director, Ministry of Panchayati Raj. Kindly come on stage, sir. A huge round of applause for Shri Vipul Ujwal sir. And you all please be seated. We have the group photograph also. So I want all of you to be seated. A huge round of applause for Shri Vipul Ujwal, Director, Ministry of Panchayati Raj. Shri Rajesh Kumar, PSO, Joint Secretary MOPR, kindly come on stage, please. Shri Rajesh Kumar. Is Shri Rajesh Kumar ji here? Moving on. Shri Rajesh Kumar ji, PSO Joint Secretary MOPR, kindly come on stage. A huge round of applause for Shri Rajesh Kumar ji. I would request the Additional Commissioner to kindly present him. Shri Anjani Kumar Tiwari ji, Consultant MOPR, a huge round of applause. Shri Anjani Kumar Tiwari, Consultant MOPR, to kindly come up. Ma'am, the next name.
Next, Mr. Sonu Kumar, Section Officer, Ministry of Panchayat Raj. Mr. Sonu Kumar. Ms. Pragya Singh, Consultant MOPR. Huge round of applause, please. Sri Satyendra Jha, Consultant MOPR. Satyendra. Sri Abhishek Kumar, Consultant MOPR. Last but not least, Dr. Kanchan Negi, ma'am. Huge round of applause. Thank you, sir.
Thank you so much, madam. And now to make this a memorable event, ma'am. So because we want all of you to have special memories of this 3 days national level workshop, I would like to invite all of you, but group wise, as per the groups we had made yesterday for the group discussion. So first of all, I would like to invite the members of group 1. The theme was role of Gram Panchayat in preventive measures of communicable and non-communicable diseases. All the participants. From Andhra Pradesh participants, please come on stage for the group photo. Team members of group 1. Group 1, kindly come on stage. Andhra Pradesh participants, please make it fast. I would request all of you to kindly stand behind the dignitaries on dais for the group photograph. Meanwhile, I would request group 2, group 3, group 4 to be ready, be seated, be present here for the group photograph. Shri Vikas Anand sir, I would request you also to kindly come on stage, please. Shri Vipul Ujwal sir, Director Ministry of Panchayati Raj, kindly come on stage, please. So this is group 1. A huge round of applause for group 1. Kindly stand behind the dignitaries for the group photograph so that everyone is visible. So group 1 comprises of Andhra Pradesh participants. A huge round of applause. Come on, Andhra Pradesh, group 1. I would request all of you to kindly make it fast. So this group photograph is for group 1. Andhra Pradesh participants. Sirikalam, PP Maniam, Vizianagaram, ASR Vishakhapatnam, Anakapalli, Dr. B.R. Ambedkar, Konaseema, Kokinada, East Godavari, West Godavari, Elluru, NTR, Krishna, Guntur, Palnada, Bapatla. Kindly stand behind the dignitary so that everybody is visible, please. Meanwhile, group 2 can assemble on my right side. Group 2, Prakasam, SPSR Nellore, YSR Kadapa, Annamaya, Kurnool, Nandayal, Sri Satya Sai, Anantapur. On my right, please. Group 2, please come on my right side. Kindly make it fast. Group 2, the theme was availability and accessibility of quality healthcare services. Please move from my left side. Please move from the other side. Please move from the other side. And group 2 will come from my right side. Thank you so much, Group 1. Now Group 2. Group 1, kindly vacate the stage, please. Now please, Group 2, stand behind the dignitaries on dais, please. Group 1, kindly vacate the stage, please. Quickly, please. Thank you. Group 1, kindly vacate the stage so that Group 2 can come forward. So again, Group 2 comprises of Andhra Pradesh participants: Prakasam, SPSR Nellore, YSR Kadappa, Anamaya, Kurnool, Nandayal, Sri Satya Sai, Anantapur. Can we have a huge round of applause for Group 2 members, please? Meanwhile, Group 3, Uttar Pradesh, Himachal, Madhya Pradesh, Jharkhand, please assemble on my right side, please. Group 3, assemble on my right side. Uttar Pradesh, Himachal Pradesh, Madhya Pradesh, Jharkhand. Thank you, Group 2. Thank you so much. Please proceed. Thank you so much, Group 2. Group 3, stay here. Group 3, stay here. Thank you, Group 2. Thank you so much for vacating the stage soon. Now I would like to welcome Group 3 participants. Kindly be seated behind the dignitaries. A huge round of applause for Group 3 participants. And this team comprised of Uttar Pradesh, Himachal Pradesh, Madhya Pradesh and Jharkhand. A huge round of applause for Group 3 team members. Quickly settle down. I request all of you to kindly be seated, people. A huge round of applause for Group 3 team members. Thank you so much, Group 3, for being there. Meanwhile, Group 4, please come on stage on my right side. Chhattisgarh, Jammu, Kashmir, Punjab, Haryana, Rajasthan. Please stay here, please stay here. Let the stage be vacated. Thank you, Group 3. Now, Group 4, kindly proceed for the photograph. A huge round of applause for Group 4 team members from Chhattisgarh, Jammu, Kashmir, Punjab, Haryana and Rajasthan. Meanwhile, Group 5, please assemble on my right side. Assam, Arunachal Pradesh, Manipur, Meghalaya, Tripura. Kindly stand on my right side, please. Thank you so much. Group 4, thank you so much. Kindly vacate the stage, please. Please move from the other side. Group 5, kindly proceed. Yeah. Now is Group 5. You are late, sir. Now Group 5 only. Group 5. Assam, Arunachal, Manipur, Meghalaya, Tripura. Please be quick. Otherwise, you will not be captured. Group 5, Assam, Arunachal, Manipur, Meghalaya, Tripura. Please, you may kneel down in the first row. Meanwhile, Group 6, please assemble on my right side. Maharashtra, Gujarat, DD, DNH, West Bengal, Sikkim. Please assemble on my right side and don't miss out this golden opportunity. Thank you so much, Group 5. Please proceed from the other side, madam. Wait, Group 6, let the stage be vacated. Group 5, please proceed. Thank you so much. Now the next we have is Group 6. And people are from Maharashtra, Gujarat, DD, DNH, West Bengal, Sikkim. Meanwhile, Group 7, please assemble on my right side. Kerala, Tamil Nadu, Telangana, Karnataka, Puducherry. Group 7, please assemble on my right side. Members of Group 7, please come on stage. quickly. Come here, please. Thank you so much, Group 6. Can we all have a huge round of applause? Please proceed from the other side, sir. Thank you so much. Group 7. Yeah, thank you so much now. I want all of you to kindly be seated, please. I want everybody to kindly be seated. We have vote of thanks. I request all of you to kindly be seated, please. Can we please close the music? I request all of you to kindly settle down for the important instructions for tomorrow, because the instructions have to be floated yet. I request all of you to kindly settle down quickly.
Someone has lost the pulse.
I want all of you to kindly settle down. Well, people, I must say that this is the end of the second day. And of course, there are instructions yet to be floated to you regarding tomorrow's field visit as well. So I would like to call upon Madam by saying a few lines, ma'am. I mean, I feel so happy. Our Prime Minister, Shri Narendra Modi ji, has been talking about women-led development. And Madam is one of the true examples. Can we have a huge round of applause for the example, the women empowerment? And I've written a few lines for her. Commissioner Surya Kumari, a beacon so bright. In rural development and Panchayati Raj, she takes her flight. Passionate and dedicated, her spirit ablaze. This 3 days national level workshop, a triumphant phase. Thank you, Madam, for the impact you share. You are indeed a leader, a guide, and beyond compare. Thank you so much, Madam, and I hereby invite you for the vote of thanks.
అతిథులందరికీ శుభ సాయంత్రం నమస్తే. బిఫోర్ వి గో టు ద యాక్చువల్ ఓట్ ఆఫ్ థ్యాంక్స్, ఒక్క మాట ఆంధ్ర పార్టిసిపెంట్స్కి. నేను ఈ 2 రోజులు ఎలా కూర్చుంటారో, ఎంత ఓపికగా కూర్చుంటారో అనుకున్నాను, కానీ అప్పుడే అయిపోయిందా అనిపించేంత బాగా జరిగింది. ఎస్పెషలీ కర్నూలు టీం మొత్తం ఆశాంతం విన్నారు. విన్నది మీతోనే ఉంచుకోకుండా వెనక్కి తిరిగి వెళ్ళిన తర్వాత దయచేసి ఇక్కడికి రాలేని వాళ్ళని, ఇక్కడికి రావడానికి అవకాశం లేని వాళ్ళకి దయచేసి ఇది చెప్పండి. ఇంతకుముందు పెద్దలు మాట్లాడుతూ చెప్పారు, మీ మీద నమ్మకంతో మిమ్మల్ని గెలిపించినందుకు ఆ నమ్మకాన్ని అధికారంగా ఉపయోగించుకోకుండా మీరు ఇతరులతో కలిసి పనిచేయడం కనుక నేర్చుకుంటే మీకు బ్యాలెట్ పేపర్ మీద కాకుండా వాళ్ళ మనసులలో స్థానం దొరుకుతుంది అని. ఖచ్చితంగా మిమ్మల్ని ఎల్లవేళలా వాళ్ళు గుర్తుపెట్టుకుంటారు. అలాగే అధికారులు బెదిరింపుతో 1 or 2 రోజులు మీకు సహకరించినట్టు నటిస్తారే కానీ వాళ్ళని ఖచ్చితంగా మీరు గెలవాలంటే వాళ్ళకున్న ఇబ్బందులు ఏవైతే ఉన్నాయో వాటిని తెలుసుకొని చేస్తే బాగుంటుందని. అలాగే అడుగు వర్గాలకి ఎవరైతే మనం ఎప్పటికీ రీచ్ కాలేమో వాళ్ళ మీద ఆశాంతం దృష్టి పెట్టి మనకు ఏవైతే గోల్స్ అయిపోయినాయి అనుకుంటున్నామో, ఫర్ ఎగ్జాంపుల్ ఒక వీధి లైట్లు అన్నీ కంప్లీట్ అయిపోయినాయి అనుకుంటున్నాం, ఎస్సీ కాలనీ అలాగే ఉండిపోద్ది. జేజేఎం 100% కంప్లీట్ అయింది అనుకుంటాం, ఒక హ్యామ్లెట్ అలాగే ఉండిపోతుంది. అలా కాకోకుండా మొత్తం మీద దృష్టి సారించి, అలాగే పెద్దలు మనకి చెప్తున్నారు, ఎక్కడో ఈ ఎక్స్పోజర్ విజిట్కి చైనానో అమెరికానో రష్యానో వెళ్ళాల్సిన పని లేదు, మన పక్క ఊర్లోనే ఎంత బాగా జరుగుతుందని. మనం బాగా చేసి ఉండొచ్చు, కానీ మనకంటే బాగా వాళ్ళు ఎలా చేస్తున్నారు, మనకంటే తక్కువ వరంతో ఎలా చేస్తున్నారని. స్పెషల్ సిఎస్ రాజశేఖర్ సార్ చెప్పారు మీకు శుభవార్త, 4వ ఫైనాన్స్ కమిషన్ అయిపోయింది, కంక్లూషన్లోకి వచ్చింది, ఫండ్స్ వస్తాయని. దానికి ఇంకొద్దిగా యాడ్ చేస్తూ 15th ఫైనాన్స్ తర్వాత విడితే ఏదైతే 1000 కోట్లు రిలీజ్ కావాల్సిందో ఇవాళ మీ అకౌంట్స్లోకి చేరిపోయింది. అది కనుక త్వరగా ఖర్చు పెట్టగలిగితే ఆ తర్వాత ఇంకో 1000 కోట్లు వస్తాయి. ఈ శుభవార్త కూడా మీతో పాటు వాళ్ళకి పంచడానికి అవకాశం తీసుకొని మీ తరపుగా ఈ కాన్ఫరెన్స్ నుంచి ఏవైతే టేక్ హోమ్ పాయింట్స్ ఉన్నాయో, మంచి మాటలు ఉన్నాయో వాళ్ళది మీరు పేపర్ మీద కాకోకుండా అలవాటులో చూపించి, మొదటి నుంచి మనం చెప్పుకుంటున్నది ఒకటే, బెస్ట్ గ్రామం తీయాలంటే మా తలపోటు రావాలి. అరే అన్నీ బాగానే ఉన్నాయి, ఏది సెలెక్ట్ చేయాలి అనేటట్టు రావాలి. అవార్డు విన్నింగ్కి సెలెక్ట్ చేయాలంటే ఒక 2 గంటలు ఏది అన్నది ఎత్తుక్కుంటూ ఉండాలి. అలా అయితేనే బాగుంటుంది. ఆ పదంలో ఒకరితో ఒకళ్ళు హెల్తీ కాంపిటీషన్తో కనుక పనిచేయగలిగితే మనకి ఈ వర్క్షాప్లో వచ్చిన దానికి అర్థవంతమైన కంక్లూజన్ దొరుకుతుంది. I also thank all the participants. You will always remain in our hearts. If there is any, just now one of the participants are told, incinerators will be there but dustbins will not be there. That might be the case with us also. We might have wandered somewhere in a tiny or a major manner. Kindly forgive us. And for all the participants, tomorrow after the field visit, kindly check out whatever theory has been told here, whether it stands good or not in the field. And once you complete it, have the lunch here, you can set out to Tirumala. The transportation will be arranged right from here for each and everybody, unless you don't want to go there. I hope all the Aadhaar cards have been furnished. Whosoever wants to have a darshan there. Tambi, where are you? I thank heartfully the MOT PR team who has given us this opportunity and boosted our confidence that we are no less when compared to other states. And in fact, without patting our backs, we are filled with confidence to take further step. And what had been left over, that we will be able to complete with this peer experience. And we are all geared up, sir, to go back and deliver at our places. On behalf of all the participants, can I promise this? Thank you. Thank you so much.
Thank you so much, ma'am. And to all, would like to say that over the past 2 days, we've had the privilege of learning from esteemed experts and respected dignitaries who have shared their profound insights on our workshop's theme. The wealth of information and experience gained is sure to leave an indelible mark on our understanding. So wish you all the very best for your bright future. And for the field trip, I would like sir to... Anand sir, can we give a huge round of applause for Anand sir, who've actually been a great pillar, sir.
Thank you. Good evening all. Tomorrow we have planned field visit to nearby villages. First village name is Cherlopalli. Second village is Tondavada. Third one is Tanapalli. Fourth one is Chiguruvada. So delegates from other states, buses will be provided to you and you can proceed to respective village in the buses. And there you will be doing certain activities like visiting the Anganwadi center, village secretariat, wellness centers, and you will also be visiting Raitu Bharosa Kendra or farmer help centers kind of thing. So there, as madam was mentioning, you will also be seeing the dashboards related to various sustainable goals which we are maintaining at that level. Similarly, you will also be participating in one of the self-help group meetings and you will be interacting with the various with the villagers regarding various services being offered by village secretariat. You might be knowing that we are offering 542 services through the village secretariat system. So you will be interacting with the villagers, you will be interacting with the public representatives and you will be going through all the activities, particularly the convergence related between various departments like Panchayat Raj, medical and health, women and child welfare, and how panchayats are acting as a pivot in bringing all these departments together and delivering quality services. So this is the basic idea behind tomorrow's field visit. I repeat, buses will be provided to you. You will be taken to your respective venues. And venue in charges have also been finalized and your respective state nodal officers will give you more details. Thank you very much.
And on this note, of course, this program would not have been complete without the group photograph of the Andhra Pradesh Commissionerate team. I would like to call upon stage Andhra Pradesh Commissionerate team to kindly come on stage, please, for the group photograph. And can we all really give a huge round of applause for the team Andhra Pradesh Commissionerate, please, for organizing such a wonderful national level workshop.
For the field visit tomorrow, which participant will be going where will be informed through the liaison officer within next 2 hours, and most probably after you coming from the darshan. Thank you.
Can we all give a standing ovation to the team Andhra Pradesh? A huge round of applause. Can we all give a standing ovation? Come on, the participants from the other states and UTs. Without them, it would not have been possible for such a successful workshop. Once again, thank you so much, the dignitaries on dais and all the team of Andhra Pradesh. Thank you so much. And to all the members as well, thank you so much for your benign presence. So see you tomorrow in the field visit. और चलते चलते कहना चाहूंगी, राह संघर्ष की जो चलता है वही संसार को बदलता है, जिसने रातों से जंग जीती है आखिर सूर्य बनकर वही चमकता है. Thank you so much everybody. भारत माता की, भारत माता की, भारत माता की. Thank you.
From the Ministry of Panchayati Raj, Government of India, we also extend heartiest gratitude to all the participants as well as the Government of Telangana, Ministry of Rural Development and Panchayati Raj for extending us such a great hospitality and taking care of everything and organizing such a wonderful workshop. Thank you all.